This is Audible.
Brilliance Audio presents the unabridged recording of Travels by Michael Crichton, performed by Christopher Lane. Michael Crichton was born in Chicago in 1942. His novels include Next, State of Fear, Prey, Timeline, Jurassic Park, and The Andromeda Strain. He was also the creator of the television series ER. One of the most popular writers in the world, he has sold more than 200 million books. His books have been made into 13 films and translated into 36 languages. He died in 2008. In self-analysis, the danger of incompleteness is particularly great. One is too soon satisfied with a part explanation. Sigmund Freud. Existence is beyond the power of words to define. Lao Tzu. What you see is what you see. Frank Stella. Preface. For many years I traveled for myself alone. I refused to write about my trips, or even to plan them with any useful purpose. Friends would ask what research had taken me to Malaysia, or New Guinea, or Pakistan, since it was obvious that nobody would go to these places merely for recreation. But I did. And I felt a real need for rejuvenation, for experiences that would take me away from things I usually did, the life I usually led. In my everyday life, I often felt a stifling awareness of the purpose behind everything I did. Every book I read, every movie I saw, every lunch and dinner I attended seemed to have a reason behind it. From time to time, I felt the urge to do something for no reason at all. I conceived these trips as vacations, as respites from my ongoing life. But that wasn't how they turned out. Eventually, I realized that many of the most important changes in my life had come about because of my travel experiences. For, however tame when compared with the excursions of real adventurers, these trips were genuine adventures for me. I struggled with my fears and limitations, and I learned whatever I was able to learn. But as time passed, the fact that I had never written about my travels became oddly burdensome. If you're a writer, the assimilation of important experiences almost obliges you to write about them. Writing is how you make the experience your own, how you explore what it means to you, how you come to possess it, and ultimately release it. I found I was relieved after all these years to write about some of the places I have been. I was fascinated to see how much I could write without reference to my notebooks. There were also some episodes from medical school that I had always intended to write about. I had promised myself I would wait 15 years until they were thoroughly ancient history. To my surprise, I find I have waited long enough, and so they are included here. I have also included experiences in the realms that are sometimes called psychic or transpersonal or spiritual. I think of this as inner travel, to complement the outer travel, although that distinction between what is internal sensation and what is external stimulus often blurs in my mind. But I found the effort to disentangle my perceptions useful in a way I had not anticipated. Often I feel I go to some distant region of the world to be reminded of who I really am. There is no mystery about why this should be so. Stripped of your ordinary surroundings, your friends, your daily routines, your refrigerator full of your food, your closet full of your clothes. With all this taken away, you are forced into direct experience. Such direct experience inevitably makes you aware of who it is that is having the experience. That's not always comfortable, but it is always invigorating. I eventually realized that direct experience is the most valuable experience I can have. Western man is so surrounded by ideas, so bombarded with opinions, concepts, and information structures of all sorts, that it becomes difficult to experience anything without the intervening filter of these structures. And the natural world, our traditional source of direct insights, is rapidly disappearing. Modern city dwellers cannot even see the stars at night. This humbling reminder of man's place in the greater scheme of things, which human beings formerly saw once every 24 hours, is denied them. It's no wonder that people lose their bearings, that they lose track of who they really are and what their lives are really about. So travel has helped me to have direct experiences and to know more about myself. Many people have helped me with this book. Among those who read early versions of the manuscript and gave me comments and encouragement were Kurt Valadson, Anne-Marie Martin, my sisters Kimberly Crichton and Catherine Crichton, my brother Douglas Crichton, Julie Hallowell, my mother Zula Crichton, Bob Gottlieb, Richard Farson, Marilyn Grabowski, Lisa Plonsker, Valerie Pine, Julie McIver, Lynn Nesbitt, and Sonny Mehta. Later drafts of the text were read by the participants themselves, who offered valuable suggestions and corrections. To all these people I am grateful, as I am to my beleaguered travel agents of many years, Kathy Bowman of Worldwide Travel in Los Angeles, and Joyce Small of Adventures Unlimited in San Francisco. In addition, certain people have had a major influence on my thinking, although they do not appear much in this book. I am thinking in particular of Henry Aronson, Jonas Salk, John Foreman, and Jasper Johns. By design, I have limited the scope of this book. Freud once defined life as work and love, but I have chosen to discuss neither, except as my travel experiences impinge upon them. Nor have I undertaken to assess my childhood. Rather, it is my intention to write about the interstices of my life, about the events that occurred while what I imagined to be the real business of my life was taking place. It remains only to say that certain changes have been made to the original text. Names and identifying characteristics of physicians and medical patients have all been changed. And in later chapters, some names and identifying characteristics have been changed at the request of the individuals involved. Medical Days, 1965 to 1969. Cadaver. It is not easy to cut through a human head with a hacksaw. The blade kept snagging the skin and slipping off the smooth bone of the forehead. If I made a mistake, I slid to one side or the other, and I would not saw precisely down the center of the nose, the mouth, the chin, the throat. It required tremendous concentration. I had to pay close attention, and at the same time I could not really acknowledge what I was doing, because it was so horrible. 4 students had shared this cadaver for months, but it fell to me to cut open the old woman's head. I made the others leave the room while I worked on it. They couldn't watch without making jokes, which interfered with my concentration. The bones of the nose were particularly delicate. I had to proceed carefully, to cut without shattering these tissue-thin bones. Several times I stopped, cleaned the bits of bone from the teeth of the blade with my fingertips, and then continued. As I sawed back and forth, concentrating on doing a good job, I was reminded that I had never imagined my life would turn out this way. I had never particularly intended to become a doctor. I had grown up in a suburb of New York City where my father was a journalist. No one in my family was a doctor, and my own early experiences with medicine were not encouraging. I fainted whenever I was given injections or had blood drawn. I had gone to college planning to become a writer, but early on a scientific tendency appeared. In the English department at Harvard, my writing style was severely criticized, and I was receiving grades of C or C+ on my papers. At 18, I was vain about my writing, and felt it was Harvard, and not I that was in error, so I decided to make an experiment. The next assignment was a paper on Gulliver's Travels, and I remembered an essay by George Orwell that might fit. With some hesitation, I retyped Orwell's essay and submitted it as my own. I hesitated because if I were caught for plagiarism, I would be expelled. But I was pretty sure that my instructor was not only wrong about writing styles, but poorly read as well. In any case, George Orwell got a B- at Harvard, which convinced me that the English department was too difficult for me. I decided to study anthropology instead, but I doubted my desire to continue as a graduate student in anthropology, so I began taking pre-med courses just in case. In general, I found Harvard an exciting place, where people were genuinely focused on study and learning, and with no special emphasis on grades. But to take a pre-med course was to step into a different world, nasty and competitive. The most critical course was organic chemistry, Chem 20, and it was widely known as a screw-your-buddy course. In lectures, if you didn't hear what the instructor had said and asked the person next to you, he'd give you the wrong information. Thus, you were better off leaning over to look at his notes. But in that case, he was likely to cover his notes so you couldn't see. In the labs, if you asked the person at the next bench a question, he'd tell you the wrong answer in the hope that you would make a mistake, or, even better, start a fire. We were marked down for starting fires. In my year, I had the dubious distinction of starting more lab fires than anyone else, including a spectacular ether fire that set the ceiling aflame and left large scorch marks, a stigmata of ineptitude hanging over my head for the rest of the year. I was uncomfortable with the hostile and paranoid attitude this course demanded for success. I thought that a humane profession like medicine ought to encourage other values in its candidates. But nobody was asking my opinion. I got through it as best I could. I imagined medicine to be a caring profession, and a scientific one as well. It was so fast-moving that its practitioners could not afford to be dogmatic. They would be flexible and open-minded. It was certainly interesting work, and there was no doubt that you were doing something worthwhile with your life, helping sick people. So I applied to medical schools, took the medical college aptitude tests, had my interviews, and was accepted. Then I got a fellowship for study in Europe, which postponed my start for a year. But the following year, I went to Boston, rented an apartment in Roxbury, near the Harvard Medical School, bought my furniture, and registered for my classes. And it was at the registration that I first was confronted by the prospect of dissecting a human cadaver. As first-year students, we had scrutinized the schedule and had seen that we would be given cadavers on the first day. We could talk of nothing else. We questioned the second-year students, old hands who regarded us with amused tolerance. They gave us advice. Try and get a man, not a woman. Try and get a black person, not a white. A thin person, not a fat one. And try to get one that hadn't been dead too many years. Dutifully, we made notes and waited for the fateful Monday morning. We imagined the scene, remembered how Broderick Crawford had played it in Not as a Stranger, growling at the terrified students, "There's nothing funny about death," before he whipped the cover off the corpse. In the amphitheater that morning, Don Fawcett, professor of anatomy, gave the first lecture. There was no corpse in the room. Dr. Fawcett was tall and composed, not at all like Broderick Crawford, and he spent most of the time on academic details, how the dissections were scheduled, when the exams would fall, how the dissections of gross anatomy would be related to the lectures in microscopic fine anatomy, and the importance of gross anatomy. You can no more become a good doctor without a thorough understanding of gross anatomy than you can become a good mechanic without opening the hood of a car. But we could hardly listen to him. We were waiting for the body. Where was the body? Finally, a graduate student wheeled in a gurney. On it was a blue denim cloth and an underlying shape. We stared at the shape. Nobody heard a word Dr. Fawcett said. He moved from the podium to the body. Nobody listened. We waited for the moment when he would pull aside the cloth. He pulled aside the cloth. There was a great sigh, a great exhalation of breath. Beneath the cloth was a heavy plastic sheet. We still could see nothing of the body. Dr. Fawcett removed the plastic sheet. There was another thin white cloth beneath that. He removed this cloth. At last we saw a very pale form, limbs, a torso. But the head, hands, and feet were wrapped in gauze like a mummy. It was not easy to recognize this as a human body. We slowly relaxed, became aware that Dr. Fawcett was still talking. He was telling us details of the method of preservation, the reason for protective wrapping of the hands and face. He told us of the need for decorum in the dissection room, and he told us that the preservative, phenol, was also an anesthetic, and that it was common to experience numbness and tingling in our fingers during the dissection. This was not a dread paralysis we had caught from the cadavers. He ended the lecture. We went to the dissection room to choose our bodies. We had previously divided ourselves into groups of 4. I had given this group choice a lot of thought, and managed to link up with 3 students who all planned to be surgeons. I thought budding surgeons would be enthusiastic about the dissection, and would want to do everything themselves. With any luck, I could sit back and watch, which was my fondest hope. I didn't even want to touch the body if I could help it. The dissection room was large, and in September, uncomfortably warm. There were 30 bodies on tables around the room, all covered with sheets. The instructors refused to let us peek under the sheets to choose the bodies. We had to pick one table and wait. My group chose the table nearest the door. The instructors gave a lecture. We stood beside our bodies. The tense feelings rushed back. It was one thing to sit high up in an amphitheater while a body was shown. It was another to stand close to a body, to be able to reach out and touch it. Nobody touched it. Finally, the instructor said, "Well, let's get to work." There was a long silence. All the students opened their dissecting kits, got out their scalpels and scissors. Nobody touched the sheets. The instructor reminded us we could now remove the sheets. We touched the sheets gingerly, at the edge of the fabric. Holding our breath, we pulled the sheets back from the feet, exposing the lower half of the torso. We had a white female, but she was thin and very old. The hands and feet were wrapped. It wasn't as bad as I had imagined, although the smell of phenol preservative was strong. Our instructor told us we would begin the dissection with 2 people on each side of the body. We would begin on the leg. We could start cutting now. Nobody moved. Everybody looked at one another. The instructor said that we would have to work quickly and steadily if we hoped to keep on schedule and finish the dissection in 3 months. Then, finally, we began to cut. The skin was cold, gray-yellow, slightly damp. I made my first cut with a scalpel, slitting across the area where the thigh meets the body, and then straight down the leg to the knee. I didn't cut deeply enough the first time. I barely nicked the skin. "No," said my instructor. "Cut." I cut again, and the flesh opened, and we began scraping away the skin from the underlying tissue. That was when we began to realize that dissection was hard work, both meticulous and strenuous. You did most of it with the blunt end of a pair of scissors, or with your fingers. As the skin spread apart, what we first saw was the fat, a broad expanse of yellowish tissue surrounding everything we wanted to see. In the heat, the fat was slippery and runny. When we stripped away this layer, we found the muscles enclosed in a milky cellophane-like covering. This was the fascia. It was strong and resilient. We had trouble cutting through it to the muscle beneath. The muscles looked like what you'd expect, reddish, striated, bulging in the middle and tapering at the ends. The arteries were easy. They'd been injected with red latex. But we had no idea what the nerves looked like until the instructor came over and found one for us. White, tough, cord-like. The afternoon wore on and took on aspects of a nightmare. Everybody working, sweat dripping down our faces, the smell pungent and indescribable. The unwillingness to wipe the sweat away because you'd only coat your face with phenol. The sudden horrified discovery that a bit of flesh had been flicked away and landed, sticking to your face. The ghastly drabness of the room itself, bare, hot, institutional gray. It was a cheerless, exhausting experience. Just the names we had to learn were difficult enough. Superficial epigastric artery, superficial external pudendal artery, pectineal fascia, anterior superior iliac spine, ligamentum patelli. All in all, 40 different structures that had to be memorized for the first day alone. We worked until 5, and then sutured the incision, squirted liquid over it to keep it moist, and left. We hadn't managed to finish the dissection, as outlined in the lab manual. At the end of the first day, we were already behind. Nobody could eat much at dinner. The second-year students regarded us with amusement, but we weren't making many jokes in the early days. We were all struggling too hard to handle the feelings, to do it at all. The autumn heat wave continued, and the dissection room became extremely hot. The fat deposits melted, smells were strong, everything was greasy to the touch. Sometimes the doorknob was so greasy that we had trouble turning it when we departed at the end of the day. Even when maggots got into one cadaver, causing the instructors to run around the room with fly swatters, nobody made jokes. It was hard work. We were just trying to do it. The weeks passed. The heat wave continued. We were under terrific pressure to keep pace with the dissection, not to fall behind. The first anatomy exams were getting closer. 2 afternoons a week we worked in the dissection rooms, and again on weekends if we had to catch up. We began to make sour, grim jokes. One joke made the rounds. A professor of anatomy addresses a woman in the class. "Miss Jones, will you name the organ of the body that increases 4 times in diameter under stimulation?" The woman becomes embarrassed, hems and haws. "There's no need to be embarrassed, Miss Jones. The organ is the pupil of the eye. And you, my dear, are an optimist." After the first anatomy exam, I got a letter in the mail. "Dear Mr. Crichton, although your performance on the recent gross anatomy exam was satisfactory, you were sufficiently close to the borderline that it will be to your advantage to talk to me sometime in the near future, at your convenience. Yours sincerely, George Erickson, Professor of Anatomy." Panic. A cold sweat. I was shaken. Then at lunch I discovered that lots of other people had received letters too. In fact, almost half the class. I went to see Dr. Erickson that afternoon. He didn't say much, just some encouragement, some hints at memorization. "Talk to yourself," he said. "Say things out loud. Pair up and quiz each other." Pretty soon everyone in the anatomy lab was talking out loud, repeating mnemonics to help them remember. S234 keeps your rectum off the floor. That told you where the nerves to the levator ani muscle originate in the 2nd, 3rd, and 4th sacral segments. St. George Street, for the order of muscles inserting around the knee. The zebra bit my cock, for the branches of the facial nerve, temporal, zygomatic, buccal, mandibular, cervical. My lab partner developed a new one, Teetonom. 2 eyes, 2 ears, 1 nose, 1 mouth. They quizzed us constantly, calling us doctor even though we were first-year students. One instructor came in and threw up an X-ray of a skull. I'd never seen one before. A skull X-ray is incredibly complex. "All right, Dr. Crichton, what would you say this is?" He pointed to a whitish area on the film. It was near the face and horizontal. "The hard palate?" "No, that's down here." He pointed to another horizontal line, a little below. I tried again, and suddenly it came to me. "The inferior border of the orbit." "Right." It was a great feeling. Then he said, "How about this?" A small hook-shaped thing near the middle of the skull. That was easy. "The sella turcica." "Containing?" "The pituitary." "What is just lateral to it?" "The cavernous sinus." "Containing?" I rattled it off. "The curving internal carotid artery and the ocular nerves 3, 4, and 6, and 2 branches of the trigeminal nerve, the ophthalmic and the maxillary." "And this dark space just below?" "The sphenoid sinus." "And why is it dark?" "Because it contains air." "Right. Now then, Dr. Martin." And he turned to another member of the group. I thought, I'm getting it. I'm finally beginning to get it. I was excited. But at the same time, the pressure was building. Every day, building. The jokes got worse. One guy wrote Al's Body Shop on the back of his anatomy lab coat. And the cadavers began getting names. The Jolly Green Giant, the Thin Man, King Kong. Ours had a name, too. Lady Brett. After 2 months, on a day when the instructors were out of the room, several people played football with a liver. "He's going out. He's deep in the end zone. The ball is in the air, and touchdown!" The liver flew through the air. A few students pretended to be horrified, but nobody really was. We had by now dissected the legs, and the feet had been unwrapped. We had dissected the arms, the hands, and abdomen. We could see that this was a human body, a dead person laid out on the table before us. We were continuously reminded of what we were doing. We could see the form clearly. There was no way to get the necessary distance, to detach, except to be outrageous and disrespectful. There was no way to survive, except to laugh. There were certain jobs in the dissection that nobody wanted to do. Nobody wanted to cut the pelvis in half. Nobody wanted to dissect the face. Nobody wanted to inflate the eyeballs with a syringe. We portioned out these jobs, argued over them. I managed to avoid each of these jobs. "Okay, Crichton, but then you have to section the head." "Okay. You remember now." Yeah, I'll remember." The head was in the future. I'd worry about it when I got there. But the day finally came. They handed me the hacksaw. I realized I had made a terrible bargain. I had waited, and now I was stuck with the most overt mutilation of all. To divide the head along the mid-sagittal plane, to cut it in half like a melon so we could see inside, inspect the cavities, the sinuses, the passages, the vessels. The eyes were inflated, staring at me as I cut. We had dissected the muscles around the eyes, so I couldn't close them. I just had to go through with it, and try to do it correctly. Somewhere inside me, there was a kind of click, a shutting off, a refusal to acknowledge in ordinary human terms what I was doing. After that click, I was all right. I cut well. Mine was the best section in the class. People came around to admire the job I had done, because I had stayed exactly in the midline, and all the sinuses were beautifully revealed. I later learned that this shutting off click was essential to becoming a doctor. You could not function if you were overwhelmed by what was happening. In fact, I was all too easily overwhelmed. I tended to faint when I saw accident victims in the emergency ward, during surgery, or while drawing blood. I had to find a way to guard against what I felt. And still later I learned that the best doctors found a middle position where they were neither overwhelmed by their feelings nor estranged from them. That was the most difficult position of all, and the precise balance, neither too detached nor too caring, was something few learned. At the time, I resented the fact that our education seemed to be as much about emotions as about the factual content of what we were learning. This emotional aspect seemed more like hazing, like a professional initiation than education. It was a long time before I understood that how a doctor behaved was at least as important as what he knew. And certainly I did not suspect that my complaints about medicine would eventually focus almost entirely on the emotional attitudes of the practitioners, and not their scientific knowledge. A good story. The first part of a student's clinical work involves interviewing patients with various diseases. The resident on the floor says, "Go see Mr. Jones in room 5, he has a good story," meaning that Mr. Jones can give a clear history for a specific disease. Off you go to find Mr. Jones, take his history, and diagnose his illness. For a student beginning work in a hospital, there is considerable tension in interviewing patients. You're trying to act professional, as if you know what you're doing. You're trying to make the diagnosis. You're trying not to forget all the things you're supposed to ask, all the things you're supposed to check, including incidental findings. Because you don't want to come back to the resident and say, "Mr. Jones has a peptic ulcer," only to have the resident say, "That's true, but what about his eyes?" His eyes? Yes. His eyes. Did you check his eyes? Sure, yes. Notice anything about them? No. You didn't notice his left eye is glass? Oh, that. To avoid these embarrassments and to make the job easier, all students quickly learned certain interviewing tricks. The first trick was to get someone to tell you the diagnosis, so you wouldn't have to figure it out for yourself. Knowing the diagnosis took a lot of the pressure off an interview. If you were especially lucky, the resident himself would let it slip. "Go see Mr. Jones in room 5, he has a good story of peptic ulcer." Or you could throw yourself on the mercy of the nurses. "Where's Mr. Jones?" "Peptic ulcer? Room 5. Then there might be relatives in the room when you arrived. They were always worth a try. "Hello, Mrs. Jones, how are you today?" "Fine, doctor. I was just talking with my husband about his new ulcer diet when he goes home." And, finally, the patients generally knew their diagnoses, and they might mention it, particularly if you walked in, sat down, and said heartily, "Well, how are you feeling today, Mr. Jones?" "Much better today." "What have the doctors told you about your illness?" "Just that it's a peptic ulcer." But even if the patients didn't know their diagnoses, in a teaching hospital they had all been interviewed so many times before that you could tell how you were doing by watching their responses. If you were on the right track, they'd sigh and say, "Everybody asks me about pain after meals," or "Everybody asks me about the color of my stools." But if you were off track, they'd complain, "Why are you asking me this? Nobody else has asked this." So you often had the sense of following a well-worn path. But even if you figured out the diagnosis, there was always an exciting uncertainty about interviewing patients. You never knew what would happen. One day the resident said, "Go see Mrs. Willis, room 8. She has a good story of hyperthyroidism." I walked down the hallway thinking, hyperthyroidism. What do I know about hyperthyroidism? Mrs. Willis was a thin 39-year-old woman sitting up in bed, chain-smoking. Her eyes were bulging. She was edgy and appeared unhappy. Her dark tan highlighted the many slashing scars on her arms and face, presumably the result of a bad automobile accident. I introduced myself and started to talk to her, focusing on thyroid questions. The thyroid regulates general body metabolism, and it affects skin, hair, voice, temperature, weight, energy, and mood. Mrs. Willis gave me all the right answers. She couldn't gain weight no matter how much she ate. She was always hot and slept with the covers off. She had noticed that her hair was brittle. Yes, everybody had asked her these things. She was quick and impatient in her responses. She often seemed on the verge of tears. I asked about her suntan. She told me she had been staying with her sister in Alabama. It was all right because her sister's apartment was air-conditioned. She had been with her sister in Alabama for 3 months. Now she was back in Boston. Why was she in the hospital? For my thyroid, it's too high. What had brought her to the hospital? A shrug. I came and they say I had to stay because of my thyroid. How did you get the scars on your arms? Those are cuts. Cuts. From a knife, most of them. This one here's glass. The scars seemed to be of different ages, some recent, some older. Yes, this one is about 5 years old. The others are newer. How did they happen? My husband. Your husband? I proceeded cautiously. She seemed close to tears now. He cuts me when he's, drinking. How long has this been going on, Mrs. Willis? I told you 5 years. Is that why you went to your sister's? She says I should call the police. And have you? Once. They didn't do anything. They came and told him to stop it, is all. He was mad after that. And she burst into great sobs, her whole body shaking, tears streaming down her face. I was confused. Emotional lability is characteristic of hyperthyroidism. Patients frequently burst into tears. But this woman appeared to have been seriously abused by her husband. I talked to her some more. She had initially come to the hospital because of her wounds. The doctors had admitted her for hyperthyroidism, but that was clearly an excuse to get her away from her violent husband. She was safe enough in the hospital, but what would happen once she was discharged? Has anybody talked to you about your husband? A social worker or anybody like that? No? Do you want somebody to talk to about your husband? Yes. I said I would arrange it, and I left, filled with outrage. In those days, physical abuse within a family was not really acknowledged. Everyone pretended that wives and children weren't beaten. There were no laws, no government agencies, no homes, no mechanisms at all to assist these people. I felt strongly the injustice of this situation and this woman's dangerous isolation, sitting alone in a hospital bed, waiting to be sent home to her husband, who would stab her again. Nobody was doing anything about it. The doctors might be treating her thyroid, but nobody was dealing with the real life-threatening problems she faced. I went back to the resident. Listen, did you see Mrs. Willis's wounds? Yes. Those are knife wounds. Yes, some of them. He seemed calm. Well, here we are treating her hyperthyroidism, and it seems to me she has a much bigger problem. All we can treat is her hyperthyroidism, the resident said. I think we can do more. We can take steps to keep her away from her husband. What husband? Mrs. Willis's husband. She doesn't have a husband. What did she tell you? I told him the story. Listen, he said. Mrs. Willis was transferred here from a private sanatorium in Alabama. Her family is well-to-do, but her husband divorced her years ago. She's been in and out of institutions for a decade. All those cuts are self-inflicted. Oh. The resident said, Did you ask her whether she'd ever been in any mental institutions? No? Well, you should have asked. She's not that crazy. She'll tell you if you ask. Another time, the resident said, "Go see Mr. Benson. He has a good story of duodenal ulcer." I went to see Mr. Benson, first stopping at the foot of his bed to read his chart. This was another trick. The bedside chart contained only nurses' notes on fluid intake, things like that, but it could still be helpful. Also, it made you look professional if you came in and read the chart first. "Ah, Mr. Benson, I see you're in your second day of recovery from surgery." Thinking that if he had had surgery for his ulcer, it must have been severe. "Yes. And putting out good urine, I see?" "Yes." "How are you feeling? Any pain?" "No." I thought, just 2 days after surgery and no pain? "Well, you're making an unusual recovery." "No." For the first time, I really looked at him. He was sitting in bed wearing a bathrobe, a small, precise, tense man of 41. He had the detached look that many post-operative patients have when they turn their focus inward to heal. But it was different in his case somehow. "Well," I said, "tell me about your ulcer." Harry Benson spoke in a flat, depressed voice. He was an insurance adjuster from Rhode Island. He had lived with his mother all his life. She was sick and needed him to take care of her. He had never married and had few friends outside work. He had had severe ulcer pains for the last 5 years. Sometimes he vomited blood, sometimes a lot of blood. He had been in the hospital 6 different times for this pain and blood. He had had several transfusions for blood loss. He had had a barium swallow that showed the ulcer. The doctors told him last year that they would have to do surgery if the medication didn't heal the ulcer. The bleeding continued, so he came back to the hospital and underwent surgery 2 days ago. That was his story. As the resident promised, it was a classic story, and after so much medical attention, Mr. Benson told it clearly. He even knew physician's jargon like barium swallow for an upper GI series. But why was he so depressed? "Well, given your history, you must be glad to have the operation over with." "No." "Why not?" "They didn't do anything." "What do you mean?" "They opened me up, but they didn't do anything. They didn't do the operation." "Mr. Benson, I don't think that's right. They did an operation to remove part of the stomach." "No. They were going to do a partial resection, but they didn't. They took one look and then closed me up again." And he burst into tears, holding his head in his hands. "What have they told you?" He shook his head. "What do you think is wrong?" He shook his head. "You think you have cancer?" He nodded, still sobbing. "Mr. Benson, I don't think you do." He had no swollen glands, no history of weight loss, no pain in other parts of his body. And I was pretty sure they wouldn't send a student to talk to somebody who had just found out he had inoperable cancer. "Yes," he insisted. "It's carcinoma." He was so upset I felt I had to do something immediately. "Mr. Benson, I'm going to check on this right away." I went back to the nursing station. The resident was hanging around. I said, "You know, Benson, did they do a gastric resection?" "No, they didn't." "Why not?" "When they opened him up, his blood pressure went to hell, and they decided they couldn't go through with the procedure. They just closed him up as fast as they could." "Did anybody tell him that?" "Sure, he knows." "Well, he thinks he has cancer." "Still?" "That's what he thought yesterday." "Well, he still thinks it." "He's been told specifically," the resident said, "that he does not have cancer. I told him, the chief resident told him, his own doctor told him, and the attending surgeon told him. Everybody's told him. Benson's a weird guy, you know. Lives with his mother." I went back to Mr. Benson. I said I'd checked with the resident, and he did not have cancer. "You don't have to kid me," he said. "I'm not kidding you. Didn't the chief resident and the other residents come to see you yesterday?" Yes. And did they tell you you didn't have cancer? Yes, but I know. They won't tell me to my face, but I know. How do you know? I said. I heard them talking when they thought I wasn't listening. And they said you have cancer? Yes. What did they say? They said I had nodes. What kind of nodes? Aerial nodes. There was no such thing as aerial nodes. Aerial nodes? That's what they called them. I went back to the resident. I told you he was weird, the resident said. Nobody ever said anything about nodes to him, believe me. I can't imagine how he... Wait a minute. He turned to the nurses. Who's in the bed next to Benson? Mr. Levine, post-cholecystectomy? But he's new today. Who was in that bed yesterday? Geez, yesterday... Nobody could remember who had been in the bed the day before. But the resident was insistent. Records were pulled and checked. It took another half-hour, and still more talks with Benson, before the story finally became clear. On the day after his operation, Mr. Benson, worried that no surgery had been performed, had feigned sleep while the residents made rounds. He had listened to what they said, and he heard them discussing the patient in the next bed, who had a cardiac arrhythmia involving the sinoatrial nodes of the heart. But Mr. Benson thought they were talking about him and his aerial nodes. And he had been in enough hospitals to know that nodes meant cancer. And that was why he was so sure he was dying. Everybody went back and talked to him, and he finally understood that he did not have cancer after all. He was very much relieved. Everybody went away. I was alone with him. He beckoned to me. Hey, listen, thanks, he said, and he gave me $20 in cash. Really, that's not necessary, I said. No, give it to that guy Eddie in room 4, he said. And he explained that Eddie was a bookie, and he was placing bets for everybody on the floor. Put it on fresh air in the 6th, he said. That was the first sign that Mr. Benson was on the road to recovery. Go see Mr. Carey in room 6. He has a good story for glomerulonephritis, the resident said. My elation at being told the diagnosis was immediately tempered. In fact, the guy's probably going to die. Mr. Carey was a young man of 24, sitting up in bed playing solitaire. He seemed healthy and cheerful. In fact, he was so friendly, I wondered why nobody ever seemed to go into his room. Mr. Carey worked as a gardener on an estate outside Boston. His story was that he had had a bad sore throat a few months before. He had seen a doctor and had been given pills for a strep throat, but he hadn't taken the pills for more than a few days. Sometime later he noticed swelling in his body and he felt weak. He later learned he had some disease of his kidneys. Now he had to be dialyzed on kidney machines twice a week. The doctors had said something about a kidney transplant, but he wasn't sure. Meanwhile, he waited. That was what he was doing now, waiting. He was my age. I talked to him with a growing sense of shock. In those days, kidney dialysis was still exotic treatment, and kidney transplantation more exotic still. The statistics were not encouraging. If the transplant worked at all, the average survival was 3 to 5 years. I was talking to a doomed man. I didn't know what to say. For a while we talked about the Celtics, about Bill Russell. He seemed happy to discuss sports, glad to have me there. But all I wanted to do was run from the room. I felt panicky. I felt I was suffocating. What could I do here? I was a medical student faced with somebody who was going to die, just as surely as the basketball season would end in a few weeks. It was inevitable. It didn't seem like there was anything I could say. Meanwhile, he seemed so pleased to talk to me. I wondered how much he knew. Why was he so calm? Didn't he know his situation? He must know. He must be aware that he might not walk out of this hospital again. Why was he so calm? Just talking away, sports, baseball season, spring training. Eventually, I couldn't stand it. I had to leave. I had to get out of that room. I said, "Well, I'm sure you'll be up and around in no time." He looked disappointed. "What I mean is," I said, "you're definitely on the mend. You'll probably be out of here in a week or so." He looked very disappointed. I was saying the wrong things. But what should I be saying? I had no idea. "So, cheer up. I'm sure they'll be arranging for you to leave any day now. I've got to go now. Rounds, you know." He looked at me with open contempt. "Sure. Fine." I fled, closing the door behind me, blocking out the view of this man my own age who was close to death. I went back to the resident. "What are you supposed to say to someone like that?" "That's a tough one," the resident said. "Does he know?" "Yeah, sure." "So what do you say?" "I never know what to say myself. It's a bitch, isn't it?" In retrospect, it seems inconceivable to me that in 4 years of medical education, nobody ever talked to us, formally or informally, about dying patients. Arguably, the most important item on any medical curriculum, death was never even mentioned at the Harvard Medical School. There was no consideration given to how we might feel around a dying person. The panic, the fear, the sense of our own failure, the uncomfortable reminder of the limits of our art. There was no consideration of what a dying patient went through, what such a patient might need or want. None of this was ever discussed. We were left to learn about death on our own. When I think back, I imagine the horrible isolation that young man must have felt, sitting day after day in a room that nobody wanted to enter. Finally, some poor medical student comes in, and this young man has a brief chance to talk to another human being, and he's delighted. He would like to talk about what is really going on in his life. He's worried about what will happen to him. He wants to talk, because unlike me, he can't avoid the realities. I can run from the room, but he can't. He is stuck with the fact of his impending death. But instead of talking about it, instead of having the strength to stay with him, I merely mumbled platitudes and fled. It was no wonder he finally regarded me with contempt. I wasn't much of a doctor. I was far more worried about myself than about him, but he was the one who was dying. I was still pretending that I was somehow different, that he wasn't like me, that it would never happen to me. The Gourd Ward. 4 o'clock in the morning, and I am stumbling around in the closet of my apartment in the darkness, trying to find everything I'm supposed to bring. My stethoscope and my doctor's bag and my notebook and everything else, because finally the day has come when I am no longer working part-time in the hospitals pretending to be a doctor. My clinical rotations begin today. From now on, I will work every day and every other night in the hospital. I am tremendously excited and nervous, and I keep dropping things in my closet. At last I have everything, but I can't find my car keys. It is 5 a.m. I'm going to be late for my first clinical rotation, neurology at the Boston City Hospital. The old brick buildings of the Boston City look more like a prison than anything else. I found the parking lot and made my way through the basement corridors to the correct building. I said good morning to the elevator operator. "Hiya, Doc," the operator said in a deep voice. His name tag read Benny, and he was acromegalic, 6.5 feet tall and easily 300 pounds, with long arms, thick fingers, and a long nose and chin. "I'm going to neuro," I said. Benny grunted and closed the rattling cage door. The ancient elevator started up. "Nice weather," I said. Benny grunted again. "Worked here long?" "Since I was a patient." "That's nice." Did an operation on me. I see. In my head. Uh-huh. Your floor, Doc, Benny said, opening the cage door. I went onto the floor. The first view of the neurology ward was startling. There were patients sitting in chairs, writhing in snake-like movements known as choreoathetoid. There were patients strapped in chairs, staring forward into space, drooling. There were patients lying in beds, groaning from time to time, distant screams of pain. It was like something from the 18th century, from Bedlam. I was going to spend the next 6 weeks here. I headed for the nurse's station to report in. I passed a large man sitting up in bed with the sheets pulled to his chin. "Hey, Doc." "Good morning," I said. "Hey, Doc, can you help me?" Just to make sure I did, he gripped my arm powerfully. He was a very large man. He had hands like slabs of meat. Beneath a grizzled crew cut, his face was scarred. He looked dangerous. He glared at me. "Nobody's helping me around this joint," he said. "Gee," I said. "Will you help me, Doc?" "Sure," I said. "What's the problem?" "Take my shoes off for me." He nodded toward the foot of the bed where his feet stuck up under the sheets. I wondered why he was wearing shoes in bed, but he was so big and fierce it didn't seem worth asking. "No problem," I said. He released my arm, and I walked to the foot of the bed. I lifted up the sheet. I saw 2 large bare feet, 10 toes, or actually 9 because 1 big toe was missing. There was just a dark stump. I looked back at the man's face. He was watching me carefully, glowering. "Go ahead," he said. "What did you want me to do again?" I asked. "Take off my shoes." "Are you wearing shoes?" "You can see 'em right in front of you," he shouted angrily. I pulled the sheet back so he could see his own bare feet, but he just nodded. "Well, go ahead." "You mean these shoes here?" I pointed to his bare feet. "Yeah, the shoes on my feet. What, are you blind?" "No," I said. "Tell me, what kind of shoes are these?" "Just take 'em off." He seemed so volatile. I had no idea what was wrong with him or how to proceed. I decided I would go along with him. I pantomimed taking his shoes off. "Jesus!" he shouted, groaning. "What's the matter?" "Don't you know nothing? Unlace 'em first." "Oh, sorry." I pretended to unlace the shoes. "Better?" "Yeah, Jesus." I pretended to remove the first shoe and then the second. He sighed and wiggled his toes. "Oh, that's better. Thanks a lot, Doc." "Don't mention it." I was eager to get away. I started off to the nursing station. "Hey, not so fast." He grabbed me again. "Where do you think you're going?" "To the nursing station." "With my shoes?" "Sorry." "Sorry, hell. I wasn't born yesterday. You leave 'em right here." "Okay. There, is that okay?" "Gotta watch you guys every minute." Then his expression abruptly changed. He looked down at the sheets. He became panicky, frightened. "Hey, Doc, can you help me?" "What is it now?" "Just get that spider off the sheet, okay? Both them spiders, you see 'em there?" "Have you been seeing spiders?" "Oh yeah, lots of 'em, especially last night. They're all over the walls." He was an alcoholic in the midst of the DTs. I said, "I gotta go to the nursing station." He grabbed my arm again and pulled his face close to mine. "I'm not touching those spiders anymore." "Good idea," I said. "I'll be back later." He released me. I went to the nursing station. There were some nurses and a pinched-faced man of 31 who was incredibly turned out, sharp creases in his trousers and jacket, pressed tie, immaculate haircut. He glanced at his watch. "Dr. Crichton, or should I say Mr. Crichton? I'm Donald Rogers, the visiting chief resident in neurology, and you're late. When I say I want you here at 6, I mean 6 and not 6:03. Is that understood, mister?" "Yes, sir," I said. That was how my rotation in neurology began. It never got better. Clinical neurology is basically a diagnostic specialty, since relatively few severe neurological disorders can be treated. The clinical neuro ward at the Boston City reflected that depressing state of affairs. In essence, cases were admitted simply so the young doctors could see them. The 37 patients on the floor all had different diseases. The staff never admitted a patient to the floor if there was already one with the same disease. It wasn't a hospital ward. It was a museum. Most people referred to it as the squash court or the gourd ward. But we pretended it was a normal hospital floor with treatable patients. We did all the regular hospital things. We made rounds, we drew bloods, we ordered consults and diagnostic tests. We carried out the charade with great precision, even though there was little we could do for anybody. Besides myself as the sole medical student, there was an intern named Bill Levine from New York, a first-year resident named Tom Perkins, and Dr. Rogers, the visiting chief resident. He was a Southerner from Duke who did everything by the book. Rogers was always immaculately turned out. His presentation, as he called it, was awe-inspiring. One day Levine, who loathed Rogers, asked him about his ties. "You like these ties?" Rogers asked in a soft Southern accent. "Well, I was wondering how you managed to keep them so smooth and unwrinkled, Don." "My wife does that. She irons them." "Does she?" "Yes. She gets up with me at 5 in the morning, and after I've dressed and tied my tie, she irons it for me. While I'm wearing it, she does that." "No kidding," Levine said. "Yes, she's okay," Rogers said. "Only once she scorched my shirt, and then I had to get dressed all over again. But she's never done that again." "No, I'll bet," Levine said. "No, she learned a lesson that time," Rogers said, chuckling. Rogers was a bit of a sadist. He kept a series of straight pins in the lapel of his jacket near the buttonhole. On rounds, he liked to stick these pins into the patients, to check their responses. There was a kind of insane pretense in all this. None of the patients were getting any better. None of them were changing at all, from day to day or week to week, except for the 2 who had inoperable brain tumors. They were slowly dying. But no one else was changing at all. The patients were indigent, extremely ill patients who were shuttled from one state institution to another. As we made rounds each morning, there wasn't really that much to discuss, but Rogers stuck pins into them anyway. Levine had to spend only a month of his internship rotation on the ward. Levine was a heavy-set, smiling guy of 25 who was almost bald. A warm-hearted soul, he despised Rogers and the ward. He expressed his distaste by lighting a joint every morning before rounds. I didn't find out about this until the second day. I passed by the men's room, smelled the smoke, and went inside. "Bill, what are you doing?" "Having a toke," he said, sucking in his breath. He passed the joint to Perkins, the resident, who took a long drag, then held it out to me. I pushed it away. "Are you kidding? What are you doing?" It was 6:30 in the morning. "Hey, suit yourself." "You mean you guys are stoned on rounds?" "Why not? Nobody can tell." "Sure they can." "You couldn't tell yesterday. And you think Pinhead can tell?" Pinhead was what Levine called Rogers. "Hey, relax," Levine said, taking a deep drag. "Nobody cares. Half the nurses are loaded too. Come on. This is great stuff. You know where we get it? Benny." "Benny?" "Benny. You know, in the elevator." It was the medical student's job to draw bloods from the patients daily. Every morning I would show up at 6 a.m. and go to the nursing station, and the night resident would read off the list of bloods to be drawn for the day. So many red tops for Mr. Roberti, a red and a blue from Mr. Jackson, a pink and a blue from Mrs. Harrelson, and so on. I had to draw about 20 tubes of blood in half an hour to be ready for morning rounds at 6:30. The only trouble was, this was my first clinical rotation, and I hadn't ever really drawn blood before. And I tended to pass out at the sight of blood. In practice, I'd go to my first patient, put on the tourniquet, get the vein to puff up, and try to get the needle in without passing out. Then, when the blood gushed, I'd stick on the vacutainer tubes and get the required number of tubes, breathing deeply. By this time, I would be very dizzy. I would quickly finish up, pull out the needle, slap a cotton ball on the elbow, dash to the nearest window, throw it open, and hang my head out in the January air, while the patients yelled and shouted at me about the cold. When I felt okay again, I'd go on to the next patient. I couldn't do 20 patients in half an hour. I was lucky to do 3 patients in half an hour. Fortunately, I got help. The first day, I went up to a huge black man named Steve Jackson. He could tell I was nervous. "Hey, man, what are you doing?" "Drawing blood, Mr. Jackson." "You know what you're doing, man?" "Sure, I know what I'm doing." "And how come your hands are shaking?" "Oh, that. I don't know." "You ever draw blood before?" "Sure, no problem." "'Cause I don't want nobody fucking with my veins, man." And with that, he snatched the needle out of my hands. "What you want, man?" he said to me. "Some blood?" "I mean what? What tubes?" "Oh, a red top and a blue top." "Give me the tubes, come back later, you got it." And he put the tourniquet in his teeth, tied off his arm, and proceeded to draw the blood from himself. Now I understood. Jackson was an addict and didn't want anybody poking around in his veins. So from then on, every morning I'd just drop the stuff off at his bed. "Yellow and a blue top today, Steve." "You got it, Mike." And I'd go on to the next patient. The patient alongside Steve was unconscious most of the time. Steve watched me fumble to get the blood, and I guess it offended his sense of finesse. So he said he'd draw blood from himself and from Hennessy, too. The nurses took pity on me, and they helped out and drew a couple of tubes for me. And Levine, if he had been on call the night before, would draw a couple of tubes for me. And as the days passed, I didn't have to hang my head out the window quite so long each time. So, with everybody's help, I was eventually able to get the job finished by the start of rounds. "Nice to see you on time for once, Mr. Crichton. Seems you make a major production out of drawing a little blood." I started to hate Rogers, too. In this way, the weeks dragged on, the medical student passing out whenever he drew blood, the residents stoned on rounds, and Rogers sticking pins in everybody while we looked away. And always the patients drooling and writhing in the corners, the alcoholics brushing off invisible ants and spiders. It was a kind of loony nightmare, and it took its toll. Finally, the house staff had a party one night, and everybody got drunk on lab alcohol. Around midnight, we decided it would be amusing to draw bloods on ourselves and send them in for liver function tests. We used patient names and sent them off. The next morning, the nurses were puzzled. "I don't get it. Mr. Hennessy has sky-high LFTs. So does Mr. Jackson. And their blood alcohols. This can't be right. Who ordered these tests, anyway? It's not in the books." "Oh, those tests," Levine said, very pink-eyed. "I remember. I'll take those." And he passed the slips around to us. It turned out we all had evidence of acute liver damage, and we certainly had roaring hangovers. "Ready for rounds?" Rogers said briskly. He was greeted with a chorus of groans. Come, we're already 4 minutes late." We started off. Rogers was in an unusually cheerful mood. He stuck lots of pins into people. Finally, he came to Mrs. Lewis. In the ward, Mrs. Lewis's bed was always curtained off, because this elderly woman was semi-comatose and incontinent, and from time to time she threw her excrement in spastic movements. There was always a slight feeling of danger when we went up to Mrs. Lewis's bed, and this morning, with hangovers, we weren't looking forward to it. But her bed was clean, and there was no smell. Mrs. Lewis seemed to be sleeping. "She seems to be sleeping," Rogers said. "Let's just see how responsive she is today." And he stuck a pin in her. The poor comatose woman winced. There seems to be a little response," Rogers said. He put his pins back in his lapel and pressed his thumb over the bony ridge just below Mrs. Lewis's eyebrow. He pressed hard. "This is a classic way to elicit a pain response," he explained. Mrs. Lewis twisted her body in pain, and her hand went beneath her buttocks, and quickly she slapped a handful of her own feces all over Rogers's shirt and pressed tie. Then she collapsed back on the bed. "Dear," Rogers said, turning white. "That's a shame," Levine said, biting his lip. "She obviously doesn't know what she's doing," Perkins said, shaking his head. "Mr. Crichton, see that she's cleaned up. I'm going to try and change. But I don't have a change of clothes at the hospital. I may have to go home." "Yes, sir," I said. So I helped clean up Mrs. Lewis, and I blessed her. And not long after that I rotated off the neurology service and went on to psychiatry, where I hoped things would be better. The Girl Who Seduced Everybody. 3 medical students at a time were assigned a psychiatry rotation on the wards of the Massachusetts General Hospital. It was a communal living ward. 15 psychiatric patients slept and ate in a dormitory setting for 6 weeks. After 6 weeks, the staff made a diagnosis and recommended further therapy for each patient. The resident explained the whole procedure. As students, we would each be assigned 1 patient to interview over 6 weeks. We would then make a report to the staff and participate in the diagnosis. Other physicians would be interviewing the patients too, but we would see them more often than anyone else, and our responsibilities were therefore to be taken seriously. When we arrived on the floor, the patients were in the midst of a communal meeting. The resident couldn't interrupt the meeting, but we stood outside the room while he pointed out our patients. Ellen's patient was a heavy-set woman in her 50s who wore garish clothes and makeup. This woman had had an affair with a doctor who gave her amphetamines, and she was now severely depressed. Bob was assigned a thin, scholarly-looking man of 50 who had been in Dachau and who now imagined cardiac problems. I was assigned a tall, strikingly beautiful girl of 20 with short blonde hair and a miniskirt. She sat in a rocking chair, her long legs curled under her, looking very calm and composed. She looked like a college student. "What's her problem?" I said. "Karen," he said, "has successfully seduced every man she has ever met." During the psychiatry rotation, you saw your patient 3 times a week. You also saw a training analyst twice a week to discuss your case and your feelings about it. Robert Geller was my training analyst. Dr. Geller was a middle-aged man who had a beard and favored bright striped shirts. His manner was very quick and direct. Dr. Geller asked me what I hoped to get out of my psychiatry rotation, and I said I was very interested in psychiatry, that it was something I thought I might end up doing. He said that was fine. He seemed a neutral, balanced person. "So do you know anything about your patient?" Yes, I did. I explained I hadn't had a chance to talk to her yet, that I had only just seen her in the room, a 20-year-old girl sitting in the rocking chair. "And?" "She seemed nice, pretty. She certainly didn't seem like a psychiatric case." "Then what's she doing there?" Well, the resident told me that she had successfully seduced every man she had ever met. What did he mean by that? I hadn't asked. Really? I would have asked, Dr. Geller said. I explained I just hadn't thought to ask. I was trying to absorb everything, just seeing her and so on. And how do you feel about seeing her? I don't know, I said. You don't know? No. You said she was beautiful. Attractive, yes. What did you think about having her as your patient? I guess I wondered if I could handle her. Handle her? This was a psychiatrist's trick, repeating your last phrase to keep you talking. Yes, I said. I wondered if I would be able to handle her case. Why shouldn't you be able to handle her? I don't know. Well, just say whatever comes to mind. This was another psychiatrist's trick. I was immediately on my guard. Nothing comes to mind, I said. Dr. Geller gave me a funny look. Well, he said, are you afraid you won't be bright enough to deal with her? Oh, no. No problem there with brightness. No. Are you afraid you don't have enough knowledge to help her? No. Are you afraid you're so busy you won't be able to devote enough time to her? No, no. Then what? I shrugged. I don't know. There was a pause. Are you afraid you're going to fuck her? I was profoundly shocked. The statement was so coarse and direct. I didn't know how he could even imagine such a thing. My skull was ringing as if I had been struck. I shook my head to clear it. Oh, no, nothing like that. You're sure it's not that? Yes, sure. How do you know it's not that? Well, I mean, I'm married. So? And I'm a doctor. A lot of doctors fuck their patients, haven't you heard? I don't believe in that, I said. Why not? I believe that when patients come to you, they are in a dependent state. They look up to a doctor because they want help, and they're frightened, and they deserve to be treated and not have their dependencies exploited by the doctor. They deserve to get what they came for. I believed all this very strongly. Maybe she came to get fucked by her doctor. Well, I said, maybe that's what she needs to get better. I began to feel annoyed. I could see where this was heading. Are you saying you think that I want to, have sex with her? I don't know. You tell me. No, I said. I don't. Then what are you worried about? I'm not worried about anything. You just told me you weren't sure you could handle her. Well, I meant, in general, I wasn't sure. Listen, it's okay with me if you want to fuck her. Just don't do it. I won't. Good. How old are you? 24. How long have you been married? 2 years. Happy? Sure. Sex life okay? Sure. Great. So you wouldn't be tempted in the first place? Well, how do you mean? I mean, since your marriage is happy and your sex life is good, you wouldn't be tempted by this girl in the first place. Well, I mean, no, of course not. She's pretty? Yes. Sexy? I guess. I bet she knows how to maneuver men. Probably. I bet she knows just what to say and do to wrap men around her little finger. Well, I'm sure I can handle it, I said. I'm glad to hear that, Dr. Geller said, because that's going to be your job. Well, how do you mean? The only way this girl knows how to relate to men is sexually. She gets everything, friendship, warmth, comfort, reassurance from the sexual act. That's not a very good life strategy. She needs to learn there are other ways of relating to men, that she can get the warmth and approval she wants from a man without having sex with him. She's probably never had that experience before. You will be her first experience. Yes, as long as you don't end up fucking her. No, I won't. I hope not. Good luck with her. Let me know how things go. My conversation with Dr. Geller struck me as helpful. Although he obviously had some fixed idea I wanted to have sex with this girl, that didn't worry me in the least. I was quite confident that I wouldn't. I knew that, in becoming a doctor, I was assuming special responsibilities. This was the first of them. In fact, far from worrying about sexual temptation, I was eager to see Karen and begin our work together. I went immediately back to the floor and introduced myself to her. She was very tall. She came up to my shoulder when we stood side by side. She had a lean, athletic body and clear green eyes that looked at me steadily. "You're my doctor." "Yes," I said, "I'm Dr. Crichton." "You're very tall." She moved closer until her forehead touched my shoulder. "Yes. I like tall guys." "That's good." I stepped back a little. That seemed to amuse her. "Are you really my doctor?" "Yes. Why are you smiling?" "You look too young to be a doctor. Are you sure you're not just a medical student or something?" "I'm your doctor, believe me." "What kind of a name is Crichton?" "It's Scottish." "I'm Scottish, too. What's your first name?" "Michael." "Is that what they call you? Michael or Mike?" "Michael." "Can I call you Michael?" "Dr. Crichton would be better." She pouted. "Why? Why are you so formal?" "We're here to work together, Karen, and I think we should keep that relationship in mind." "What does that have to do with what I call you?" "Dr. Crichton. Ugh, I hate Dr. Crichton." "I just think it's better, is all." I found myself nervous standing next to her this way. Her physical presence was very strong. It left me a little shaky. As part of the workup, I had to begin by drawing bloods for routine chemistries, so I took her into the little examining room. We were alone. "Aren't you going to close the door?" "No." "Why not?" "It's fine the way it is." "Afraid to be alone with me?" "What makes you say that?" I asked. I felt very clever and psychiatric saying that, giving her a question back. "Do I have to take off my clothes?" "That won't be necessary." "Really? But don't you have to examine me, my body and everything?" "Just draw some blood." She ran her fingers across the examining couch. "Mind if I lie down on this bed?" "Go ahead." Having finished my neurology rotation, I was more relaxed about drawing bloods. But right now, my hands were shaking. She was sure to notice. She lay back on the examining table and stretched like a cat. "You want me on my stomach or my back?" "On your back is fine." "This couch is too short. I have to put my legs up." Her miniskirt slid around her hips. "Whatever's comfortable," I said. "Is it going to hurt?" she asked, wide-eyed. "No, not at all." "Why are you shaking, Dr. Crichton?" "I'm not." "Yes, you are." "Do I make you nervous?" "No." "Not even a little?" She was smiling, laughing at me. "You're a beautiful girl, Karen. You'd make anybody nervous." She smiled with pleasure. "You think so?" "Of course." She seemed reassured by this, and I felt calmer as well. It didn't hurt anything, I thought, to tell her she was attractive. I started drawing the bloods. She watched the needle, watched the tubes fill. She had a calm gaze, a steady way of looking at things. "Are you single?" "No, I'm married." "You tell your wife everything you do?" "No." "Men never do," she said, laughing. It was a sarcastic, knowing laugh. "My wife is in graduate school," I said. "I sometimes don't see her for days at a time." "Are you going to tell her about me?" "What goes on between you and me is confidential," I said. "So you won't tell her?" "No." "Good." She licked her lips. I lived in an apartment on Maple Avenue in Cambridge. I had known my wife since high school. She was studying child psychology at Brandeis. 1 block away, my wife's college roommate lived with her husband. They were both graduate students at Harvard. A block beyond that lived another friend and her husband, with whom I used to play basketball in high school. The 6 of us, all stable, all married, all in school, all connected in the past, spent a lot of time together. The relationships went way back. It was a small, complete world. My wife liked to cook. She was cooking while we talked. Is this girl in school? Yes, junior at BU. Says she wants to be a lawyer. Smart? Seems to be. And she's your patient? Yes. What's her problem? She has trouble relating to men. And what are you supposed to do? Interview her, find out what's wrong, write a paper at the end. Long paper? 5 pages. That's not too bad, my wife said. The resident told me I could meet with my patient twice a week or 3 times a week if I felt that was necessary. I felt 3 times a week would be required. There was an interview room that you booked. I asked Karen how she had come to be admitted to the hospital. She told me she had had a bad trip on LSD in her school dorm. The campus police had brought her in. But I don't know why they made me stay here. I mean, it was no big deal, just a bad trip. I made a mental note to check with the BU campus authorities and then asked her about her background before college. Karen spoke freely. She had grown up in a small coastal town in Maine. Her father was a salesman. He fooled around with a lot of women. He had always ignored her. Her father didn't like it when she took up with Ed just because he was a Hell's Angel. Her father was very angry when she became pregnant by Ed at 14. He made her have the baby. She gave the baby up for adoption. Her father never liked her other boyfriends either. For example, he didn't like Todd, the rich kid who made her pregnant when she was 16. He wanted her to have that baby too, but instead she had a miscarriage. She laughed. In Puerto Rico, she said. You had an abortion? Todd's rich, and he didn't want his father to find out. She laughed. You probably think I'm crazy. Not at all. You smoke so much when we're together. Do I? Yes, you're chain-smoking. Am I making you nervous? Not that I'm aware. That's good. I don't want to make you nervous. I appreciate your helping me. She wore miniskirts all the time. She liked to curl herself in chairs. She would wait for just the right moment, then curl her body and show me her pink underwear. I had to quickly look away, but when my eyes met hers again, I saw that she was laughing at me. So, did you make her pregnant yet? No, I said to Dr. Geller. Tell me how it's going. I told him what I knew so far. Her story sounded terrible. I interpreted it as a cry from a young girl for the attention of her father, a man who obviously wasn't capable of giving her the love and care she required. Instead, he was harsh and punitive. 2 pregnancies, then dismissed, sent off to various foster homes. It was amazing, I felt, that Karen had done as well as she had gotten into college and so forth. Why are you so protective of her? I'm not. Dad's a bastard and she's a victim? Well, isn't she? How does Karen relate to you? She seems very open. Ask about her mother. Karen didn't have much to say about her mother. Her mother was a retired schoolteacher, crippled in one leg from an automobile accident. Her mother was a weak person who let her father walk all over her, abuse her. And her mother didn't stand up for Karen, even when she knew. She fell silent and stared out the window. Knew what? I said. She shook her head, continued to stare out the window. Knew what? I said. She sighed. About my father. What about your father? My father used to fool around with me. How do you mean? He used to, fool around with me. He told me not to tell my mother." "You mean your father had intercourse with you?" She smiled. "You're so formal." We had been talking about her father for a week. "Why didn't you tell me this before?" "I don't know. I thought you would be mad at me." She curled in the chair again, in her kittenish way. This time beneath the miniskirt she wore no underwear at all. "How does she relate to you?" Dr. Geller said. "I would say seductive." "How?" "Well, she usually doesn't wear underwear under her miniskirts, and one day she wanted to come to our session in her nightgown." "What did you do?" "I made her go back to her room and change." "Why?" "I thought it was better." "Why?" "I'm trying to control her flirtatiousness." "Why?" "Well, I still have a lot to find out about her." "What don't you know?" After the second pregnancy, her mother found out that Karen had been having sex with her father. Her father then decided that Karen must go to a foster home. Karen lasted only 6 weeks at the first one. "Why?" "The guy had a problem. He couldn't keep his hands off her." "And then?" "Another foster home. This time the woman threw her out because she saw what was developing between Karen and the husband." "And then?" "A minister and his family. She lived with them for almost a year. He was a very strict man, a very pure man, and he told her that she should stop it, that he would never be tempted by her." "And?" "He lied." She shrugged. "One day his wife came home early and caught us. But by then it was time for me to go to college anyway." She found college boring, she said. It was so stuffy. She got good grades even though she cut most of her classes. She liked to take trips, to go skiing, or to go to New York. Anywhere just to get away. School was so boring. "Did you talk to those people at school?" she said. "The administration people?" "No, why?" "Just wondered." "Should I?" "I don't care. They don't know anything about me anyway." I interviewed the mother, a bland, worn woman of 50. She had swollen ankles. She kept crossing and uncrossing them. Helen was upset to learn that Karen was in the hospital for a mental problem. She had worried about Karen for a long time. Karen had been such a difficult child to bring up. Helen had hoped that once she was in college she would be all right, but obviously she wasn't. I asked about Karen's pregnancies. Helen was vague. She couldn't really remember much about them. I asked about trouble between Karen and her father. Helen said they had never gotten along. I asked about improprieties. Helen said, "Like what?" I asked about sexual activities of any kind. "Did Karen tell you that?" Helen said. "She is such a little liar." "It isn't true?" "I don't know how she could say that." "It isn't true?" "Of course it isn't true. Dear God, what kind of people do you think we are?" "Then why did you send her to foster homes?" "Because she was still seeing those boys, that's why. We had to get her away from those boys. So she told you that about Henry? And I'll bet you believed her. Men always believe whatever she says." "Well, what did you expect my mother to say?" Karen said. "You think she'll admit that?" Then she said she wanted a pass to leave the hospital for the following weekend, to go back to school for Saturday and Sunday. There was a party she wanted to attend. I said no. "Why shouldn't she get a pass?" Dr. Geller said. "I just don't think it's a good idea." "What's wrong? Think she's dangerous? She'll commit suicide?" "No." "You think she'll get laid?" "Probably." "What's wrong with that?" "Nothing," I said. "She can do whatever she wants. I don't care." "So let her leave." "I'm just concerned about my responsibility." "Your responsibility is to make a diagnosis, not to run her life." "I'm not trying to run her life." "Good, because you can't, you know." "I know." I gave her a pass. All weekend I thought about her, wondered where she was, wondered what she was doing. I spent some time at my apartment, but my thoughts were elsewhere. Karen's life seemed dangerous. She lived on the edge, in a way that was unfamiliar to me. I had always been so safe, so cautious in my own life. Here was somebody who just did what she wanted to do, said whatever she felt like saying, acted the way she wanted to act. I was beginning to have dreams about her eyes, her legs. I think I'm a little attracted to her, if you want to know the truth. Really? Dr. Geller said. Yeah, I'm a little preoccupied with her and so on. Dreams? Sometimes. Sexual dreams? Sometimes. I imagine I would, too. She must be pretty damn attractive. And she's bright, you say. You like her intelligence. Yes, she's bright. Nice body, nice young girl, nice legs, and so on. Yes. So it's natural to be attracted. The thing is, what are you going to do about it? Nothing. Perhaps you want to talk to her about your feelings? Why would I do that? She's the patient. That's true, Dr. Geller said. There was a long silence. He waited. I knew from past experience he could wait a long time. But what? I said. But if she's behaving seductively toward you, perhaps you could discuss her behavior and how it is making you feel. If you brought it to her awareness, she would have a chance to change it. Maybe she wouldn't. How do you know? I felt suddenly confused. I don't think that's a good idea, discussing my feelings. Merely a suggestion, he said. Karen was cheerful and evasive after her weekend off. She had seen some friends. She had gone to some parties. I felt irritable. Why? She said. Does it matter? To what? To your research paper about me or whatever you're doing? Who said I'm doing a research paper? Ellen told Margie that all the students are doing research papers. Margie was the depressed woman who had been seduced by her doctor. What are you going to write about me? Karen said. At home, I had dinner with my wife, our friends. The topic of divorce came up. Somebody Marvin knew was getting a divorce, another couple in graduate school. A little chill passed around the table, a flicker of the candles. I started to think, what if I got divorced? I would be a working doctor. What women would I meet? I would meet my patients, mostly. I would be busy. I wouldn't have much time for a social life outside my work. So the women I met would be my patients. But even if I was divorced, I couldn't go out with patients. I certainly couldn't have sex with patients. So how would I handle it exactly? How would I find women to go out with? And for that matter, how would I handle my practice, where women might come in whom I found exciting? What was I going to do? The priestly dedication to medicine was fine in the abstract, but when it came to actual limbs, sexy limbs, and beautiful bodies on the examining table, and breasts and necks and girls who didn't wear underwear. She probably has a disease, I consoled myself. But it wasn't much consolation. Yes, I told Dr. Geller, I am having trouble with my feelings. You want her, huh? Sometimes. Only sometimes? Listen, I have this thing under control. I'm not saying you don't. What about your marriage? My marriage isn't always that great. Nobody's is. But sexually? Not that great. Not all the time. So you think about Karen? Yeah. Listen, Dr. Geller said. That's fine. In fact, it's normal. It is? Sure. Think about her all you want. Just don't fuck her. I'm not going to fuck her. Great. Glad to hear it. I diligently assembled facts, dates, information of all sorts. I wrote a 20-page report 4 times as long as required. I presented it to the entire psychiatric staff. My basic picture was of a seriously abused child who had grown up without proper supports and encouragement, but who was valiantly struggling to keep her head above water and who was probably going to make it. Karen had intelligence and strength, and while her obstacles were formidable, I believed she would pull through in the end. The staff complimented me on my fine and unusually detailed report. But they viewed Karen's case much more seriously. This girl had a prior suicide attempt a year before while at college. This attempt, unknown to me, had required dialysis at another Boston hospital for barbiturate overdose. Karen had severe problems of self-worth. She had taken a great many psychedelic drugs. She was possibly even borderline schizophrenic. Her intelligence was a hindrance to contacting her true feelings. Her manipulative exterior kept her from feeling her pain. Her prognosis was not good. The chances were better than 50-50 that she would commit suicide within the next 5 years. I was shocked. I wanted to tell them that they were wrong, that their detachment and their statistics were wrong. I wanted to shake them from their complacency. We were talking about a human life here, a human life. If they really thought Karen was going to die, they should help her. They should prevent her senseless death. As calmly as I could, I said something to that effect. The chief of service puffed on his pipe. The truth is, there's not much we can do for her. He paused. You've seen how she is. I nodded. You've seen how she relates. I nodded. So you are aware of the degree to which she in fact causes the unfortunate events of her life, and the likelihood that she will continue to cause them in the future. I nodded and realized. She had seduced me after all. The chief of service spread his hands. Well then, it's hard, but that's the way it is. She was cheerful, waiting for me in the conference room. Did you have the meeting? Yes. And what did they say about me? She was as eager as a child. The chief resident will be talking to you. You tell me now. Karen, why didn't you tell me about the drug overdose? What drug overdose? The one last year when you were at college. It wasn't any big deal. I think it was. I figured you already knew about it. I thought when you called the college they told you about it. No, I said. I didn't call. Anyway, she said, shrugging it off. What did they say about me in the meeting? Well, I said, they think you need further therapy. They think it's very important that you get it. Will you be giving me my therapy? No, I'm afraid my 6 weeks are up. I'm going on to another rotation starting Monday. You are? She seemed shocked. Yes. Remember, I told you last week. I don't remember. Yes. Well, will I at least see you again? Probably not. I don't think so. So this is it? Tears welled in her eyes. Yes. Really? Yes. She stood up and looked at me with her steady eyes. The tears, if they had ever been there, were gone. Okay, goodbye, she said, and marched straight past me out of the room and slammed the door. I never saw her again. I never heard what happened to her. I never tried to find out. A day at the BLI. 5 teaching hospitals surrounded the Harvard Medical School, but in the eyes of the students, the least interesting was then the Boston Lying-In Hospital. Over the years, the other hospitals had decided not to do obstetrics, so all deliveries were now done at the BLI, a whole hospital full of babies being born. Most of my fellow students were unexcited by obstetrics, but I was fascinated at the prospect of seeing a delivery, and even doing 1 or 2. On my first day at the BLI, I stepped into a world that reminded me of nothing so much as Dante's Inferno. Room after room filled with women, all twisting and writhing in rubber-sheeted beds like oversized baby bassinets, all shrieking at the top of their lungs in the most hideous agony. I was appalled. It was like something from the 19th century, from the 18th century. "Yeah, well, these women are all on scope," the resident said. "They all insist on it. They come in the door, and the very first thing, they go, 'Give me the shot.' So we scope 'em." Scopolamine, famed in World War II movies as truth serum, was a soporific drug. But, as the resident explained, it wasn't a painkiller at all. "That's why they're screaming so much. Scope's not a painkiller." "Then what's the point?" "The point is it's an amnesiac. They're having the pain, but they won't remember any of it when it's over." And a good thing, I thought, watching them twist and scream and shriek. Many of them had to be tied down to the bed with restraining straps. "You gotta watch how you tie 'em down, because you don't want 'em waking up with bruises on their wrists. But if you don't tie 'em down, they'll bang around and hurt themselves, pull out their IVs, all sorts of stuff." I felt embarrassed for these women. Many were wealthy and elegant, carefully applied makeup, coiffed hair, manicured nails. Now they were tied down to a rubber hamper, and they were swearing and screaming, utterly out of control. I felt like an intruder, seeing something I should not see. "Why do you do this?" I asked. "They insist on it. You tell 'em this is what happens. You show 'em, even. They go, 'I don't care, give me the shot.'" I kept looking at the nurses, trying to see how they felt about it. They were women, too. But the nurses were blank-faced, neutral. As far as they were concerned, this was how it was. "Isn't there another way?" "Oh, sure," the resident said. Down the hall were more rooms. No rubber bassinets here, just ordinary hospital beds with women panting and groaning, with the occasional cry of pain. Most of the beds had IV lines hanging from them. Now here, these women get an epidural, a slow spinal drip for pain, and they maybe get a little Demerol, and they just work with the pain. It seemed much better here, much more human. "Yeah, whatever," the resident said. There were more rooms down the hall. "Down there," the resident said, "is where we have the girls from the home." "The home?" "The unwed mothers," he said, and named the home where they came from. We walked down there. "You gotta keep an eye on the nurses here," he said. "If you're not careful, they won't give the girls anything for pain at all. Sometimes they let 'em get all the way to the delivery room with nothing at all, sort of punishment for their sins." I expressed disbelief. I was back in Dante's hell. "Yeah, well, it's Boston," the resident said. We went into this room. It was incredibly tranquil. 4 or 5 teenage girls, panting and breathing and counting contractions. Only one nurse to attend them, and she was out of the room a lot. Some of the girls were having a great deal of pain, and they looked frightened to be alone, experiencing this pain. I stayed in the room with them. One girl named Debbie was red-haired and pretty. She was glad for some company and told me all about the home and the nuns who ran it. Debbie wasn't Catholic, but her family had been angry when she got pregnant. They had taken her to the home 5 months earlier. They hadn't come to see her since. A few friends from school came to visit, though not many. Her sister wrote letters, but said her father wouldn't let anyone from the family visit Debbie until it was over. Debbie said the nuns were okay if you didn't pay any attention to their lectures about sin. She said the home was okay. Most of the girls were 15 or 16. They all worried about missing school. Debbie would have to do her sophomore year over. Debbie had read a lot of books about childbirth, and she told me how the baby developed in the uterus, how at first it was like a pinhead, but then a couple of months later there was a beating heart and everything. She told me about breaking water and about contractions, and how you had to breathe with the pain. She and the other girls had practiced the breathing. She knew they weren't going to give her painkillers. She had heard that. The nuns had told her. From time to time as we talked, she would stop to go through the contractions. She asked to hold my hand during the contractions, and she would squeeze it hard. Then she would let go until the next time. Debbie explained that the girls talked a lot about keeping their babies, that most of them wanted to keep them, but a lot of the girls wouldn't be fit mothers, in Debbie's opinion. She herself wanted to keep her baby, but she knew she couldn't, because her father would never allow it. And anyway, she had to go back to school. "Can I have your hand again?" Another set of contractions. She looked at the wall clock. She told me they were only 3 minutes apart. It wouldn't be too long now, she said. I talked to some of the other girls in the room. They were all the same, all right there with the pains, paying attention, going through it. Most of them said they didn't want to see the baby after it was born. They were afraid that it would be too hard if they saw the baby. They were experiencing intense physical pain, and they were talking about intense emotional pain. But they were all right with it. They all had a calmness and a dignity. Meanwhile, back in the high-class rooms, the private patients, the respectable married women, were strapped down in rubber beds, swearing like sailors, screaming their heads off. It didn't make any sense to me. The people who were being punished were having the best experience. The people who were being indulged were having the worst experience. I saw my first delivery. It was, on the one hand, just like what I expected, and on the other hand, to see the little head appear and then the little body immediately transported you to some other reality. It wasn't a medical procedure, it was a miracle. I walked around in a daze. I saw several more deliveries. I couldn't get used to the feeling. I was floating. I went back to the room with the girls from the home. It was still peaceful, the girls still panting, alone. Debbie was gone. I checked the other rooms. I couldn't find her. I found the resident scrubbing outside a delivery room. "Say, did that girl from the home deliver?" "What girl?" "Debbie." "Don't know her." "Sure you do. Cute girl, red hair, Debbie." "I never look at the faces," the resident said. I grew to despise the Boston Lying-In Hospital. I stopped showing up for my duty hours. Of course, childbirth has changed greatly since then. You let a husband in the delivery room, and he won't permit his wife to be tied down, screaming like an animal, even if the doctors and nurses see nothing wrong with it. And the negative consequences of delivering narcotized babies have come to be more clearly acknowledged. Natural childbirth was a rarity in Boston in the late 1960s. The few doctors who did it were considered outlandish kooks. Now, natural childbirth is quite unexceptional. In fact, except for the recent enthusiasm for cesarean sections, childbirth practices represent one of the areas where medicine has changed for the better, and the Boston Lying-In Hospital has long since been torn down. Lousy on admission. Emily was a 66-year-old woman who lived alone in a small apartment. On a routine visit by a social worker, she was found lying unconscious on the floor and was rushed to the hospital. In the emergency ward, she was noted to be semi-comatose for unknown reasons. Her clothes were filthy and unkempt. She was also infested with lice. She was cleaned up, deloused, and admitted to the medical floor. When I first saw her, Emily was a tall, gray-haired, sharp-featured woman, sleepy and unresponsive. If you tried to wake her, she would grunt and push you away. Nobody knew what was wrong with her, how long she had been lying on the floor of her apartment, or why she was stuporous. But lab tests showed her chemistries were severely unbalanced. My resident, Tim, reviewed her chart. "Lousy on admission," he sniffed. "Obviously, a lot of neglect here, probably some senility. God knows how long she was lying on the floor." Emily was given intravenous feedings to correct her body chemistries, but she did not awaken. Meanwhile, nobody was able to find out anything more about her. Apparently, she lived alone in a small apartment in an unfashionable part of town. Apparently, she had no friends, no living family. No one came to visit her. She was an isolated, neglected old woman, obviously unable to care for herself. She was in our hands. And we were not able to determine why she was unresponsive. She appeared to be in a deep sleep, but we couldn't tell why. Abruptly, on the third day, Emily awoke. She looked around at all of us. "Oh, shit," she said. Her language further distanced her from the resident staff. An old lady who swore. She was obviously senile. We questioned her. What was her name? "You think I don't know? Scram, Daddy-o." Did she know where she was? "Don't be ridiculous." Did she know what day it was? "Do you?" Did she know who the president was? "Franklin Delano Roosevelt," she said, and cackled. A psychiatric consultation was requested. The psychiatrist found Emily to demonstrate bizarre ideation, strange flow of ideas, and hostile affect. Noting that she had been lousy on admission, he suggested that she might be in the early stages of senile dementia. We still had no idea why she had been comatose, and we ran more and more tests on her. In the meantime, she seemed to sleep less, to be more generally alert. But she remained distinctly odd. You never knew how she would greet you when you walked in the room. One day it was, "Ah, dottore, how are you today?" in a corny Italian accent. "What news from the Rialto?" One day it was, "All quiet on the Western Front," and her irritating cackle. One day it was, "Going to stick me full of needles again today? The human guinea pig, huh? You think I don't know what you're doing, Daddy-o?" She hated Tim, and the feeling was mutual. But for some reason she liked me. "Ah, the gigantic cherub, como está usted? Pablo should paint you, dearie." I talked to her. I was able to confirm that she had no living family, that she had never married, that she had lived alone for many years. I asked her the usual questions you ask old people, like whether she had any hobbies. She would snort contemptuously at the very idea. "Hobbies? Hobbies? I'm not an idiot." "Well, then, how do you spend your time, Emily?" "None of your fucking business, dottore." She puzzled me. She was evasive, but there was a strange strength to her, a kind of imperiousness. I speculated she might be a rich old Boston lady fallen on hard times, and now embarrassed by her condition. I speculated she might be foreign-born. She seemed to know a lot about artists and literature and music, making all sorts of references to Pablo and Ezra and Thelonious and Miles. These references went right past Tim and the other residents. They just thought she was senile. In fact, Tim became increasingly annoyed with her. He ordered more and more tests on Emily. We still didn't know what was wrong with her. Emily had lots of minor problems, a slight hypothyroidism, a degree of anemia, but nothing that would explain her stuporous condition on arrival, a condition that was now gone. Yet Tim continued to order tests. Finally he said, "We have to deal with her anemia. I'm going to order a bone marrow biopsy." Bone marrow biopsies were painful. "Why?" I said. "Just to complete the workup." "But her anemia is improving, and it's probably iron deficient," I said. "There's no evidence of any other problem. Why are you putting her through a biopsy?" "I feel it's required," Tim said. Actually, I didn't like Tim. I'd had terrific luck in most of the residents I had been assigned to for my year of clinical work, but it was inevitable that sooner or later I'd be paired with someone I didn't get along with. Many things about Tim troubled me. He wasn't well educated except in narrow scientific matters. He didn't know sports or politics or popular culture like current movies, so he didn't understand what patients were telling him if they alluded to any of these things. Either because of this, or for another reason, Tim was sarcastic about the patients. He made nasty cracks about nearly everyone under his care. He also complained about the patients' families and the trouble they caused when they visited the hospital. Finally, his physical manner was rough and harsh. He'd yank and pull at people in their beds, shoving them around, yelling at them, "No, no, not like that. Just stay the way I had you." In retrospect, Tim was a frightened man trying to hide his own sense of inadequacy behind a facade of bullying sarcasm. But at the time, I thought he was outrageous. All of the house staff had witnessed his behavior. More than once, glances were exchanged at the bedside. I felt Tim ought to be taken aside. I felt he needed psychiatric help. But nobody was doing anything about Tim, and it wasn't my position to suggest that a member of the house staff needed a shrink. I was just a medical student, the lowest of the low, and at the end of 3 months, Tim was going to give me my grade. But now Tim was planning to do a punch biopsy on Emily's hip bone, a painful and, I believed, unnecessary procedure. I felt he wouldn't dare to do it if Emily weren't an old woman without friends or relatives, a woman no better than an alcoholic bum, a woman who had been lousy on admission. "I'm doing it at 1 o'clock, he said. "Want to assist?" "No," I said. "I'll let you do it if you want." A bribe. "No," I said. "Why not?" I'd already registered my protest, so all I said was, "I have clinic follow-ups all afternoon." "Okay," Tim said. "You missed your chance. I'll get the nurse to help me." I still hoped he wouldn't go through with it, but he did. The test was negative. Emily's marrow was fine. Still, they kept Emily in the hospital. She had been there 2 weeks now. There was an unspoken rule about old people, which was that you discharged them from the hospital as soon as possible. Emily had gained strength steadily during the first week, but now she was starting to decline, to drift into a vague passivity. At rounds the next day, the house staff discussed further tests for Emily, more exotic blood chemistries, another EEG, a series of brain X-rays, a pneumoencephalogram. These tests would take at least another week. I was already feeling guilty about the bone marrow biopsy. Now I felt I had no choice. I spoke up. I said that, while Emily was clearly a strange person, her health now seemed basically good. There wasn't any compelling reason to do further tests. If she was senile, as everyone thought, then these tests wouldn't benefit her. There was no advantage to diagnosing an incurable disease. True, we had never found out what had put her in a coma, but we had been trying for 2 weeks, and there was no reason to think we would succeed in a 3rd week. Meanwhile, Emily was in noticeable decline. I argued we should discharge her and do any further tests on an outpatient basis, and I suggested that if Emily had a family, they would now be pushing us to let her go, and that by keeping her around, we were open to a charge of exploiting her as learning material. I was sweating by the end of my speech. Everybody stared at me. The chief resident said nothing. He turned to Tim and asked when the tests would be scheduled. Tim said the tests would be scheduled all during the coming week. The chief resident said, "Fine, go ahead." And that was that. We went on to the next patient. "What do you people think is wrong with me?" Emily said later when she and I were alone. "We're not sure," I said. "Nothing is wrong with me," Emily said. "I feel fine. I don't want any more tests." "I can understand that feeling," I said. "Well, then, why do I have to have them?" "He hurt me," she said, pointing to her bandaged hip. I was on dangerous ground now. I had to choose my words carefully. "If you want to leave the hospital," I said, "no one can stop you." "You mean I can just walk out of here?" "No, you have to be discharged, but if you insist on it, they have to discharge you." "They do?" "They'll try to talk you out of leaving, but they can't make you stay." "Good," Emily said. I'm sick of all you fucking doctors and your fucking tests. Guess who checked out? Tim said that night in the cafeteria. Emily. Oh, yes? Yeah. Discharged herself against physician's advice. When? Tonight. Screaming and swearing. Nobody could talk any sense to her. They had to let her go. I think somebody put the idea into her head. Oh, really? Yeah, somebody talked to her. I wonder who. I think somebody from accounting. They're not sure if she's covered by Medicare, you know, and I think accounting got nervous about the expense and decided to get her out. He sighed. But you wait. She'll be back in a few weeks, covered in lice, just like before. Crazy old bitch. 2 months later, I was walking through the lobby of the outpatient department when I felt a pain in the ribs. Somebody had banged into me. I grunted and kept going. Hey, doctor! I stopped and turned. A rather elegant woman stood there, wearing a green cape and a beret set at a rakish angle. She smoked a cigarette from a long ivory holder. She carried a cane in one hand. She was staring at me expectantly. Don't you say hello, doctor? Patients never understand how many people you see, how many faces pass before you, particularly in the outpatient clinic. You may see 50 in an afternoon. I'm sorry, I said, but do I know you? She cocked her head and seemed amused. Miss Vincent. I hadn't a clue. Miss Vincent? Emily. I stared, still not recognizing her. I tried to dredge up anybody named Emily Vincent, and suddenly it all fell together. Emily, the lady who was lousy on admission. Seeing her now, her stance, her dress, her manner, I understood. Emily was a bohemian. In the 1920s, she had been one of those rebellious, independent, artsy women. Of course she knew all about artists and writers. Of course she had never married. Of course she swore and smoked and was fiercely independent and advanced. Of course she was contemptuous of the doctors around her. Of course she liked saying shocking and outrageous things. As the years went on, Emily would have been in turn a flapper, then a wartime riveter, then an aging beatnik. Of course she said things like Daddy-O. Emily was a hipster. Emily, I said, how are you? Quite well, dottore. You may call me Miss Vincent. You're coming to the clinic? They say I have a little something with my thyroid and I take pills, she said, puffing on her cigarette. Frankly, I think it's crap, but my doctor is so handsome I indulge him. You look wonderful, Miss Vincent, I said, still trying to adjust to what I was seeing. You too, she said. Well, I must be off. Ciao. And with a dramatic wave, she turned, cape flying, and was gone. Heart attack. A major disaster befell the medical wards of the Beth Israel Hospital. All the interns and residents went around shaking their heads. The disaster was that, by some quirk of fate or statistics, 2/3 of the patients on the ward had the same illness: heart attack. The residents acted as if all the theaters in town were playing the same movie and they'd seen it. Furthermore, most of these patients would be here for 2 weeks, so the movie wasn't going to change soon. The home staff was gloomy and bored, because, from a medical standpoint, heart attacks aren't terribly interesting. They are dangerous and life-threatening, and you worry about your patients because they may die suddenly. But the diagnostic procedures were well worked out, and there were clear methods for following the progress of recovery. By now, I was in my final year of medical school, and I had decided I would quit at the end of the year. So my 3 months at the Beth Israel were going to be all the internal medicine I would ever learn. I had to make the best of this time. I decided to learn something about the feelings the patients had about their disease. Because, although doctors were bored by myocardial infarcts, the patients certainly weren't. The patients were mostly men in their 40s and 50s, and the meaning of this illness was clear to them. They were getting older. This was a reminder of their impending mortality. And they would have to change their lives, work habits, diets, perhaps even their pattern of sexual relations. So there was plenty of interest for me in these patients, but how to approach them? Sometime earlier I had read about the experiences of a Swiss physician who, in the 1930s, had taken a medical post in the Alps because it allowed him to ski, which was his great passion. Naturally, this doctor ended up treating many skiing accidents. The cause of the accidents interested him, since he was himself a skier. He asked his patients why they had had their accidents, expecting to hear that they had taken a turn too quickly or hit a patch of rock or some other skiing explanation. To his surprise, everyone gave a psychological reason for the accident. They were upset about something, they were distracted, and so on. This doctor learned that the bald question, "Why did you break your leg?" yielded interesting answers. So I decided to try that. I went around and asked patients, "Why did you have a heart attack?" From a medical standpoint, the question was not so nonsensical as it sounded. During the Korean War, postmortems on young men had shown that the American diet produced advanced arteriosclerosis by the age of 17. You had to assume that all these patients had been walking around with severely clogged arteries since they were teenagers. A heart attack could happen any time. Why had they waited 20 or 30 years to develop a heart attack? Why had their heart attack happened this year and not next, this week and not last week? But my question, "Why did you have a heart attack?" also implied that the patients had some choice in the matter, and therefore some control over their disease. I feared they might respond with anger. So I started with the most easygoing patient on the ward, a man in his 40s who had had a mild attack. "Why did you have a heart attack?" "You really want to know?" "Yes, I do." "I got a promotion. The company wants me to move to Cincinnati, but my wife doesn't want to go. She has all her family here in Boston, and she doesn't want to go with me, that's why." He reported this in a completely straightforward manner without a trace of anger. Encouraged, I asked other patients. "My wife is talking about leaving me. My daughter wants to marry a Negro man. My son won't go to law school. I didn't get the raise. I want to get a divorce and feel guilty. My wife wants another baby, and I don't think we can afford it." No one was ever angry that I had asked the question. On the contrary, most nodded and said, "You know, I've been thinking about that." And no one ever mentioned the standard medical causes of arteriosclerosis, such as smoking or diet or getting too little exercise. Now, I hesitated to jump to conclusions. I knew all patients tended to review their lives when they got really sick, and to draw some conclusion about why the illness had happened. Sometimes the explanations seemed pretty irrelevant. I'd seen a cancer patient who blamed her disease on a lifelong fondness for Boston cream pie, and an arthritis patient who blamed his mother-in-law. On the other hand, it was accepted in a vague way that there was a relationship between mental processes and disease. One clue came from timing of certain illnesses. For example, the traditional season for duodenal ulcers was mid-January, just after the Christmas holidays. No one knew why this should be, but a psychological factor in the timing of the disease seemed likely. Another clue came from the association of some physical illnesses with a characteristic personality. For example, a significant percentage of patients with ulcerative bowel disease had extremely irritating personalities. Since the disease itself was hard to live with, some doctors wondered if the disease caused the personality. But many suspected that it was the other way around. The personality caused the disease. Or, at least, whatever caused the bowel disease also caused the personality. Third, there was a small group of physical diseases that could be successfully treated with psychotherapy. Warts, goiter, and parathyroid disease responded to both surgery and psychotherapy, suggesting that these illnesses might have direct mental causes. And finally, it was everybody's ordinary experience that the minor illnesses in our own lives, colds, sore throats, occurred at times of stress, times when we felt generally weak. This suggested that the ability of the body to resist infection varied with mental attitude. All this information interested me enormously, but it was pretty fringe stuff in the 1960s in Boston. Curious, yes. Worthy of note, yes. But nothing to pursue in a serious way. The great march of medicine was headed in another direction entirely. Now, I was getting these data from the heart attack patients, and what I was seeing was that their explanations made sense from the standpoint of the whole organism, as a kind of physical acting out. These patients were telling me stories of events that had affected their hearts in a metaphorical sense. They were telling me love stories, sad love stories which had pained their hearts. Their wives and families and bosses didn't care for them. Their hearts were attacked. And pretty soon their hearts were literally attacked, and they experienced physical pain. And that pain, that attack, was going to force a change in their lives and the lives of those around them. These were men in late middle life, all undergoing a transformation that was signaled by this illness event. It made almost too much sense. Finally, I brought it up with Herman Gardner. Dr. Gardner was then chief of medicine at the hospital and a remarkable, extremely thoughtful man. As it happened, he was the attending physician who made rounds with us each day. I said to him that I had been talking with the patients, and I told him their stories. He listened carefully. "Yes," he said. "You know, once I was admitted to the hospital for a slipped disc, and sitting in bed I began to wonder why this had happened to me. And I realized that I had a paper from a colleague that I had to reject, and I didn't want to face up to it. To postpone it, I got a slipped disc. At the time, I thought it was as good an explanation as any for what had happened to me." Here was the chief of medicine himself reporting the same kind of experience. And it opened up all sorts of possibilities. Were psychological factors more important than we were acknowledging? Was it even possible that psychological factors were the most important causes of disease? If so, how far could you push that idea? Could you consider myocardial infarctions to be a brain disease? How would medicine be different if we considered all these people in all these beds to be manifesting mental processes through their physical bodies? Because at the moment we were treating their physical bodies, we acted as if the heart was sick and the brain had nothing to do with it. We treated the heart. Were all these people being treated for the wrong organs? Such errors were known. For example, some patients with severe abdominal pain actually had glaucoma, a disease of the eye. If you operated on their abdomens, you didn't cure the disease. But if you treated their eyes, the abdominal pains disappeared. But to extend that idea more broadly to the brain suggested something quite alarming. It suggested a new conception of medicine, a whole new view of patients and disease. To take the simplest example, we all believed implicitly the germ theory of disease. Pasteur proposed it 100 years before, and it had stood the test of time. There were germs, microorganisms, viruses, parasites, that got into the body and caused infectious disease. That was how it worked. We all knew that you were more likely to get infected at some times than others, but the basic cause and effect, germs caused disease, was not questioned. To suggest that germs were always out there, a constant factor in the environment, and that the disease process therefore reflected our mental state, was to say something else. It was to say mental states caused disease. And if you accepted that concept for infectious disease, where did you draw the line? Did mental states also cause cancer? Did mental states cause heart attacks? Did mental states cause arthritis? What about diseases of old age? Did mental states cause Alzheimer's? What about children? Did mental states cause leukemia in young children? What about birth defects? Did mental states cause Mongolism at birth? If so, whose mental state? The mother's or the child's? Or both? It became clear that at the farther reaches of this idea, you came uncomfortably close to medieval notions that a pregnant woman who suffered a fright would later produce a deformed child. And any consideration of mental states automatically raised the idea of blame. If you caused your illness, weren't you also to blame? Much medical attention had been devoted to removing ideas of blame from disease. Only a few illnesses, such as alcoholism and other addictions, still had notions of blame attached. So this idea that mental processes caused disease seemed to have retrogressive aspects. No wonder doctors hesitated to pursue it. I myself backed away from it for many years. It was Dr. Gardner's view that both the physical and the mental aspects were important. Even if you imagined the heart attack had a psychological origin, once the cardiac muscle was damaged, it needed to be treated as a physical injury. Thus, the medical care we were giving was appropriate. I wasn't so sure about this. Because if you imagined that the mental process had injured the heart, then couldn't the mental process also heal the heart? Shouldn't we be encouraging people to invoke their inner resources to deal with the injury? We certainly weren't doing that. We were doing the opposite. We were constantly telling people to lie down, to take it easy, to give over their treatment to us. We were reinforcing the idea that they were helpless and weak, that there was nothing they could do, and they'd better be careful even going to the bathroom because the least strain and poof, you were dead. That was how weak you were. This didn't seem like a good instruction from an authority figure to a patient's unconscious mental process. It seemed as if we might actually be delaying the cure by our behavior. But on the other hand, some patients who refused to listen to their doctors, who jumped out of bed, would die suddenly while having a bowel movement. And who wanted to take responsibility for that? Many years passed, and I had long since left medicine before I arrived at a view of disease that seemed to make sense to me. The view is this: we cause our diseases. We are directly responsible for any illness that happens to us. In some cases, we understand this perfectly well. We knew we should not have gotten run down and caught a cold. In the case of more catastrophic illnesses, the mechanism is not so clear to us. But whether we can see a mechanism or not, whether there is a mechanism or not, it is healthier to assume responsibility for our lives and for everything that happens to us. Of course, it isn't helpful to blame ourselves for an illness. That much is clear. It's rarely helpful to blame anybody for anything. But that doesn't mean we should abdicate all responsibility as well. To give up responsibility for our lives is not healthy. In other words, given the choice of saying to ourselves, "I am sick, but it has nothing to do with me," or saying, "I am sick because I caused the sickness," we are better off thinking and behaving as if we did it to ourselves. I believe we are more likely to recover if we take that responsibility. For one thing, when we take responsibility for a situation, we also take control of it. We are less frightened and more practical. We are better able to focus on what we can do now to ameliorate the illness and to assist healing. We also keep the true role of the doctor in better perspective. The doctor is not a miracle worker who can magically save us, but rather an expert advisor who can assist us in our own recovery. We are better off when we keep that distinction clear. When I get sick, I go to my doctor like everyone else. A doctor has powerful tools that may help me. Or those tools may hurt me, make me worse. I have to decide. It's my life. It's my responsibility. Doctors W, X, Y, and Z. Mr. Irwin, a 52-year-old man, was admitted to the hospital because of a spot found on a routine chest X-ray taken by his private physician. Once he was in the hospital, the X-rays were repeated. The spot was there, no doubt about it, in the upper left lobe of his lung. Mr. Irwin was told that he should have surgery, and he agreed. But when it came to signing the forms, he asked for time to think it over. The next day, he was again advised to have surgery, and again he agreed, only to back out at the last moment. A week passed in this way. Mr. Irwin never asked what was in his lung that required surgery. He never asked anything at all, and nobody volunteered to tell him. For one thing, the X-ray image was anomalous. It appeared to be some sort of tumor, but it didn't present a classical picture. Mr. Irwin was extremely nervous, and the house staff chose to wait. On the other hand, a week was a week. It became difficult to justify keeping someone in an expensive bed, but the house staff didn't want to discharge Mr. Irwin because they felt he'd never confront his illness once he left the hospital. So there was an impasse. Mr. Irwin still didn't ask about the operation, and still no one told him. Finally, at the end of the week, Dr. W., a surgeon from a nearby hospital, came to conduct visiting rounds. Dr. W., a former athlete, was a big blustery man who performed surgery with drama and verve. The house staff presented him with the case of the reluctant Mr. Irwin. Dr. W. was outraged at the way the staff had coddled this man, and insisted on seeing him at once. Dr. W. walked into the man's room and said, "Mr. Irwin, I'm Dr. W. You have cancer, and I'm going to take it out." Mr. Irwin burst into tears and agreed to surgery. The following day the operation was performed. A granulomatous lesion was removed. In the center of the lesion was found some stringy material identified by the pathologists as beef. Apparently Mr. Irwin had, at some earlier time, inhaled a bit of meat while eating. The beef had lodged in his lung and had been overgrown with a protective coating of tissue. When Mr. Irwin awoke, he was told the good news by the delighted house staff. Mr. Irwin remained glum. He still cried frequently. As the days went on, he said he knew the house staff was lying to him, that he had cancer. Dr. W. had told him so. The residents assured him that Dr. W. was wrong, that there was no cancer. They showed him the pathology reports. They offered to let him see his chart. Mr. Irwin believed none of it. 2 days later, Mr. Irwin crawled out the narrow window of his room and jumped to his death. Dr. X performed surgery on the leg of a 35-year-old woman. His intention was to tie off the femoral vein. Immediately after surgery, the woman complained of severe pain in the leg, which was noted to be blue and cold with little pulse. 24 hours after surgery, when there was no improvement in her condition, it was realized that Dr. X had mistakenly tied off the femoral artery, not the vein. The woman's leg would now have to be amputated at the hip. Dr. X was an elderly Jewish refugee from Nazi Germany. He was known to have made such errors before, and his surgical privileges had been revoked at a suburban hospital. The question was whether Dr. X would now lose his privileges at this hospital as well. 2 things interested me. The first was that nobody told the woman anything was amiss. In those days, before the flood of malpractice litigation, a woman who had been grossly mistreated by a physician known to be negligent was not being told anything by the other doctors around her. The woman was relatively young, and the mother of 2. With one leg amputated, she was now going to have a very different life. The second thing was that there was discussion about whether Dr. X would lose his surgical privileges, as if the question were in doubt. In fact, the hospital did not revoke his privileges entirely. He was merely forbidden to operate alone any longer. Dr. Y was discussing the case of a traveling salesman who had been admitted for gallbladder surgery. The salesman was a chronic alcoholic, and the staff was afraid that he would go into the DTs while in the hospital, which would complicate his treatment and might even kill him. It was decided that he should be allowed beer while in the hospital. Every day the salesman got a case of beer delivered to his bedside. I asked whether Dr. Y was troubled by the fact that this alcoholic patient was also a traveling salesman. Presumably, once his medical condition was resolved, he would be back on the road, drinking and driving. Did the hospital, knowing the man was an alcoholic, have any greater responsibility to the man, his employers, or the wider society of drivers? Well, this is a very difficult problem, Dr. Y said. For instance, I recently performed an insurance exam on an airline pilot who was a chronic alcoholic. What did you do in that case? I asked. Dr. Y shrugged. I certified him, he said. What else could I do? I couldn't take away his livelihood. Dr. Z was a 78-year-old physician who entered the hospital in a near coma, in end-stage cardiac and renal failure. His son was also a physician, but not on the staff of the hospital, so he could only visit like any other relative, and he had nothing to say about his father's care. He did, however, state that he wanted his father to die peacefully. The old man was on the critical list for nearly a week. He had a cardiac arrest one night, but he was resuscitated. His son came in the next day and asked, with a certain delicacy, why the staff had resuscitated the old man. Nobody answered him. Later that day, old Dr. Z suffered sudden massive congestive heart failure. The hospital staff was making rounds. They all rushed to his bedside. In a moment he was entirely surrounded by white-jacketed interns and residents, working on the old man, sticking needles and tubes into his body. In the midst of all this, he somehow emerged from his coma, sat bolt upright in bed, and shouted clearly and distinctly, "I refuse this therapy! I refuse this therapy!" The residents pushed him back down. He got the therapy anyway. I turned to the attending physician and asked how such a thing was possible. This man was, after all, a physician, and he was unquestionably dying, if not today, then tomorrow or the next day. Why had the house staff contradicted his wishes, and those of his family? Why was he not being allowed to die? There was no good answer. Dr. Z finally died on the weekend, when hospital staffing was light. Incidents such as these troubled me throughout my clinical years. Everyone around me seemed to shrug them off, and to go on about their business, but I was unable to do that. My concerns in these areas eventually became one of the major reasons why I decided to quit medicine. Quitting medicine. Back in my first year, shortly after I cut open a human head with a hacksaw, I decided to quit medical school. I went to Dr. Lorenzo, the dean of students, and said I wanted to quit, that medicine wasn't for me. "Okay," he said, "go see Tom Corman. After that, if you still feel the same, you can quit." At this time, it was the policy of the Harvard Medical School that you had to talk to a shrink before you quit. Dr. Corman was the shrink. He was well known among the students. A lot of us had been to see him. Dr. Corman was short, intense, and direct. "What's your problem?" "I want to quit medical school." "Why?" "I hate it." "So?" This confused me. I explained that I had been at the school for 3 months. I had given it a try, but I just didn't like it. I didn't like what I was studying. I didn't like the experience. I didn't really like my classmates. I didn't like anything about it. "So?" I asked him to explain. "Why did you come to medical school?" he said. "I want to be a doctor." "Meaning what?" "I want to help people." "And how many patients have you seen so far?" "Almost none." "So you're not doing what you came here to do. You came here to help people, and instead you sit in classes all day, right?" "Right." "I can understand that you hate it," he said. "Most of your classmates hate it. That doesn't mean anything." I thought it did mean something. It meant that I hated it. "The first 2 years of medical school don't have anything to do with being a doctor, which is what you want to be. I think you owe it to yourself to wait until next year, when you start seeing patients in a clinical setting." I said that was too long to wait. I wanted to quit now. "All right," he said. But consider the academic realities. It's not advisable to quit in the middle of an academic year. It doesn't look good on your record when you apply to graduate school in some other field. You'd be better off finishing this year and then quitting." That was true enough. So, in the end, Dr. Corman talked me out of quitting, and after the first year I felt a little better about medicine. I thought I'd give the second year a try. The second year was even worse. I was back in Dr. Corman's office. "I want to quit." "Still don't like it?" "I hate it." "What do you hate?" "The classes." And I did. For such a famous medical school, the quality of instruction was a disgrace. It was so bad that the students had recently rebelled and demanded the right to tape the lectures, and to assign one student to each lecture to go over the tape and make decent mimeographed notes for the class. The faculty was up in arms about this, but the students were adamant and won in the end. To listen to one of those lectures again and again, trying to put the speaker's points into some kind of logical order, consulting the textbooks to explain what he forgot to explain, was a startling demonstration of how poor the lectures really were. I had taught a lecture course at Cambridge University, so I'd had the experience of preparing and delivering lectures. I knew how long it took. In my case, 10 to 20 hours to prepare an hour's lecture. I knew how it felt to give a lecture when you were fully prepared, how it felt to be almost prepared, how it felt to be poorly prepared, and how it felt to wing it. The Harvard lecturers were mostly winging it. One man after another would stand up with a fistful of last year's lecture notes, including a few scribbled changes in the margins, and start to talk. The fact that a few instructors like Don Fawcett and Bernard Davis were superb only threw the inept majority into sharper relief. "And are you seeing any patients?" "Yes. We were doing some introductory clinical work." "How is that?" "I like that." "Well, the classes you dislike will stop in a few months, and then you'll just be seeing patients. So is it correct to quit now?" He talked me out of it. Pretty soon another year had gone by. I was in my third year, doing full-time clinical rotations, more or less living at the hospital. By then, I'd concluded I wanted to be either a surgeon or a psychiatrist. But when I did my 3-month surgical rotation, I found myself surprisingly bored. I liked the pragmatism of surgeons. I liked their active stance toward the world. I liked the crises and pressures. And I liked telling people what to do. All that appealed to me. But I noticed that surgeons were interested in each case in a way I was not. To a good surgeon, every gallbladder presented new features of interest. But as far as I was concerned, if you'd seen one gallbladder, you'd seen them all. So I suspected I was not destined to be a surgeon. This left psychiatry, but I'd had a disturbing experience with a female patient. I'd been uncomfortable as a therapist. And worse, as I worked in the clinic, seeing as many patients as possible, I began to feel that psychiatry was not a powerful field. I didn't think psychiatry could really help people much. On the one hand, I had seen severely ill, institutionalized people with dramatic mental disease. But psychiatry didn't seem able to do much for them, and certainly couldn't effect cures. And, on the other hand, there were lots of well-to-do people who didn't strike me as sick, but rather as self-indulgent. For them, psychiatry appeared to offer a glorified kind of hand-holding that I didn't admire, and I wasn't at all sure that it did them any good either. So I was disillusioned with both surgery and psychiatry. Back to Dr. Corman. "Well," he said, "you haven't finished your clinical rotations. How do you know you won't like pediatrics, orthopedics, or internal medicine?" "I'm pretty sure I won't." "This far along, don't you owe it to yourself to find out?" He talked me into staying again. When I was finally convinced that no clinical specialty appealed to me, I had completed 3.5 years of a 4-year program. And then it really didn't make sense to quit. I went back to Dr. Corman and said I was going to get my degree and then quit. He sighed. "I thought you would quit in the end," he said. "Your fantasies are too strong." In this, he was correct. I was supporting myself in school by writing thrillers, and my imaginative tendencies were overpowering. I often listened to patients thinking, how can I use this in a book? And sometimes when I heard the symptoms of their disease, I'd think, it's obviously anemia, but can I imagine a new disease that would present with these same symptoms? Of course, when you go to a doctor, you don't want him to view you as a book chapter, and you don't want him making up fictional diseases to explain your case of anemia. I was clear on that. I understood that I was not behaving like a doctor that I would want to consult, so I thought I ought to quit. There were other problems, too. Much of medicine, as it was practiced in those days, I simply didn't agree with. I didn't agree that abortion on demand should be illegal. I didn't agree that patients had no rights and should shut up and do whatever the doctors told them to do. I didn't agree that, if a procedure presented a hazard, the patient shouldn't be worried with the facts. I didn't agree that terminally ill people should have treatment forced upon them, even if they wished to die in peace. I didn't agree that, when malpractice occurred, doctors should cover it up. Beyond these broad issues of ethics, I didn't agree with the style of the new physician-scientist so popular at that time. I didn't think of people as a sack of biochemical reactions that had somehow gone awry. I thought people were complex creatures who sometimes manifested their problems in biochemical terms. But I thought it wiser to deal primarily with the people, not to deal primarily with the biochemistry. And while there was much lip service given to my view, in practice nobody did anything but treat the enzyme levels. Again and again, I met patients who had been in the hospital for weeks and who had obvious problems that nobody had ever noticed because they didn't show up in the lab tests. It made you suspect that the doctors weren't really looking at their patients, not as people. And the trend toward the physician-scientist had brought to the medical school a kind of student with whom I had little in common. My classmates tended to think that literature, music, and art were irrelevant distractions. They held these cultural matters in the same intellectual contempt that a physicist holds astrology. Everything outside medicine was just a waste of time. In those days, Harvard had built a new medical library. One day, a pale, ethereal-looking man wandered in and looked around. It took me a moment to realize it was Louis Kahn, who was one of my heroes. I was very excited and reported the news at lunch. Louis Kahn was in the library today. Who? Louis Kahn. Frowns. The new professor of medicine? No, the architect. Oh. And the conversation turned away. Louis Kahn was not only a famous architect, he was arguably the most influential medical architect in the world, as a result of the building he had done at the University of Pennsylvania some years before. Harvard was putting up a lot of new hospital buildings at this time, and there was much discussion of their merits and faults. How could you have informed discussions if you had never heard of Louis Kahn? This single-mindedness led to some bizarre medical episodes. Once I heard a group of residents plan the surgical treatment of a middle-aged businessman. The best thing for his intestinal problems, they agreed, was to schedule 5 separate surgical procedures. The first would clean up his bowel. The second would cut a hole in his stomach so he could defecate into a bag. The third would do something else. The fourth would repair the hole in his stomach and reconnect his intestines. The fifth would do something else again. Altogether, the man would be out of the hospital good as new in 9 months. The alternative was a 2-stage procedure that would require only 3 weeks and no colostomy bag, but it was obviously inferior to the 5-stage treatment. I suggested that the man might not agree to the 5-stage treatment. Everyone listened to this view with astonishment. Why on earth wouldn't he agree? I said, Perhaps the man didn't want to spend 9 months of his life in a hospital undergoing one operation after another. I suggested that a busy corporate executive was worried about many things besides his health. He was worried about his family, about his income, about his rank in the company. A 9-month hiatus from daily life was going to give him a lot of problems. I also said that to live with a colostomy bag was a major body alteration, and it would not be lightly accepted by anyone, even temporarily. No, no, they said. When we explain it to him, he'll certainly agree to the 5-stage treatment. Of course, the man didn't agree to it. He wanted the fastest possible treatment, and he thought their elaborate plan was crazy. He reacted to the idea of a colostomy bag with horror. The residents came away shaking their heads. What can you do with somebody who doesn't care about his health? Yet the fact that the patients were complex human beings with a rich life beyond the hospital never really sank into the consciousness of the residents. Because they had no rich lives beyond the hospital, they assumed no one else did either. In the end, what they lacked was not medical knowledge, but ordinary life experience. Nor did the attitude of practicing physicians encourage me. I liked them much better as people. They often had a breadth of interest missing from the current crop of students. But all too often the senior physicians were dissatisfied with their work. Even if they loved medicine, and most did, they came to dislike the lifestyle. In those days, when group practices were less common and doctors had a more direct one-to-one relationship with their patients, clinical practice was enervating in a way that seemed to catch up with physicians after a decade or two. These men had families they hardly knew, boats they had hardly sailed, and trips they had many times canceled. It seemed their patients took everything in their lives, and not enough came back. I had assumed the life of a doctor was, without doubt, devoted to helping people, but practicing physicians weren't so sure. They saw many patients who apparently had nothing wrong with them. They saw terminal illnesses which they could not cure. Again and again they would say, "I'm not so sure I really help people." At first I chalked it up to temporary fatigue or to fashionable self-doubt. Eventually I began to believe it. They were serious, and a lot of them felt that way. Of course, I wanted to quit to become something else. I wanted to be a writer. This had been my earliest life ambition. It went back almost to the beginning of my ability to read and write at all. When I was 9, my 3rd-grade class was told to write a puppet show. Most of the students wrote brief skits. I wrote a 9-page epic involving so many characters that I had to get my father to retype it for me with multiple carbon copies before it could be performed. My father said he'd never read anything so cliché-ridden in his life, which probably was true. This hurt me and confirmed a pattern of conflict between us that persisted for many years. But my father unquestionably influenced my interest in writing. He was a born storyteller. At bedtime we insisted he tell us stories, which he would illustrate on the spot with little comic strip drawings until we slowly drifted off to sleep. When I was growing up, my father was a journalist and an editor. At the dinner table there was always talk about writing and correct word use, with frequent pauses to consult Fowler's modern English usage when arguments arose. Many of his editorial dicta stayed with me. Be careful about obviously. If it's really obvious, you don't need to say it. And if it's not obvious, it's insulting to say that it is. My father insisted on clarity and brevity, and he could be a harsh critic. But he was also full of good humor in those days. Journalists hear more jokes than anyone else, and each night he would come home with a new one, often risque. My mother would say, "Now, John," as he told it to the glee of the children. My father considered the ability to type a necessary life skill, and all his children learned at an early age. I learned to type when I was 12, and it is surely no accident that of his 4 children, 3 have published books, and the 4th is working on one. In any case, I wrote extensively from an early age. It was something I liked to do. I began submitting short stories to magazines when I was 13, and I sold a travel article to the New York Times when I was 14. What happened was that on a summer trip my family visited Sunset Crater National Monument in Arizona. I found this place fascinating, but there was nobody else around that day, and I suspected most tourists bypassed it, not realizing how interesting it really was. "Why don't you write about it?" my mother said. "For what?" "The New York Times publishes travel articles from different people." My mother was a great clipper of articles. "The New York Times," I said. "I'm just a kid." "Nobody needs to know that." I looked at my father. "Get all the published information they have at the ranger station," he said, "and interview the ranger." So my family waited in the hot sun while I interviewed the ranger, trying to think of things to ask him. But I was emboldened by the fact that my parents seemed to think I could do this, even though I was only 13. Back in the car, driving to the next place, my father said, "How many visitors do they have every year?" "I didn't ask that," I said. "Is it open all year round?" "I didn't ask that either." "What was the ranger's name?" "I didn't ask." "Jesus," my father said. "What published information did you get?" I showed him the pamphlets and brochures. "Well, that'll be enough. You can write the story from that." When I got home, I wrote an article and sent it in, and the Times bought it and ran it. I was ecstatic. I was a published writer. Years later, I discovered that the travel editor, Paul Friedlander, lived near us, and his daughter Becky was in my class at school, so he probably knew a kid had written this article, and he was probably amused to publish it. But at the time, I thought I had sneaked past the system, and had done a grown-up thing, and it gave me tremendous encouragement to continue writing. After all, I had been paid $60, which in those days was a lot of money for a kid. I began doing other journalistic writing. I covered high school sports for the town paper. I was both reporter and photographer and was paid $10 a week. And in college I wrote for the Harvard Crimson, where I was book review editor, free books, and sometime movie reviewer, free theater passes. And I covered sports for the Alumni Bulletin, which paid about $100 a month. So with this history of writing, it was natural for me to think of writing to pay for the cost of medical school. My father had 3 other children in college at the time, and he couldn't pay the cost of school. I had to make money in some way. Clearly, I couldn't make enough writing freelance articles, so I decided to write novels. In those days, James Bond spy novels were popular, and I read a lot of them. I decided to write novels like that. By then I was married, and my father-in-law knew somebody at Doubleday. He sent Doubleday my first novel. Doubleday said that they wouldn't publish it, but Signet might. Signet bought it as an original paperback and called to ask who my agent was to negotiate the deal. I didn't have an agent, but my father-in-law arranged for me to meet some. I met 3. The first agent represented many famous authors and intimidated me. The second told me how I should write, and annoyed me. The third was a young girl who had been an agent's secretary and was just starting out on her own. She said she wanted to represent me. Since she was the only one who had said she wanted to represent me, it seemed like I should sign with her. So I did. For the next 3 years, while I went to medical school, I wrote paperback thrillers to pay my bills. Of course, there wasn't much time for writing, but I did it on weekends and vacations. And with practice, I learned to write these spy thrillers quickly. Eventually, I wrote one in 9 days. But I didn't take any particular interest in this work. It was just a way to pay the tuition bills. Then, slowly, almost imperceptibly, the writing became more interesting to me than the medicine. And as my writing got more successful, the conflict between writing and medicine became increasingly awkward. Under a pseudonym, I wrote a book called A Case of Need. It had many lightly disguised references to people in the Harvard Medical School. When the book was published, there was a lot of talk about this author, Jeffrey Hudson, who seemed to know so much about Harvard. I joined right in. Who could this Hudson fellow be, anyway? What a mystery. That was fun. Then the book was nominated for an Edgar for the Best Mystery of the Year. That was fun, too. Then the book won, which meant somebody had to accept the award. Suddenly it was not fun anymore. I knew that if anybody found out I had written that book, I would be in a lot of trouble. At Harvard, in your clinical years, you were given grades according to the informal opinion of the people you worked with. If these people found out I was writing books, my grades would fall precipitously. I went to New York and accepted the award with dread. But I needn't have worried. There wasn't much publicity, and I was protected by the prejudices of the physician-scientists, who regarded literary matters as a waste of time. Nobody ever knew. But then this same troublesome book was bought for the movies, and the movie company wanted me to fly to Hollywood to talk to the screenwriter. I said I couldn't come. I was in medical school. They said come for the weekend. They were very insistent. I had to go to the chief of service to get Friday off. Dr. Gardner was a very nice man. I asked if I could take off Friday. "Is there a death in the family?" he asked. That was the usual excuse we used. By the third year, each of us had our grandparents die 3 or 4 times. "No," I said. "An illness?" he said. "No," I said. And I gulped and told him the truth, that I had written this book and it had been bought for the movies, and now the people in Hollywood wanted me to come out and talk to the screenwriter, and so I needed Friday off to do that, but don't worry, I'll be back on Monday for sure. He looked at me strangely. What a lunatic excuse. Why didn't I just say my grandmother had died like everybody else? But all he said was, "All right." So I went to Hollywood, and I rode around in limousines and had dinner with famous people, and then I came back and went to the hospital again. There was a discontinuity in my life, a gap between the parts, and as time passed it grew wider. I made the decision to quit in the summer of my 3rd year. At that time, medical students apply for an internship. I didn't apply, which meant I'd be dropping out after graduation. A few weeks after I decided not to continue, I developed numbness in my right hand. Over several days, the numbness extended up my arm to the shoulder. I thought perhaps I'd slept on my arm and had compressed the nerves a little. The numb sensation was mild, and I ignored it. I had every reason to ignore it. During all the clinical rotations, I had developed convincing symptoms of every disease I had studied. In dermatology, I was sure my moles were growing. I went home each night and used a hand mirror to check my back, where I was convinced melanomas were popping out like beads of sweat. During surgery, I developed bloody stools, symptomatic of a hemorrhagic ulcer, a true surgical emergency, although one of the residents said disdainfully that I had just developed hemorrhoids and welcome to the club. During genitourinary, I developed pain on urination and would spin down my urine in the lab each day, looking for microorganisms that I felt sure were there, although I could never find them. In each instance, the day the clinical rotation ended, the symptoms mysteriously vanished, only to be replaced by new symptoms which developed as I began my new rotation. So no matter how persuasive these new symptoms seemed to me, I had learned, after a year, not to panic. I certainly wasn't going to panic now over something as peculiar as numbness in my right arm. I chose to avoid thinking about it. I refused even to look up the symptoms in my textbooks. Then, one day in the cafeteria lunch line, I reached into my pocket for change and realized I could not distinguish the coins I was feeling in my pocket. I had to bring the coins out and look at them in my palm to see which was which. I knew what this was called. Asteriognosis. I knew it was definitely abnormal. Still, I ignored my symptoms. Nothing further happened for 2 weeks, but the numbness did not go away either. One day I asked a classmate who was a superb diagnostician, "What can give you numbness in your right arm?" He thought about it for a while, shook his head. "The only things I can think of are spinal cord tumor and multiple sclerosis." I thought, what does he know? He's only a medical student. I still did nothing. I expected the symptoms to go away. They didn't. I worried more and more about my arm until finally I looked up the symptoms of spinal cord tumor and multiple sclerosis. It was immediately clear that spinal cord tumor was highly unlikely. If I had anything wrong with me, it would seem I had multiple sclerosis. Multiple sclerosis was a progressive degenerative disease of the nervous system, which tended to afflict young people. It was an autoimmune disease in which the body's defenses became confused and attacked its own nerve fibers as if they were foreign intruders. The progress of the disease was highly variable. There was no known cause, no effective treatment, and no cure. According to my reading, MS could first appear in almost any way. The fact that I had numbness without pain in only one extremity with no prior history of injury was highly suspicious. But it was impossible to make a diagnosis of MS based on a single set of symptoms. You needed to see a pattern of neurological attack and remission over time to confirm a diagnosis. I stopped reading. I went on to my next rotation and hoped the symptoms would disappear. They did not. My arm remained numb. By now, it had been almost 2 months. One day in October, while bending over a patient's bed, I noticed shooting electrical tingles going down both legs. From the reading I had already done, I knew what this was. Lermit's sign. Technically, paresthesias on flexion of the neck. Lermit's sign was pathognomonic of multiple sclerosis. I had the disease. I did more reading, a lot more reading. For a man of 26, the news was not encouraging. Multiple sclerosis was highly variable, but according to the statistics, I could expect substantial impairment within 5 years, serious handicaps that interfered with a job within 10 years, very severe limitations including loss of bladder and bowel control within 15 years, and death within 20 years. I was horrified. The thought of becoming bedridden and incontinent, of undergoing the subtle loss of mental functioning, filled me with dread. But I reminded myself I still had not been examined by a doctor. No objective diagnosis had been made. Finally, I couldn't keep my worries to myself. The internist at the health services listened to my story, did an examination, then named a neurologist he wanted me to see. I said I would call. "No," he said, "I'll call. Maybe he can see you right away." The neurologist saw me that day. He was young and brisk. I sweated profusely while he examined me. When he finished, he said I could get dressed and come into his office. I dressed and went to the office. "Well," he said briskly, "you have had a demyelinative episode." "Does that mean I have it or not?" I asked. I couldn't bring myself to say the words. "You mean, do you have multiple sclerosis?" "Uh-huh," I said. "Well," he said, "you have had a single attack, yes." I felt as if a great powerful wave washed over me, knocked me down, spun me around in boiling surf. I felt as if I were drowning in this man's office, sitting in a chair facing his desk. The neurologist started speaking very quickly. "But let me tell you how to think about this," he said. "I assume you've been reading up on it." "Yes." "Well, the books are wrong. Listen to me and forget the books." "Sure," I thought. Try and cheer me up. "The books are based on old and inadequate data. I'll tell you how to look at this disease, or really this syndrome, because it's more a syndrome than a disease." He spoke fast and loud, realizing that my attention was wandering, that I was withdrawing into myself in panic. He said that a large percentage of people had a single episode like mine sometime during their lives. Most people would never consult a doctor about it, and so doctors had no idea how common a single episode might be. But he thought they were very common, perhaps occurring in as much as 90% of people. He told me that several of my classmates had had such single episodes. Only one had had subsequent episodes. So the question in my case was whether I would have no further attacks at all, or whether I would have occasional attacks and experience some loss of function, or whether I would have frequent and severe attacks and serious difficulty in my life. Think of this as a heart murmur, he said. It's a warning of a possible problem, but you can't say now whether a heart murmur will remain asymptomatic all your life, whether it will give you some trouble, or whether you'll die of it. You'll simply have to wait and see. How long do I have to wait to find out what sort of case I have? I said. 2 to 5 years, he said. If you have no further attacks for 2 years, I think you can relax. And if you have no symptoms for 5 years, I think you can forget about it completely. He then discussed what I could do in the meantime. The answer was, basically, nothing. Multiple sclerosis was a disease of unknown cause. There were some helpful treatments during acute episodes, but no cures. Since there wasn't anything to do, he said I should take care of my general health and avoid stress and mental upset, but otherwise try not to think about it. This neurologist was so straightforward, so matter-of-fact, that I was able to leave his office and go back to the wards to work. Despite the bad news, I was okay. 2 days later, the internist called me in. He said he had gotten the report from the neurologist. He asked me how I felt. I abruptly started to cry. I was embarrassed to be crying in this man's office, but I couldn't help myself. The internist said he wanted a second opinion, and sent me to Dr. Derek Denny Brown, who was the most famous neurologist at Harvard at that time. I had had lectures from Dr. Denny Brown. I was not happy to be seeing him now as a patient. He told me the same thing. Yes, I had probably had an episode. Yes, I would have to wait and see what would happen in my case. Yes, it would be 2 to 5 years of waiting. Yes, I had the disease. Yes. I cracked completely. I couldn't go back to the wards. I just went AWOL for a few days. I cried constantly. I was terrified and sad and angry. I had just celebrated my 26th birthday. I was just beginning to be successful as a writer. I was starting to look forward to leaving medicine and beginning a career as a writer. And now this dreadful shadow. Each morning I woke up tense, wondering if I was blind or numb in another part of my body or paralyzed, and I was going to have to wait years to find out for sure. I could hardly bear to wait a week. How could I wait 2 to 5 years? The suspense was intolerable. But since there was nothing I could do, eventually I had to go back to work, to resume some normalcy in my life. My internist said I should see a psychiatrist. Had I ever met Dr. Corman? Yes, I said, I was well acquainted with Dr. Corman. Dr. Corman listened to my story and sniffed. Actually, he said, there is a third possibility besides spinal cord tumor and multiple sclerosis. What's that? Conversion hysteria. Oh, come on, I said. Conversion hysteria was an old psychiatric concept. Back in the 19th century, people, usually women, developed all sorts of bizarre symptoms, including seizures, blindness, and paralyses that had no organic cause. These were considered hysterical symptoms in which the patient converted some psychological problem into a physical manifestation. I certainly knew such things happened. In the clinic, I had treated a young woman with hysterical blindness. She would just become blind from time to time, then regain her sight. She was obviously screwed up. I had also seen one case of pseudocyesis, hysterical pregnancy. This woman developed all the signs of pregnancy and actually went into labor, though of course she didn't deliver a baby since she wasn't pregnant. That's not me, I said. I'm not hysterical. Really? Of course not, I said, insulted. I pointed out that hysterics were mostly women. "We're seeing more hysterical men," Dr. Corman said. I pointed out that in cases of conversion hysteria, patients showed a characteristic indifference to their diseases. They weren't really worried. My woman who went blind from time to time complained about it, but she wasn't as upset as you might expect, whereas I was extremely upset about my case. "Really?" Dr. Corman said. He was annoying me. I said so. "Well," Dr. Corman said, "if I were you, I'd consider the fact that, of all your possible diagnoses, conversion hysteria is actually the most favorable." I didn't believe that I was hysterical. Later on, other doctors who followed my case mentioned this possibility too. Although the numbness continued for several years, I never developed further symptoms. And I learned that it was indeed common to have a single neurological episode. Fortunately, I have never had another. I have learned to knock on wood and to take good care of my general health. Almost 10 years passed before I could look back and wonder whether the decision to leave medicine was so difficult, so traumatic, that I needed the added boost of a serious illness, or at least a possible illness, because the immediate effect of the terrifying diagnosis was bracing. I was forced to ask myself what I wanted to do with the rest of my life, how I wanted to spend it. And it was clear to me that if, in fact, I had only a few years of unencumbered activity, then I wanted to spend those years writing and not doing medicine, or any of the things that colleagues, friends, parents, or society in general expected me to do. The illness helped me to stand on my own, to make a difficult transition. In quitting, I was following my instincts. I was doing what I really wanted to do. But most people saw only that I was giving up a lot of prestige. In those days, the prestige of physicians was high. Polls ranked doctors just below justices of the Supreme Court. To quit medicine to become a writer struck most people like quitting the Supreme Court to become a bail bondsman. They admired my determination, but they thought I was pretty unrealistic. Then, in my last year of school, it became publicized that I had written a book called The Andromeda Strain, and sold it to the movies for a lot of money. Overnight, I was identified as a successful writer, and it changed everything in my life. All the doctors and residents who had shunned me became suddenly interested in me. I had been eating lunch alone. Now I was never alone. Everybody wanted to sit with me. I was a celebrity. The blatant insincerity of the way I was treated troubled me very much. I didn't yet understand that people used celebrities as figures of fantasy. They didn't want to know who you really were, any more than kids at Disneyland want Mickey Mouse to pull off his rubber head and reveal that he's just a local teenager. The kids want to see Mickey, and the doctors in the cafeteria wanted to see young Dr. Hollywood. And that was what they saw. I just sat around and watched them do it. The difficulties I experienced adjusting to my new position barely hinted at the kinds of experiences I would later have. Many of those experiences have been painful and difficult, but most have been, on balance, exciting. I often think back to medicine and my life as a student. I wouldn't have had to change if I had remained a doctor. Quitting medicine assured me that I would be forced into all sorts of changes I might not otherwise have made. Travels, 1971 to 1986. Sex and Death in L.A. In 1971, I was living in Los Angeles, and my wife was in La Jolla. We had separated because after 5 years together as students, she wanted to start a family, and I wanted to pursue my career in books and movies. That was why I had gone to Los Angeles, to try to work in movies. Los Angeles was a strange city. I didn't know anyone there, and I was lonely and unhappy much of the time. I moved into an apartment building in West Hollywood that was well known as a place where people went when they got divorced, because you could rent a furnished apartment for only 6 months. My apartment was furnished in green crushed velvet couches and chairs with a vaguely Mexican look. The carpet was green with gold flecks. The kitchen was yellow. The view overlooked the Sunset Strip. It was Hollywood, all right, and it was exciting. In the afternoons I would sit by the swimming pool. The same group of tenants could always be found at the pool. There was a Rams football star and his actress girlfriend. They were always fighting. There was a model who had been Miss Arizona and was extremely beautiful in a bikini. She was always shy and insecure. There was an accountant with a portable radio and a big cigar who read the New York papers. He never spoke. There was a woman in her 30s reputed to be a madam. She always swam laps and then read the Hollywood Reporter. I had imagined that living in a Hollywood apartment would be more exciting than it was. The football player and his girlfriend made an attractive couple, but since they were always glaring at each other, I tended to stay away from them. And the lovely Miss Arizona was recuperating from an unhappy marriage to a rock-and-roll star. She never went out at all. She stayed home and watched television and worried about her car payments. There were some movie stars in the building, too, but they always wore dark glasses and never talked to ordinary people. Later, the accountant with the cigar stopped coming to the pool. I asked Miss Arizona if he had moved out. She showed me a newspaper clipping. The man had been found in the trunk of a Cadillac at Kennedy Airport with a bullet in his head. You never knew what to expect. One night I was getting dressed for dinner when the front doorman knocked on my door. "Dr. Crichton." "Yes?" "It's Miss Jenkins." "Miss Jenkins?" An unfamiliar name. "In the building, you know, Miss Jenkins." "I don't think I do." "Well, she lives in the building. I thought you might have seen her." "What about her?" "She fell off the commode." I couldn't see why that was any business of mine, and I said so. "I think you should see her." "Why?" "She fell off the commode." "Well, did she hurt herself?" "It is only one floor up on the 8th floor." "But why should I see her?" "Because she fell off the commode." This conversation could go on forever. In the end, he led me upstairs and with a grave dignity unlocked the door to Miss Jenkins's room. Her apartment also contained green crushed velvet furniture in a Mexican style. I recognized Miss Jenkins as a bespectacled woman of about 40 with short blonde hair, the younger of a pair of lesbians who had lived together in the building at least as long as I had. Miss Jenkins was now fully dressed, lying on her back on the living-room couch, one arm dangling limply on the floor. Her skin was pale blue. She did not seem to be breathing. Her lover, the other woman, was not there. "Where is the other woman?" I said. "Walking the dog." "Walking the dog? Does she know about Miss Jenkins?" "Yes, she's the one who told me." "What did she tell you?" "That Miss Jenkins fell off the commode." By now I had quickly checked Miss Jenkins, noting a thready pulse, shallow, intermittent respiration, dilated eyes, an open can of beer, and a half-empty bottle of sleeping pills. The doorman said, "Is she dead?" "No," I said. "No?" He seemed surprised. "No," I said. "She's taken an overdose." "I was told," he said, "that she fell off the commode." "Well, the problem is a drug overdose." "You can help her?" "No," I said. "Aren't you a doctor?" "Yes, but I can't do anything." And indeed I could not. I was not licensed to practice medicine, and I faced serious lawsuits if I did anything at all in this situation. "Call the police," I said. "I did," he said, "although at the time I was not sure if she was dead." "She's not dead," I said. "What did the police say?" "They said to call the fire department." "Then call the fire department," I said. "Why should I call the fire department?" he said. In the end, I called the fire department, and they said they would send an emergency vehicle. Meanwhile, her roommate returned with a yapping Lhasa Apso on a rhinestone leash. "What are you doing in my apartment?" she said suspiciously. "This man is a doctor," the doorman said. "Why don't you help her?" "She's taken a drug overdose," I said. "No, she fell off the commode," the roommate said. She was a tall, slender woman of 50, graying hair, a stern manner. She looked like a schoolteacher. "Do you know what drugs she took?" I said. "Are you really a doctor?" the woman said. "You look too young to be a doctor." By now the Lhasa was jumping on the comatose woman, licking her face and barking at me. The dog was leaving muddy footprints on Miss Jenkins's blouse. The scene was becoming chaotic. The roommate turned to me, holding the beer can. "Did you drink this beer?" "No," I said. "Are you sure?" She was very suspicious. "I just got here." She turned to the doorman. "Did you drink this beer?" "No," the doorman said. "I came with him." "This beer can wasn't here before," she said. "Maybe Miss Jenkins drank it." I checked Miss Jenkins's pupils again, and the Lhasa Apso bit my hand, drawing blood. The roommate saw the blood and began to scream. "What have you done to Buffy?" She grabbed the barking dog into her arms, and then she began to kick me, shrieking, "You bastard! You bastard! Hurting a poor innocent dog!" I was trying to avoid her kicks, and I looked at the doorman. "Can't you do something about this?" "Shit, man," he said. There was a loud knock on the door, but nobody could get to the door because the roommate was kicking and fighting. Now she was shouting, "You robbed me! You robbed me!" Then we heard a loudspeaker voice say, "All right, you people inside, stand clear of the door. We're coming through." "Shit," the doorman said. "Cops." "So?" "I'm carrying." "Aha!" the roommate shouted. "I knew it." She flung open the door, and there stood a fireman in a yellow slicker and pointed hat, standing with his axe upraised. He was ready to hack down the door, and he looked disappointed to have it opened instead. "What the hell's going on in here?" he said. "She fell off the commode," the roommate said. "Did you put it out already?" the fireman said. "I was walking the dog. I don't know what happened." "There isn't any smoke," the fireman said suspiciously. "What are you people up to?" "This woman's had a drug overdose," I said, pointing to Miss Jenkins on the couch. "Hell, then we need the paramedics," the fireman said, looking at the woman. He called on a walkie-talkie. "There's no damn fire here," he said. "Who reported a fire?" "Nobody reported a fire," I said. "Somebody sure as hell did," the fireman said. "This man is not a doctor," the roommate said. "Who are you?" the fireman said. "I'm a doctor," I said. "Then I'd like to know what he is doing in my apartment," the roommate said. "You got some identification?" "I called him," the doorman said, "because he's a doctor." "He is not a doctor." "All I want to know is who reported a fire, because that's against the law." "Coming through," the paramedic said, arriving at the door with a stretcher. "Never mind," the fireman said. "We already got a doctor here." "No, come in," I said to the paramedics. "You don't want to treat her?" the paramedic said. "I'm not licensed," I said. "He's no doctor. He cut Buffy." "You're not what?" "I'm not licensed." "But you're a doctor, is that right?" "Yes." "I've never seen him before in my life." "I live in the building." "And he drank my beer." "You drank her beer?" "No, I never drank any beer." "I think he took something, too." "You mean this beer here?" Meanwhile, the paramedics were working on Miss Jenkins, getting ready to take her to the hospital. They asked what drugs she had taken, but the roommate would only say she had fallen off the commode. The fireman was giving me a hard time about being a doctor, until Buffy leaned over and bit him viciously on the hand. "Son of a bitch!" the fireman said, reaching for his axe. "Don't you dare!" screamed the woman, clutching her dog. But all the fireman did was take his axe and head for the door. "Jesus, I hate Hollywood," he said, and he slammed the door behind him. I was out the door right after him. "Where are you going?" the fireman asked me. "I have a date," I said. "I'm late." "Yeah, right," he said. "Only think of yourself. You guys, shit." It turned out the manager had listed my name on the lobby board with an MD after it, because he thought it gave the building class. Whenever there was a suicide attempt, the doorman would look at the building directory and call the doctor. I was the only doctor. I got all the calls. It was a large building. There was a suicide attempt nearly every week. The second time it happened, I told the doorman right away, "I don't have a license. I don't practice. There's nothing I can do." "Would you just check him? I'm pretty sure he's dead." "How do you know?" "He jumped from the 12th floor. Would you just check him, make sure he's dead?" "Okay, where is he?" "Out front." I went with him to the lobby. There was a woman crying. I recognized her as a girl from Atlanta who had come to Los Angeles to sell cosmetics, but who hoped to get discovered for the movies while she was here. She was always heavily made up. Now she was sobbing. "Oh, Billy, Billy." I hadn't been aware this girl had a boyfriend. I looked at the doorman. He nodded sadly. "Billy jumped from a balcony." "Oh." We went out to the street. "Did you call the police?" I said. "Do I have to?" "Of course," I said, "if he's dead." Out on the street, I didn't see a body immediately. I was tense now, steeling myself against what I might see, wondering how bad it would be, how gruesome. We walked around the side of the apartment building. Then the doorman pointed to some low bushes that were planted near the building. "Billy's in there." "In there?" For an awful moment I thought Billy might be a child. I walked forward to the bushes and saw the body of a yellow cat. "Billy's a cat?" I said. "Yeah." "You called me out here for a cat?" "Sure, what'd you think?" "I thought it was a person." "No, hell. Person jumps, we always call the police." Psychiatry. My wife called me in Los Angeles almost every day. She thought we should get back together, but I wasn't so sure. She suggested I see a psychiatrist. I refused. I didn't think psychiatry did any good for people. It was just a lot of hand-holding. One day, she called to say she had gotten the name of a psychiatrist in Los Angeles for me. This man, Dr. Norton, had worked with a lot of writers and artists, and he was very eminent, a professor at UCLA. She said I should go to see him. I didn't want to. Then she said, "He probably won't take you anyway. He's so important and busy." I was immediately offended. Why wouldn't he take me? Wasn't I an interesting person? Wouldn't he find my case interesting? I called his office immediately and scheduled an appointment. Arthur Norton was a fit, tanned man nearing 60. He explained he didn't usually take new patients, but he would hear my problem and then refer me to someone else. I said okay. I now found myself in a peculiar situation. I didn't really believe in psychiatry, I didn't want to see a psychiatrist, and I didn't think there was anything wrong with me, but I was challenged to present myself to Dr. Norton in a fascinating way. For an hour, I revealed all my most unusual sides. I made jokes, I expressed provocative opinions. I really worked hard to interest him in me. I kept glancing at him out of the corner of my eye to see how I was doing. He appeared friendly, but completely unreadable. At the end of the hour, he said that he thought I had some life issues to consider, and that during this period I might benefit from talking about them, and he offered to serve as the person I talked to. Aha! Success. I left the office elated. I had talked him into it. But I still wasn't sure psychiatry did any good, and it was expensive, $60 an hour. Anything that cost so much must surely be an indulgence. Rich, lazy people went to psychiatrists. I decided to keep track of how much it was costing me to see Dr. Norton, and I assessed each session when it was over to determine if it had been worth the $60. I found Dr. Norton puzzling because he was so normal. I'd tell him my story, and he'd say things like, "Time will tell," or, "You can't make an omelet without breaking eggs." I thought, $60 an hour to hear you can't make an omelet without breaking eggs? What good is this? But I enjoyed going to him and complaining about my life, how I had managed to survive all the people who had abused me. I had a lot of energy for this sort of complaint, and he seemed sympathetic. Then, on the 5th session, $300 down the drain so far, he said, "Well now, let's see where we are." "Okay," I said. Dr. Norton said, "You've explained that as a child you didn't get any approval from your parents." "Right. If you got a 98 on a test, they wanted to know why it wasn't 100. "Right. They never appreciated or complimented you." "Right. They belittled your achievements." "Right. And now, as an adult, when you write a book, you are fearful that you won't be accepted even though you always seem to be. Right. And you feel that you have to do whatever other people want. People call you up and ask you to give a speech or to do something, and you can't say no to them. Right. People won't leave me alone. In general, you feel you have to please people or they won't like you. Right. Okay, he said. What kind of person are you describing? I suddenly went blank. I couldn't remember what we had been talking about. My mind was absolutely empty. I was enveloped in a confusing fog. I don't understand what you're asking me, I said. Well, he said, you're a doctor. If you were presented with a person who never received praise and encouragement no matter how hard he worked, who felt that what he did was never enough, and who as an adult was very unsure of himself and easily manipulated by total strangers, what kind of person would you say that was? I don't know, I said. I had no idea at all. I could see Dr. Norton was driving at something, I just didn't know what. I was still in a fog. I couldn't seem to organize my thoughts or to keep track of things. I was disoriented, dazed. I stared at him. He waited calmly. There was a long silence. I'm sorry, I said. What was the question again? Dr. Norton tried a few more times to get me to see it, but I couldn't. And finally he said, Aren't you describing an insecure person? I was stunned. He had laid out all the evidence. I couldn't deny the conclusion. And the very fact that I couldn't see where the evidence pointed was itself significant. He was telling me I was insecure, and he was obviously right. I felt amazed. Just as amazed as if he had shown me that I had a third arm coming out of my chest, an arm I had never noticed before. How could I not have noticed this before? But I never thought I was insecure. If anything, I saw myself as astoundingly confident. Could I really have held such an incorrect view of myself? Dr. Norton tried to soften the blow and explained that many things about ourselves were difficult to see without outside help. That was the whole point of a therapist. He was an objective outsider. This was a new idea to me, that there might be some things about myself that I couldn't see without outside help, but it obviously was true. I never kept track of how much I was spending again. It became clear that my marriage was finished, and that I was going to remain single in Los Angeles. I was in my late 20s. I had a reputation as a writer, I had a psychiatrist, and I had a Porsche Targa. In short, I was ready for whatever life had to offer. But my academic past had left me rather sheltered, and I was unrealistic, particularly where women were concerned. I kept imagining that I could do things that I couldn't. At one point, I was going out with a girl who worked in a literary agent's office. Pretty soon, I decided I liked another girl in the same office. I wanted to go out with this second girl, but I didn't want the first one to find out. Do you think I can keep it secret? I asked Dr. Norton. No, he said. Why not? I think two girls in the same office will talk, and they'll discover they're both going out with you. Even so, I said. Is that so bad? Well, I think they may both decide not to see you. That seemed an unpleasant outcome. I didn't like the idea of going from two girls to none. Oh, I don't think that would happen, I said. Dr. Norton shrugged. Time will tell. Of course, that's exactly what happened. The girls found out, and they were both indignant that I would try such a low trick. Later, I began to get interested in my secretary, a cute blonde with large breasts. I'd never been involved with a large-breasted girl before. I think I'm falling for my secretary, I told Dr. Norton. Don't, he said. Why not? I said. I couldn't see why it would be a problem. It tends to complicate not only your work but your private relationships as well. That seems to be what usually happens. At least it happens often enough to lead to the rule that it's unwise to get romantically involved with your secretary. Well, I said, maybe that's the rule for most people, but I think I can handle it. Time will tell, Dr. Norton said. Within 2 weeks, my life was living hell. I quickly learned this cute, large-breasted girl was not for me. I knew it, and she knew it, too. Suddenly nothing worked right in the office. Things didn't get done. Callers were insulted. Appointments were missed, details overlooked. And my cheerful, sunny California secretary now filled the office with glowering rain clouds. Her every word and comment to me was sour and accusing. I couldn't believe it. Not only had our affair not worked out, now I was going to have to fire her. What a mess, I said to Dr. Norton. Hell hath no fury like a woman scorned, Dr. Norton said. By now I saw the point of these homilies. Dr. Norton was trying to get me to understand that certain rules of life had been around for a long time, and that life probably wasn't going to make an exception for me. I was having trouble understanding precisely that. I kept thinking that things would be the way I wanted them to be, and I kept learning I was wrong. I had been going out for several months with a girl I liked when I met a famous movie star. Suddenly I wanted to go out with this movie star, but I figured it would be a short-lived thing that would quickly end, and I didn't want my regular girlfriend to find out. If you date a famous movie star, your girlfriend's going to find out, Dr. Norton said. How? I said. I'm just going to dinner in an out-of-the-way restaurant. It turned out my out-of-the-way dinner was reported the same night by a television gossip columnist. Not only my girlfriend, but all her family and friends found out what I had done. My girlfriend broke up with me. I was considered a rat. I felt pretty bad, too. I couldn't seem to manage my social life. I blamed my sex drive. I can't help it, I said to Dr. Norton. I'm going out with some girl, and then I see another girl, and I want her. And then I see another girl, and I want her too. Uh-huh, he said, noncommittal. When is it going to stop? I said to Dr. Norton. Maybe when I get older, maybe in a couple more years I'll calm down sexually. It'll stop then. Well, he said, I'm almost 60. He shrugged. It never stops, I said. I couldn't decide whether to be pleased or appalled by this prospect. Dr. Norton had a different idea about the nature of my problem. He seemed to think I kept getting into trouble because I wasn't telling women the truth. He thought I should tell them all that this was a time in my life when I was seeing a number of women and leave it at that. That way you don't have to be secretive, he said. But I couldn't do that, because I was afraid none of the women would like me if they knew I was seeing other women. A year later, I got divorced. I bought a house in Hollywood. My life settled down a little. I managed to write some screenplays, and I tried to set up a movie to direct. I liked my life pretty well, but I was moving further and further from the academic existence I had known for so many years. Many things about movies perplexed me. For example, all the people in the movie business lied. They lied all the time. They said they liked your screenplay when they didn't. They said they were going to hire you when they had no intention of hiring you. I couldn't understand why movie people didn't just say what they meant. It was so confusing. Why did everybody lie? And there seemed to be a different style in movies from the academic style I was used to. In talking over a movie, the studio head said, "What about casting Joe Mason?" "I don't really think so," I said. Then, the next week, we had another casting meeting, and the studio head said, "What about Joe Mason?" "He's not really right," I said, and I never liked him myself. Then, at the next meeting, the studio head said, "What about Joe Mason?" By now, I was frustrated because the movie wasn't getting cast. I stood up and leaned over his desk and shouted, "I can't stand Joe Mason. He makes me vomit whenever I see him. I hate Joe Mason." "Hey," the studio head said, raising his hands. "All you have to do is say so. So I began to learn that the ordinary, everyday style of communication in Hollywood required what was, in academic terms, wretched excess. You were expected to shout and scream and carry on in a way that would never have been acceptable at Harvard. But apparently in Hollywood, they didn't listen to you unless you shouted and screamed. And the Hollywood environment was exotic. There were homosexual and theatrical people, and people who were into drugs and orgies and odd things of all sorts. This had its own fascination, but I often felt uneasy. Eventually I was going out with a girl who was a famous sex symbol. I was quite pleased that I was going out with a famous sex symbol, although we never really had sex. She wasn't interested in sex, and she bathed infrequently, so she had strong odors, which deflected my enthusiasm. But she was a lively, friendly person, and I enjoyed spending time with her. One day she called to say she'd be late because she was going to see a psychic. This didn't surprise me. Hollywood people were into all this loony stuff, psychics and astrology and peculiar diets. Everybody was interested in what your sign was. "What's your sign?" I used to answer, "Neon." It was a lot of foolishness. When she showed up, she was very excited. "Michael, you have to see this woman." "Why?" I asked. I didn't believe in psychics. "Listen," she said. "This woman told me stuff nobody could possibly know." Sure, I thought. That's what they always say. "No," she said. "Listen, I ran out of money and I had to get a job, so I made a low-budget movie in the Philippines. I never told anybody." I certainly didn't know about this film she had made. "And while I was there, I met this pilot in the Air Force, and he used to take me for rides in his jet fighter." I didn't know about that either. "Well, this psychic told me all about it, and there's no way she could have known." I wasn't impressed. "Go and see for yourself." I didn't want to go. It was a waste of time and money. Later on in the evening, I was talking about a movie called Westworld I wanted to make. The studio, MGM, was behaving in a discouraging fashion. One day they said they were going to make it. The next day they said it was off. I was worried about what would finally happen. "Go and ask her, Michael." And she made the appointment for me to see my first psychic. The psychic was a British woman, about 50, wearing a quilted housecoat in the middle of the afternoon. She lived in a small frame house in the San Fernando Valley. She kept all the shades drawn, so it was dark and gloomy. She led me into a back room with barbells on the floor and an exercise bicycle to one side. The room smelled of talcum powder. And it was dark with the shades drawn. And she sat me down on a bed, and then she sat next to me. She took my hand. "Just relax, love," she said. She was silent for a moment, holding my hand. I decided that, as long as I was going to a psychic, I'd try to help the process along by making my mind a complete blank. Sitting with her, I tried not to think about anything, but just to be blank. "What are you doing?" she said after a few moments. "I can't read you. What are you doing?" "I'm trying to make my mind blank." "Well, just relax. Don't try to do anything." "Okay," I said. So I just stared at the barbells and the exercise bicycle, and then she began to talk. "I see you surrounded by books," she said. "Lots and lots of books." She said I had a project that was up in the air, but that I shouldn't worry, it was just a little premature. The project would begin in late February. I found it quite agreeable to be with her, and not at all weird, the way I imagined it would be. She was just a lady who seemed to get things out of the air and talk about them. I felt as if I was listening to her daydreams about me, that sort of feeling. But I knew what she was telling me was wrong. This was now November. MGM had set its final decision for December 15th. No matter what the studio said at that time, there was no way to begin the picture, either at MGM or elsewhere, by February. So she was definitely wrong. And she said that I was drawn to psychic and spiritual things. That was wrong, too. I was a scientist. I had no interest in this stuff. And she said I was psychic myself, which proved to me, if proof were necessary, that neither of us was psychic, because I knew I wasn't. She made some other comments about my past and my family, but nothing unambiguous. Sitting there with her, I began to imagine how I would recount this experience for the amusement of my friends. Psychic? Some woman in her bathrobe sitting in a room with barbells? Give me a break. A few weeks later, on December 15th, MGM canceled Westworld. As far as I was concerned, that was the final nail in the psychic coffin. Then 2 days later, MGM changed its mind. The studio would make the movie after all, if the producer and I would agree to an absurdly tight production schedule. We didn't like the schedule, but we wanted to make the movie, so we agreed. The movie began shooting on February 23rd of the following year. So I had to admit that she had gotten one thing right. But by then I had lots of other things on my mind. I was finally shooting a movie. In August of 1973, I was flying back from Chicago, where I had screened Westworld. It appeared the picture would be successful. The producer and I had survived an impossible budget and an impossible schedule to shoot and release a picture in 6 months. Many people had predicted we couldn't do it. Some had even bet their jobs we couldn't. Heads would soon roll at the studio, but not ours. Now, with the intense pressure abruptly ended, the producer and I shared in a mood of almost hysterical self-congratulation. We had done it. Not only had we made our dates, but the little low-budget picture actually seemed to work. Sitting on that airplane, we literally felt on top of the world. Suddenly, I broke out in a drenching sweat. My clothes were soaked through within seconds. I was panic-stricken in the grip of a powerful anxiety attack. But why at this instant of airborne elation? It took a while to figure it out. All my life I had pursued clear goals. In high school, to get into a good college. In college, to get into medical school. In medical school, to become a writer. As a writer, to make a movie. I was 30 years old. I had graduated from Harvard, taught at Cambridge University, climbed the Great Pyramid, earned a medical degree, married and divorced, been a postdoctoral fellow at the Salk Institute, published 2 best-selling novels, and now had made a movie. And I had abruptly run out of goals for myself. I was stranded within my own life. That was why I broke into a sweat. What was I going to do now? I had no idea. In the following weeks I fell into a lethargy, then a full-blown depression. Nothing seemed worthwhile. Needless to say, sympathy for my condition was in short supply. To be depressed by success was not attractive, or even understandable. My friends didn't realize that they might be next in line. I took to haunting bookstores, buying $500 worth of books at a time, carrying them off in cartons. Books on every conceivable subject: dinosaurs, hot air ballooning, Charles II, saturation diving, Islamic art, weather forecasting, computer graphics, Indonesian cooking, criminology, Benjamin Franklin, the Himalaya, Victorian cities, high-energy physics, tigers, Leonardo da Vinci, the British Raj, witchcraft, vegetarian cooking, the Inca Empire, Winslow Homer. Since nothing interested me, everything was equally uninteresting. One day I came across a book called Be Here Now. It was an esoteric, quasi-religious Eastern philosophy book of the sort I didn't usually look at, but it had a handmade quality and an odd shape that caught my eye. The author was Ram Dass, formerly Richard Alpert, an expelled professor of psychology at Harvard. I had been a reporter on the Harvard Crimson during the 60s when Alpert and his colleague Timothy Leary were thrown off the faculty for giving LSD to undergraduates. I remember those incidents well. Now, here was his book. I took it home and read it. The book was in 3 sections. The first section contained straightforward prose. The second section consisted of hand-printed words and pictures, a kind of messy collage. The third section was a guide to meditation. I read the first section. I expected to find the disorganized ramblings of a poor fellow whose brains had been scrambled by too much acid and too many mystical journeys that went nowhere. But instead, I found a lucid history of a driven, successful East Coast intellectual who suddenly found his life, his houses, his cars, his lovers, his vacations, his work to be unsatisfying. I knew exactly what he was talking about. I felt exactly the same way. Richard Alpert, a Harvard renegade, an obviously unbalanced man who had gone off the deep end of his life, now appeared before me as somebody I identified with strongly. I had a juggling act to do, to make it all right for me to agree with him. Richard Alpert must have something on the ball after all. But there was a further implication. Alpert, now Ram Dass, the new name stuck in my throat, I didn't even want to say it, Ram Dass had gone to India. And after several years he had come back with answers that seemed to work for him. He seemed to feel better about things, to have found a new perspective. He had made a pilgrimage to India. Should I? I couldn't stand the idea of it, the implications of it. I couldn't see myself as a holy seeker after truth, wearing white robes, contemplating my navel. I still shopped at Brooks Brothers. I still liked Brooks Brothers. There had to be another way. My attitude toward mystical journeys was typified by the joke about the student who seeks the holy man in India, finds him meditating at the top of a mountain, and asks breathlessly, "What is the meaning of life?" The holy man says, "Life is a flower." The student is outraged. "Life is a flower?" To which the holy man replies, "You mean it's not?" That was my idea. Nobody knew any more than I did. Not really. A professor might know more about his particular subject, and the resident of a city might know more about that city, but as far as reality was concerned, nobody knew any more than I did. I figured I knew all there was to know. What I knew was that the history of man demonstrated the inexorable triumph of reason over superstition, culminating in our acceptance of science as the best method for learning the truth and exploring the universe. That in the past men had believed all sorts of nonsense, but through the fruits of science we were able to roll back the darkness and live in the light of reason. This meant that, however bad life might be now, it could only have been worse in past ages. The history I envisioned was a history of steady progress. Nothing was lost, only gained. In no way were the people of, say, the Middle Ages better off than I was. That was inconceivable. Medieval people were suffocated by their social structure, impoverished by their economy, and driven by their religion to make those idiotic, if beautiful, cathedrals. I lived in a fast-paced scientific world, where technical journals were removed from the library after 5 years. In general, I preferred to look forward. We lived in an exciting time in which we were learning the nature of reality at the subatomic level, the nature of the universe, and the nature of life. I was living in the most enlightened, the richest, the most advanced, the most liberated period in the history of man. And I knew that despite fame, fortune, and psychiatry bills, I was miserable. And it seemed Ram Dass was not. I reread his book several times, trying to find another way, my own way, in his story. Each time I read the book, what Alpert was saying seemed to make more sense. It became more straightforward. It became more clearly a better way to behave, a better way to look at things. But I still wasn't about to give up my life and go to India. What I did was, I read books. There was a bookstore called the Bodhi Tree that specialized in these esoteric areas. I went there a lot, and pretty soon names like Krishnamurti and Yogananda were as familiar to me as Watson and Crick, or Hubel and Wiesel. And I went a lot to Maui. In the early 70s, Maui was a wonderful place. You could go diving and listen to the mysterious underwater songs of the humpback whales. You could hike into lush hidden valleys without being shot by dope growers. In 2 hours, you could go from the beach to the freezing summit of Haleakala, 10,000 feet above sea level. Inside the crater of Haleakala, there were at least 3 distinct environments: cinder cone desert, alpine meadow, and tropical rainforest. The silence inside the crater, the unworldly appearance of the landscape made it especially impressive. In those days, Maui wasn't crowded. They hadn't built those monstrous hotels that appear to have been designed by Walt Disney and Albert Speer. Lahaina was a sleepy, run-down little town populated by hippies. The bookstores were stocked with spiritual books. I hadn't seen most of these books before. I first read the Seth books there, and Carlos Castaneda, and Ken Wilber. I read all sorts of books there for the first time. The other thing that I did was I began to travel again. Bangkok. I had traveled before. I had traveled all my life. My parents were inveterate travelers, and they took their kids with them. They'd cram all of us into the car each June when school was over, and we'd head off for some faraway destination. The Southwest and Mexico 1 year, the Pacific Northwest 1 year, the Canadian Rockies 1 year. By the time I graduated from high school, I had been to 48 states, to Canada and Mexico, and to 5 countries of Europe. After college, I won a Henry Russell Shaw Fellowship, and for a year traveled in Europe and North Africa. That was in 1965. A year of travel. What an opportunity. And as a student, I was obsessively thorough. I entered the museums of Paris and Amsterdam, loaded down with guidebooks and commentaries. If I was in a city where an important museum was closed, I stayed an extra day. I saw everything. I ate everything. I experienced everything. In Egypt, I climbed the Great Pyramid of Cheops, went inside it, and then visited every archaeological site of importance between Saqqara and Aswan. Nothing was too small or too distant to escape my inspection. It was never too hot or too buggy. If there was any question about it, I saw it. In Madrid, I sought out obscure apartment buildings that represented the early work of Antonio Gaudi. In France, I went down a checklist of buildings by Le Corbusier. I fought the traffic of Naples in search of Caravaggios. In France and Spain, I visited every prehistoric painted cave known. I developed an interest in Romanesque cloisters. In Greece, I spent 2 weeks in the Peloponnese alone, looking at classical sites outlined by the Guide Bleu. I used the Guide Bleu because it was the most detailed guide I could find. I preferred it even though I was obliged to struggle through the site descriptions in my bad French. So, by the time I started medical school, I could say, of all North America, Europe, and North Africa, I've been there. I knew my way around. I was comfortable with different languages, different currencies. My passport and luggage were suitably battered. I could enter a strange city, find a hotel, speak enough of the language to get along, to be at ease. I was an accomplished traveler. The financial pressures of medical school prevented much traveling during those years, and afterward I fell out of the habit. I didn't have much curiosity about other places anymore. I was pursuing my career, getting on with my life. Eventually I realized it had been almost a decade since I'd taken a real trip. When I hit my doldrums, I decided I had better get moving. I decided to go to Bangkok, where my friend Davis Pike had urged me to visit him. I booked a flight, cabled Davis that I was coming, and set off. My first stop was Hong Kong. There are few sights as exciting as landing in Kai Tak Airport in Hong Kong at night. The mountains, the water, the lights of the buildings make it magical, like flying into the center of a glowing jewel. I was tremendously excited as I looked out the window. And then, to step off the plane and be assailed by the smells, that peculiarly Asian combination of seawater, dried fish, packed humanity. My excitement increased tenfold. And driving in a taxi through the city, past the open, brightly lit stalls, people squatting on the pavement, working, all the street life, fantastic. I had never seen anything like this. I arrived at the Peninsula Hotel, and it appeared to me the grandest in the world. There was nothing in Europe like this. Everything was subtly different. There were white-liveried people on every floor to help you. The rooms were sumptuous, and in the elegant marble bathroom there was a carafe of drinking water and a little sign saying that you shouldn't drink the tap water. Fabulous! Exotic! This combination of expensive marble and the little sign. Europe had nothing like this. I went to sleep blissfully happy. I awoke the next day ready to see Asia. Guidebook in hand, I walked the streets of Kowloon, then took the Star Ferry to Victoria. I wandered, enjoying all the street activity. Then I went to the Central Market, thinking markets are always good to look at, a good orientation to how people live. I'd always enjoyed seeing the markets in rural France and North Africa. The Central Market was a 2-story open concrete structure with tiled surfaces. The place smelled like a morgue. They were slaughtering chickens and small animals right on the street. I saw one man slice open a pig's intestines on the sidewalk and sluice out the ruffled inner surface with a garden hose. Suddenly I was exhausted. I had to go lie down. It was jet lag catching up with me. I returned to my hotel and slept several hours. That afternoon I took a taxi to Aberdeen on the other side of Victoria. In those days Aberdeen was a spectacular place, a giant boat basin where thousands of people lived. I hired a boat and went for a tour of the basin. It was terrific to see the vignettes of life on the boats. I was excited again. Afterward I went to the onshore market in Aberdeen where the boat people purchased their food. The Chinese place great importance on fresh food. I would often see a Chinese woman carrying a plastic bag filled with water, with a live fish swimming inside it. This, I was told, was her family's dinner, kept fresh to the last minute. The Aberdeen market was under dark green tents, very extensive, very crowded. I got the kind of stares and jokes that I always get in Asia because of my height, but the Chinese are cheerful. I enjoyed the whole thing. I looked at the freshness and variety of the vegetables. I looked at the clothing and other things for sale. I came with some trepidation to the meat section. But I was psychologically prepared. The Aberdeen market did not upset me. I moved through to the section where they sold fish, men shouting the freshness and quality of their wares. One man had filleted his fish, about a dozen of them set in a sloping incline in front of him. Each fish had a red spot on it. The red spot pulsed. I couldn't imagine what that was. I looked more closely. He had filleted each fish with such skill that he had left the hearts intact. These exposed fish hearts were now beating as a kind of visual display and as a proof that his fish were fresh. I was looking at a dozen beating fish hearts. I had to go lie down. Soon I fell into a pattern of exploration, punctuated by some sight that would leave me unexpectedly exhausted, driving me back to my room to recuperate. But it was humiliating in a way. I was an accomplished traveler. These little experiences shouldn't bother me. Why was I getting so upset? I was sure it must be jet lag, but whatever the reason, my symptoms got worse. Some American girls picked me up and took me to a big Chinese dinner. The dinner was pleasant, but extremely strange. The first course was shrimps, little shrimps. We all peeled the shells with our hands and ate the shrimps. Then the second course came. We all dumped the shells on the tablecloth next to our plates to make room for the next course. And that's where the shells stayed, in a little pile next to each diner for the rest of the evening. Then there was toasting. The Chinese love to drink healths, and a dinner is continually interrupted by this routine. But I saw that everyone was drinking with one hand holding the glass, and one finger from the other hand touching the bottom of the glass. I asked an Australian woman seated next to me, "Why does everyone do this?" She said, "You have to drink a toast holding the glass with two hands, but a single finger from the other hand suffices." More courses. They kept coming for hours. You got accustomed to having something put in the center of the table, picking at it for a while, and then getting something else. At one point, a cooked fish, one of many, was placed in the center of the table. I was talking with someone, and I looked back. The fish was gone, picked clean. Yet it had only been there a few seconds. "What happened to that fish?" I asked. "That fish is a great delicacy," I was told. "Everyone appreciates that fish. That fish cost $400. Having missed this fish, I was alerted. I immediately made a stab with my chopsticks at each new thing put on the table. Pretty soon there was another fish everyone liked. In a few moments the top was picked clean. Now we were looking at the backbone and the flesh beneath. It seemed a simple matter to flip the fish over or to remove the backbone, but nobody at the table was doing this. The fish just lay there, half-eaten. Finally, I couldn't stand it. I said, "May I turn the fish?" "I don't know," said the Australian woman next to me. I said, "Is it acceptable to turn the fish?" "Yes, of course." "Then why isn't anyone doing it?" I asked. "Well, because of how they came here, I expect." "How they came here?" "And how they'll go home, of course." I didn't understand. We seemed to have drifted from the primary question of the fish. I said, "Then it's all right for me to turn the fish?" "How will you be going home?" she asked. "The same way I came here, in a taxi, I imagine." "But won't you cross over water when you go home?" "Yes." We had taken a little boat to come to this restaurant. "Then you can't turn the fish," she said. And she explained that if you were going to cross water after your meal, you couldn't turn the fish. "Perhaps if I just remove the backbone?" I asked hopefully. She shook her head. "Sorry." Then she said something quickly in Chinese, and the waiter came over and flipped the fish, and everyone started to eat again. "He lives here," the woman explained, nodding to the waiter. So it went on like that, with all of us sitting next to our piles of shrimp shells, drinking toasts with our fingers on the bottoms of the glasses, and nobody able to flip the fish. You never knew what would happen next. Finally, at the end of the evening, the guest of honor, an elderly man who was a Chinese movie star, gave a martial arts demonstration. He flung his body around the room, quick, agile, graceful, strong. He was 67 years old. I thought, there's a lot I don't know about. When I landed in Bangkok, I was met by my friend Davis, who had lived in Thailand for 5 years. "What were you doing in Hong Kong? It's so boring there. Completely Western. Not the real Asia at all. You'll have a much more interesting time here." Driving back from the airport, Davis gave me essential advice for getting along in Bangkok. "There are 4 rules you must never break while you are in Thailand," he said. "First, if you are in a temple, never climb on a statue of Buddha." "Okay." "Second, always keep your head lower than the head of a Buddha statue." "Okay." "Third, never touch a Thai person on the head." "Okay." "Fourth, if your feet are lifted off the floor, never allow them to point at a Thai person. That's very insulting." "Okay," I said. Personally, I thought that these circumstances were pretty unlikely. I told Davis I thought I could get through my visit to Bangkok without breaking any of his injunctions. "I doubt it," he said gloomily. "I just hope you don't break all 4. Next, he instructed me in how to say my street address in Thai. I was staying at Davis's house. He explained that I had to be able to tell a taxi driver where to go, and since the driver wouldn't understand English or read Thai writing, there was nothing to do but commit the oral address to memory. I still remember it. Sipjet Sukbumvit Sawi Yizip. Davis's house was beautiful, all elegant polished hardwood, opening onto a lovely garden in the back with a swimming pool. I was introduced to the servants, reminded to remove my shoes at the front door, and shown to my bedroom on the second floor. "Now, the Buddha in your room has been moved," Davis said. "We've put it on top of the armoire, which is the tallest piece of furniture in the room. But in your case, I don't know if—" No, you see, you're still taller than the Buddha when you stand. That's not good. I'll speak to the servants." "What about?" "Well, I think they'll agree to make a special case for you since you're so tall. But it would help if you would sort of hunch over when you're in the room, so you won't be taller than the Buddha any more than necessary." I thought, this is a single bedroom. No one is ever going to see me in here. I am all alone in here, and Davis is telling me to stay hunched over because of the Buddha? It seemed a little crazy, but I said I would try. I thought perhaps Davis was kidding me, but he wasn't. The Thais are wonderful, easygoing people, but they take their religion seriously, and they are not, in these matters, tolerant of foreigners. I later saw a Thai-censored version of a Peter Sellers film, A Girl in My Soup. To watch the movie was a bizarre experience. Peter Sellers would stand up from a table, and suddenly the Buddha statue in his wall niche would explode like a black ink sparkler, which continued until Sellers sat down again. Then you could see the peaceful Buddha once more. The Thai censor had inked out the image of the Buddha frame by frame whenever Peter Sellers was higher than the statue. So the Thais were serious, all right, and the servants were spoken to, and I stooped in the privacy of my bedroom. But technically one of the 4 rules was already broken. The next day we were walking down a Bangkok street, and we passed some young kids. They were cute and friendly as they clustered around us. I patted one on the head. "Ah," Davis said. 2 of 4 broken. "Buddhists," Davis explained, "believe the head, the highest part of the body, is sacred and shouldn't be touched. It's barely acceptable with kids, but don't ever touch an adult that way. I'm serious. In fact, it's better not to touch an adult Thai at all." Chastened, I said all right. That night we were at a dinner party, and I was talking with a Thai cameraman who shot commercials for Australian companies, as well as feature films for the Thai market. He was a very interesting fellow. We talked about crew requirements and methods of working. Then the hostess called us in for dinner. We walked together, and when we came to the door, I gestured for him to go through first, and put my hand on his shoulder to ease him through. It was a very natural, casual gesture. The cameraman stiffened for a fraction of a second, then went through the door. I looked over. Davis was shaking his head. So this second rule was more difficult than I had imagined. I had to watch my natural tendency to touch people. After dinner we sat on pillows around a low, round table. There was a Thai woman across the table from me. She was rather aloof, talking to someone else. As the night went on, she began to give me dirty looks. Later, she'd break off her conversation at intervals to glower at me. I didn't know what her problem was. "Michael," Davis said. Ah. I looked down at myself. Everything seemed okay. "Feet," Davis prompted. I was sitting on a pillow, leaning back on my elbows on the ground. My legs were crossed. My feet were fine. No holes in my socks. "Michael." Because my legs were crossed, one foot was off the floor, and pointing at the Thai woman. She was giving me dirty looks because my foot was pointing at her. I uncrossed my legs, put them flat on the floor. The woman smiled pleasantly. "Try and keep your feet on the floor," Davis advised. It's really the only way. 3 out of 4 rules broken. Meanwhile, I was making all sorts of minor mistakes as well. I could never remember to remove my shoes when entering people's houses. Also, I became enamored of the Thai greeting in which you bow and make a temple of your fingers in front of your face. This is called a why. I liked to do it, and the Thais were amused to see me doing it. One day, a little kid in a tailor's shop did it to me. I did it back. "Never why a kid," Davis said. "Oh, God," I said. By now I was becoming accustomed to my clumsiness. "Why not?" "To why an adult is a sign of respect. Why a kid? It shortens his life." "I didn't know." Never mind, the parents didn't seem too upset. At least I didn't break the 4th rule, about climbing on a Buddha in a temple. Tourists are jailed in Thailand for that. The Thai temples are exquisite, beautifully maintained. Often they sit as tranquil, gilded oases amid an ugly expanse of roaring traffic and gray concrete buildings. Thailand was the first Buddhist country I had ever been in. I was surprised by everything: the gaudiness of the temples, the way people behaved inside them, the flowers and the incense and the yellow-robed priests. But I also found that I liked being in these temples. I wasn't sure what I liked, certainly not the exhausting ornateness, but something. I liked the feeling. I liked the way the people behaved in a temple. I knew absolutely nothing about Buddhism. I didn't know what the religion taught, what its principles were. In one of the temples, a Thai who spoke English told me that Buddhists didn't believe in God. That seemed pretty extreme, a religion that doesn't believe in God. I found it interesting that I liked this religion, because for many years I had been vociferously atheistic and anti-religion. But here in the temple it was just peaceful. I went to a bookstore and started to read books on Buddhism. Other things were happening, too. Davis had a dinner party for Peter Kahn, who was then the Asia correspondent for the Wall Street Journal. I had known Peter from the Harvard Crimson many years before. He was still easygoing, funny, very smart, and very competent, but now there was also a tough, worldly quality that I admired. Peter had been a correspondent in Vietnam and had remained in Asia after the war was over. He could wear shirts with epaulets and get away with it. At the dinner party, I was seated next to an English hairdresser, whose hair was dyed red on one side of her head and green on the other. I suspected this might be the latest thing in London, but I wasn't sure. I didn't even know whether I should refer to it or not, so I kept my mouth shut. Conversation at dinner was desultory until someone casually mentioned that Peter had been to Hunza. Instantly the table became charged with excitement. Hunza? Really? How incredible! How fantastic! Nick Spencer, a neighbor of Davis's, was full of questions. "Did you go to Gilgit, then?" "Yes," Peter said. "Fly to Gilgit?" "Yes." "How long did that take?" "A week in Pindi." Not so bad." "No," Peter said. "It was all right." "And Chitral as well, did you?" "No, not this time," Peter said. I was trying to figure this out. Hunza, Gilgit, Pindi? Hunza was obviously some geographic location, but I was very much at a loss, and I couldn't imagine how everyone at the table could know so much about a place I hadn't even heard of. What was the appeal of Hunza anyway? Some sort of local resort? I never found out, because the conversation moved on. "Been to Bhutan as well?" "No, never," Peter said. "Can one go?" "Billy's been to Bhutan." "Has he? Never mentioned it to me. How'd he manage it?" "Knows a friend of the ruling family, did it from Darjeeling." "What about Nagar?" "Yes, well, see Hunza, might as well go to Nagar." The conversation continued in this way, affording me no deductive opportunities. I listened in silence for about 15 minutes. When I couldn't stand it any more, I turned to the hairdresser with the red and green hair and said quietly, "What are they talking about?" "Countries," she said. I was ready to collapse. They were talking about countries, and I hadn't heard of any of them. Bhutan and Hunza are countries? Yes, in the Himalaya. Well, I felt a little better. Who knew what was tucked away in the folds of the Himalaya? I felt my ignorance could be excused. But as the conversation continued, I realized that the world I inhabited was a world where, if I did not know everything, I had at least heard of most of it. My ignorance about Himalayan states, on the one hand so embarrassing, was also in its way enlivening. I'd certainly do some reading when I got home. Davis's friend Ed Bancroft, a handsome investment banker living in Bangkok, was a rake. He was the only rake I had ever met. As the dinner guests departed, Bancroft announced to Peter and me that he was taking us to see the famous nightlife of Bangkok. Davis begged off, pleading fatigue. In Patpong, once a Vietnam R&R district, there were clubs with names like the Playboy and the Mayfair. In the Playboy Club, we saw Thai girls demonstrate varieties of muscular control with cigarettes and bananas, all done under ultraviolet lights while the crowd shouted and screamed. The spectator appeal of this activity struck me as limited unless you were really drunk, as most of the spectators were. We visited several more bars and then went to a massage parlor. It was a gigantic modern place the size of a hotel. Ed Bancroft suggested that as out-of-towners we might like the full-body massage, where the girl slithers all over you in a soapy bathtub. We were taken to a one-way mirror where we could look into a room full of girls, all wearing starched white uniforms and number tags. The girls were all looking in our direction because there was a television mounted just beneath the mirror. The idea was, you picked a number, and the manager called the girl out to give you your massage. Because he spoke Thai, Ed talked with the manager at the window and second-guessed our decisions. Apparently, certain choices among the girls were not desirable. I never did figure it out. The whole business of standing at the mirror was very bizarre. It was a little too much like the slave trade or the auction block or outright prostitution for my taste. Yet nobody was treating it that way. There wasn't any sordid, sinful feeling. It was exactly like a massage parlor, sort of healthy and straightforward. I retired with my girl to a fully tiled room that had a low circular bathtub sunk into the floor. The girl made a bucket of suds, put a little hot water into the tub, and got me to sit in it. She scrubbed me with a rough brush, which was nice in a masochistic way, and gestured for me to lie on my stomach. Then she took off all her clothes, soaped her body, lay down on my back, and writhed with the soap. I had a few problems with this. For one thing, I didn't fit in the tub. My legs hung over the edge, so when she lay on top of me, it was extremely painful on my shins. Also, because my back was arched, we didn't have good contact. She kept giggling and trying to push me into a better position, but there just wasn't room in the tub. Then soap got up my nose, and I began to cough. We decided to call it a day. She rinsed me down, and I dried myself and got dressed and headed back upstairs. "How was that?" Ed said. "Wasn't that unbelievable?" "Unforgettable," I agreed. Peter showed up, and we were off again, Ed with a peculiar gleam in his eye. He was building up to something. "A whorehouse?" he asked. "I don't know," I said. "It's getting late." Peter made non-committal noises. "Just a look," Ed said. He was showing us the town. He was the resident expert. He didn't want to stop this wild ride. "Okay, just a look." But the mood in the car was declining. My shins still hurt from the slippery massage, though I'd never admit to the others that I'd anything but unalloyed delight. Peter was saying nothing at all, smoking cigarettes and staring out the window. We were getting into that funny territory that men can share in A Night on the Town or Chasing the Broads, a situation that says much more about the men being together than about any broads. What was happening at 2 a.m. on a muggy Bangkok night was that nobody was willing to be the first to quit. But Ed, our guide, took the silence to mean we were bored with his itinerary thus far. He perceived us as especially jaded, requiring a special stimulus. "I know what," he said, snapping his fingers. "A child whorehouse." "Ed," I said, "wouldn't just a regular whorehouse be adequate?" No. A child whorehouse, absolutely. Listen, this place is incredible. You have to see it." And off we drove in the steamy night. I'm thinking of Justine in the Alexandria Quartet, exotic episodes in exotic foreign countries. Peter still stares out the window. I'm noticing the epaulets on his shirt again. I say to him, "Have you ever seen a child whorehouse?" "Not personally," he says, very cool. Bancroft pulls up a back alley into one of the indistinguishable gray concrete structures of Bangkok. There is a guard and a central courtyard. In the courtyard are parking stalls with curtains in front of each stall. "That's for the cars. You pull the curtains so people can't read the license plate numbers," Ed says. "Politicians, really important people come to this place. Wait here." He jumps out of the car, is gone. Moments later, he is back. "Okay, it's all right." We go up a broad flight of stairs from the street, then into what looks like a single large apartment, a long hallway with doors opening off each side. "Good to see what they have here tonight," Ed says. We are led down the hallway to the first door. Inside, a room draped with gaudy Indian fabric, pinks and reds, harsh lighting. Sitting on pillows in the room, watching television, women with crude, heavy makeup. They don't look like children to me. "Pretty old," Peter says, grinning at Ed, needling him. "Old? Christ! Ancient!" Ed says something quickly in Thai to the man beside him. "I wonder how old they actually are," Peter says. Now he has his reporter's voice, his correspondent's voice. So-and-so many women, such and such an average age. We go down the hall to another door, another room draped with cheap cloth. Women in negligées, bra and panties, garter belts. The bordello effect is spoiled by the fact that some of them are cooking food in a corner of the room. These girls are somewhat younger. The man looks at us, questioning. "I don't know what this guy is thinking of," Ed says. "The last time I was here it was with—" he names a distinguished person. "And they had 7- and 8-year-olds here. Really extraordinary." We go farther down the corridor to still another room. Every time I move down the corridor I feel more claustrophobic. There are funny smells here, masked by incense. The corridor is getting narrower all the time. Short women stand in the corridor, clustering around us, trying to get us to choose them instead of the women in the rooms. In their dirty underwear, their garish makeup, they pluck at us, tug at us. When they smile, they have missing teeth. "Ah, here's the room," Ed says. The door opens. We see a handful of prepubescent girls. They look 10 or 11. Their eyes are dark and smudged. Their postures are coy. They strut and throw glances over their shoulders. One girl walks unsteadily in high heels too big for her. "What do you say, guys?" Ed says. He's grinning with excitement. I just want to get out of there. I don't care if they think I'm effeminate. I don't care what they think. I just want to get away from these poor children and these reeking corridors with people pulling at me, touching me, little fingers reaching up for me. Mister! I think I'll pass, I say. I'm a little tired." "Hey, you don't see what you like. We can keep looking." "No, I'm tired, really. I'll wait for you outside." Okay, suit yourself. Ed looks at Peter. Peter? This is another classic moment from Night on the Town. One guy has just crumped out. He's tired or guilty or thinking of the wife or whatever. And now let's see which way the rest of the evening is going to go. Are you in or out? Peter says, I want a cigarette. I'll wait outside, too. You guys, Ed says, shaking his head, disappointed in us. You don't know what you're missing here. I'll have to take that chance, Peter says. Peter and I go outside and sit on the bumper of Ed's car and smoke cigarettes and talk about what has happened in our lives in the 10 years since we have last seen each other. We suddenly have this camaraderie, because it is the middle of the night, and we are tired, and we have both decided to pass on the child prostitutes, and we want to make sure the other guy doesn't think we're chicken or something. We have a really nice conversation, and then Ed reappears. You guys, you really missed it. There was some quite extraordinary material there. Yeah, well. Okay, what do you say we stop at a coffee shop, see what girls are around, huh? We plead exhaustion. Ed says he doesn't feel we've had a good enough night. We assure him we have. We manage to get back to Davis's house. I walk into my bedroom with my head down so as not to be higher than the Buddha, and I fall immediately asleep. The next night I went to dinner at the house of a man who ran an advertising agency in Bangkok. He was an Australian known for his cooking. Everyone coveted an invitation to his meals. Before dinner, someone unrolled a Thai stick of marijuana, made a joint, and passed it around. Some guests smoked it, others didn't. I smoked some. How could you go to Thailand and not have Thai grass? When the joint came around, I had some more. Better be careful, Davis said. That stuff is strong. Hey, don't worry, I said. I'm from L.A. Davis shrugged. I had a couple of vodkas before dinner, too. I was feeling pretty good, sitting around talking to people. In fact, I was glad to be feeling so good, because for a couple of days I had been having this undercurrent of feeling that I was far from home, meaning that I was overextended, lonely, stretched a little far, having more anxieties about my new experiences than I was admitting to myself. But then, when we got up to go to the dinner table, I realized that I had misjudged my consumption. I was very high. I was even having a little trouble coordinating things. Oh, well, I thought, I'll be okay when we sit down again. I'll be okay once I eat something. We sat at the table, and there was an Indian woman, the wife of a diplomat, on my left, a Thai advertising account executive on my right. The food was passed around. The conversation was very pleasant. And then, suddenly, I began to see gray. The gray got darker. And then I was blind. It was odd. I could hear the conversation and the clink of silverware around me, but I was completely blind. The Indian woman asked me to pass something. I'm sorry, I said. I know this is going to sound funny, but I'm blind. She laughed delightfully. You are so amusing. No, seriously, I'm blind. You mean you can't see? No, I can't. How extraordinary. I wonder why. I was wondering that myself. I don't know. Do you suppose it was something you ate? I don't think so. Can you see me now? No, still blind. I wonder what we should do, she said. I don't know, I said. The host was notified. Plans were made. Everyone seemed to be treating this as a normal occurrence. I thought, have other people been blind in this house before? Next, I felt myself carried by several people upstairs to the second floor and put on a bed in an air-conditioned bedroom. Some time went by. I opened my eyes. I couldn't see anything. For the first time, I began to worry. It had been okay to be blind for a while, but it wasn't going away. I wondered what time it was and felt my watch with my hand. Was this going to be a permanent condition? Was I going to have to get a Braille watch? What kind of room was I in? Some more time went by. Someone touched my shoulder. I looked over and saw an elderly Thai woman smiling at me. She gave me a glass of water, giggled, and went away. After a while she came back. By then I could see all right, but I felt terrible. After that I went to sleep. Much later Davis came up, clucked his tongue, and drove me home. In the morning I told Davis that I wasn't going to go sightseeing. I was just going to take it easy, maybe sit in his garden by the pool, read a book, get over the strangeness of things. "Good idea," he said. "Just keep an eye out. The gardener saw a cobra in the garden last week." Davis announced that we were going up country for a couple of days. He had to check on sales for the pharmaceutical company he worked for. Prescription drugs were legally sold over the counter in Thailand at that time, and the international drug companies treated Thailand as a major market. The countryside was flat and green and beautiful. We stayed in Chinese hotels and had a wonderful time. Finally, we got to Ayutthaya. Davis said he was going to check his stores, see how they were doing. "But there's a large open market around the corner," he said. "Big up-country market. Have a look, you'll find it interesting." I went around the corner. The market was enormous, almost an acre. It was entirely covered by white sheets to block the sun. A beautiful, vast open space, it was filled with everything from produce to clothing. I wandered around looking at what people were selling. The sheets were so low I had to duck my head, but it was a fascinating market, and I was glad to see it. Because of my height, I caused a considerable commotion. The up-country people stopped and stared, and, in common with most Asian people, they laughed. The laughter began in scattered places here and there, but it grew, swelling to fill the entire open market. They were all laughing at me, pointing and laughing. I smiled back good-naturedly. I knew they didn't mean anything. It was just an expression of embarrassment. The laughing continued. It became a roar in my ears like an ocean wave. People were dashing off to get their friends. The whole town was running to get a look at me. The laughter built. Now there were 400 or 500 people laughing. I was on display. Everywhere I saw open mouths laughing. Finally I looked down at the ground and saw at my feet an old Thai woman rolling on the ground, clutching her stomach in hysterics. She was laughing so hard. Her body blocked me. I couldn't step over her. I looked around and thought, what an interesting experience. Here is a chance to see how it feels to have 500 people laughing at you. How does it feel? And I suddenly thought, I hate it. I turned and walked quickly away. I went back to the shop where I had left Davis. He was grinning like a Cheshire cat. "Knew they'd get a kick out of you," he said. "Jesus Christ." "They don't mean anything." "I know," I said, "but still." The Thais are famously good-natured. They are called the Danes of Asia because of their easy dispositions. A favorite expression, mai penrai, means more or less, never mind, and is invoked to resolve all sorts of disappointments and upsets. I frequently remarked on the wonderful quality of the Thai character, so different from what I was accustomed to at home. One day in Bangkok, in a taxi going back to Davis's house, I saw a Thai woman and a European woman in their separate cars trying to pass each other in the narrow road. They were both leaning out of their cars, having a screaming argument. Nobody was saying, "Mai penrai." I thought, it's time to go home. I left the next day. All in all, I considered it a traumatic trip. Then I realized that, although I saw myself as an accomplished traveler, I was, in fact, terribly culture-bound. I had visited only a small part of the world, North America and Western Europe. I began to think of all the places I hadn't been. I had never been to Africa. I had never really been to Asia. I had never been to Australia. I had never been to South or Central America. In fact, I had never been to most of the world. It was time to find out what I had been missing. Bonaire. The setting sun glowed red off the ocean as we waded clumsily out from the beach with our scuba tanks and lights. We paused, waist-deep in water, to put on our face masks and adjust the straps. Behind us at the Hotel Bonaire, people were heading for the dining room to eat. I said to my sister, "Hungry?" She shook her head. My sister had never been night diving before, and she was a little apprehensive about it. We had come to Bonaire for a 2-week diving holiday in the summer of 1974. Kim had just finished her second year of law school, and I had completed a draft of my next novel. We both looked forward to a good rest and a lot of superb diving. Bonaire is a Dutch island 50 miles off the coast of Venezuela. The island is actually a sunken mountain peak with sheer sides. 20 yards from the sandy beach, the crystal-clear water was 100 feet deep. This made night diving easy. Just walk out from the hotel beach at sunset and drop on down to 100 feet. You could make your night dive for an hour and be back at the hotel dining room in time for dinner. This was our plan. My sister put her mouthpiece between her teeth, and I heard the hiss as she sucked air. She clutched her shoulders and pantomimed that she was cold. She wanted to get started. I bit my mouthpiece. We sank beneath the surface. The landscape is deep blue, small fish flicking like shadows over the sand and heads of coral. I hear the burble of my air bubbles sliding past my cheek. I look over at Kim to see how she is doing. She is fine, her body relaxed. Kim is an accomplished diver, and I have been diving for more than 10 years. We go deeper down the slope into blackness. We turn on the lights and immediately see a world of riotous, outrageous color. The corals and sponges are all vivid greens, yellows, reds. We move deeper through black water, seeing only what is illuminated in the glowing cone of light from the flashlights. We find large fish sleeping beneath overhanging shelves of coral. We can touch them, something you can never do during the day. The night animals are active. A black and white spotted moray eel comes out of its hole to flex its powerful jaws and peer at us with beady black eyes. An octopus scurries through my beam and turns bright red in irritation. In a niche of coral, we find a tiny red-striped crab no longer than my little finger. On this dive I plan to take photographs, and so I have my camera around my neck. I take a few shots, and then my sister taps me on the shoulder and gestures she wants the camera. I take the strap from around my neck and hold it out to her. I'm moving slowly, with a flashlight dangling from my wrist. Things seem awkward. Kim pulls the camera away. Suddenly I feel a sharp yank at my jaw, and my mouthpiece is torn from my lips. My air is gone. I know at once what has happened. The camera strap has caught on the air hose. My sister, in pulling the camera away, has also pulled out my mouthpiece. I have no air. I am hanging in ink-black water at night, and I have no air. I remain calm. Whenever you lose your mouthpiece, it invariably drops down the right side of your body. It can always be found hanging in the water alongside your right hip bone. I reach down for it. The mouthpiece isn't there. I remain calm. I keep feeling for it. I know it is down there somewhere near my hip. It has to be. I feel my tank. I feel my weight belt. I feel my backpack. My fingers run over the contours of my equipment, moving faster and faster. The mouthpiece isn't there. I am sure now it isn't there. The mouthpiece isn't there. I remain calm. I know the mouthpiece hasn't been ripped from the air hose, because if it had, I would be hearing a great blast of air. Instead, I am in eerie black silence. So the mouthpiece is around me somewhere. If it hasn't fallen to my right side, it must be behind my neck, near the top of the air tank. This is a little more awkward to reach for, but I put my hand behind my neck and feel around for the air hose. I can feel the top of the tank, the vertical metal valve. I feel a number of hoses. I can't tell which is my air hose. I feel some more. I can't find it. I remain calm. How deep am I? I check my gauges. I am in 60 feet of water now. That's okay. If I can blow out my air in a slow, steady stream and make it to the surface, I am sure I can. At least I am pretty sure I can. But it would be better to find the mouthpiece now, down here. My sister is hanging in the water 5 feet above me, her fins kicking gently near my face. I move up alongside her, and she looks at me. I point to my mouth. Look, something's missing. No mouthpiece, Kim. She waves at me and gives me the high sign that everything is all right with her. She busies herself with putting the camera around her neck. I realize that in the darkness she probably can't see me very well. I grab her arm. I point to my mouth. No mouthpiece. No air. She shakes her head, shrugs. She doesn't get it. What is my problem? What am I trying to tell her? My lungs are starting to burn now. I blow a few air bubbles at her and point again to my mouth. Look, no mouthpiece. For God's sake. Kim nods slowly. I can't see her eyes because light reflects off her glass face mask, but she understands. At least I think she understands. My lungs are burning badly now. Soon I'm going to have to bolt for the surface. I am no longer calm. In the darkness, she swings slowly behind me. Her light is behind my head, casting my shadow on the coral below. She is picking around my air hoses near my neck, sorting things out. Now she is over on my left side. Not my left side, Kim. It's got to be somewhere on the right. She moves slowly. She is so deliberate. My lungs are burning. I know I'm going to have to bolt for the surface. I am telling myself over and over, remember to breathe out, remember to breathe out. If I forget to exhale on the way up, I will burst my lungs. I can't afford to panic. Kim takes my hand. She gives me something in her slow, deliberate way. This is not the time to be giving me something. My fingers close on rubber. She has put the mouthpiece into my hand. I jam it between my teeth and blow out. Water gurgles, then I suck cold air. Kim looks at me tentatively. I suck air and cough a couple of times. Hanging in the water beside me, she watches me. Am I all right? I suck air. My heart is pounding. I feel dizzy. Now that everything is okay, I feel all the panic I have suppressed. My God, I almost died. Kim is looking at me. Am I all right now? I give her the high sign. Yes, I am all right. We finish the dive, though I have trouble concentrating. I'm glad when it is over. When we get to the beach, I collapse. My whole body is shaking. That was weird, she says. She tells me that somehow the air hose had gotten twisted around, so that it was hanging down behind my left shoulder. I didn't know that could happen, she says. It took a while to find it. Are you all right? I think so, I say. You're shivering. I think I'm just cold. I take a hot shower. Alone in my room, I have a terrible urge for sex, a compulsive desire. I think, this is a cliché. Escape death and seek procreation. But it's true, I am feeling it. And here I am with my sister, for Pete's sake. By the end of dinner, I have calmed down. The next couple of days are more ordinary. We make another night dive. Nothing bad happens. I settle into the novels I have brought. I work on my suntan. For the next week, we have a good time. And we do all of the standard dive spots that every diver does in Bonaire. But I want to do more. I won't tell you where it is, the dive master said, when I asked about the wreck. I had read there was an interesting wreck somewhere on the north shore of the island. Why not? You'll die if you go there, the dive master said. Have you been there? I asked. Sure. You didn't die. I knew what I was doing. The wreck's deep. The shallowest part is 140 feet. At that depth, no decompression limits are 4 minutes. Is it really a paddle wheeler? Yes, iron hull. Nobody knows when it was wrecked, maybe around the turn of the century. I tried to get him talking about it, hoping that he would drop enough clues so I could find my way. The ship rolled down the incline? I'd read that, too. Bonaire is surrounded on all sides by a steep drop-off, an incline that goes from the shore almost straight down 2,000 feet in some places. Yeah, apparently the ship originally crashed on the shore. At least there are some fragments from it near shore, in about 30 feet of water, and then sank. When the ship sank, it rolled down the incline. Now it's on its side, 140 feet down. Must be something to see. Oh yeah, it is. Hell of a big wreck. So there are fragments in 30 feet of water near the shore? Yeah. What kind of fragments? Forget it, he said. Finally, I said, Look, I know what I'm doing. I've been diving with you guys for over a week, so you know I'm okay. You don't have to sanction what I'm doing, but it's unfair of you not to tell me where this famous dive is. Yeah? He said. You think you're up to this dive? He got truculent. Okay, here's how you do it. Drive east 5 miles until you find a little dock. Then load up, jump in with all your gear on, and swim north from the dock about 100 yards until you pass a green house on the shore. When the house gets to be about 2 o'clock to you, start looking down on the water. You'll see a spar and cables and 30 feet of water right below you. Swim down to the spar, and then go right over the edge and straight down the incline as fast as you can go. When you get to 90 feet, leave the incline and swim straight out into the open ocean. You think you're swimming straight, but actually you'll be dropping, and you'll hit the wreck about 140 feet down. It's huge. You can't miss it. Okay? Still want to go? The directions sounded difficult, but not impossible. Yes, I said. Sure. Okay, just remember, if anything happens to you, I'll deny I told you where it is. Fine. And remember, at that depth you'll be narked, so you have to pay attention to your time. Remember, your no decompression limits only give you 4 minutes down there. The wreck is so huge there's no way you can see it in 4 minutes. Don't even try. Make sure you observe all the stops on the way up. There isn't a decompression chamber within 8 hours airtime of Bonaire, so you don't want to screw up. If you get the bends, there's a good chance you'll die. Got it? Got it, I said. Another thing, if you do decide to go, remember to leave your camera. Your Nikonos is only certified to 160 feet. You'll warp the case. Okay, I said. Thanks for your help. Take my advice, he said. Don't go there. I asked my sister what she thought about it. Why not? She said. Sounds interesting. The next day we drove up to have a look at the site. There was a sort of industrial pier that went a few yards out into the water. It looked broken down, disused. There were several ratty houses along the shore, none green. Still farther north there was some sort of refinery or industrial complex with big ships tied up. The water by the dock was murky and unappealing. I was all for giving it up. I asked my sister what she thought. She shrugged. We're here. Okay, I said. At least we can look for the mast. We put on our gear, inflated our vests, and floated north. It was a fairly strenuous swim. I kept watching the houses on the shore. I had about decided that the dive master had given us bad instructions when I suddenly saw, at 2 o'clock as I looked back, a green door. It was not visible from the dock. I looked down in the water. Directly below us was a heavy mast and spar. Some metal cables draped over the coral. It looked almost new. Think that's it? I asked my sister. She shrugged. Looks like what he described. I asked her what she thought we should do. We've come this far, she said. "Okay, let's go," I said. We put in our mouthpieces, deflated our vests, and went down to the spar. Up close, the spar was big, 40 feet long, a foot in diameter. It had very little marine growth on it. We swam along its length, moving out from the shore. Then we ducked over the edge and plunged down the incline. That's always an exciting moment, to drop over an undersea ledge, but my heart was pounding now. The landscape was ugly, with heavy pollution from the nearby industrial site. The water was cloudy, and visibility was poor. We were swimming in crud. There wasn't a lot of light, and it got quickly darker the farther down we went, and we had to go fast because we had to conserve our air. At 90 feet, I looked out at the open ocean and decided the instructions were wrong. Anyway, it was difficult to leave the scummy incline and head straight out into the cloudy murk. I decided to go deeper before heading out. At 120 feet, I headed outward. I couldn't see more than a few feet ahead of me, but once I had left the incline behind, it was difficult to know where to focus my eyes. There was nothing to look at except the milky strands of crud suspended in the ocean. I was chiefly concerned that we would miss the wreck. At this depth, it was not going to be possible to hunt for it. We would have neither the time nor the air for that. And then suddenly, my entire field of vision was filled with flat, rusted metal. I was staring at a vast wall of steel. The wreck. The size of it astonished me. It was far bigger than I had imagined. We were at the keel line running along the bottom of the hull. We were at 160 feet. I started my stopwatch and swam up the side of the hull, at 140 feet. The metal surface of the hull was covered with beautiful sponges and wire corals. They made a wonderful pattern, but there wasn't much color this deep. We moved through a black and white world. We went over the side of the hull and onto the deck of the ship, which was almost vertical, with the masts pointing down the incline. The geography was pretty crazy, but you got used to it. I took some pictures. We had a quick look around, and then our 4 minutes were up. We returned slowly to the surface. When a diver breathes compressed air, nitrogen enters his bloodstream. Two things then happen. The first is that the nitrogen acts like an anesthetic and causes an intoxication. Nitrogen narcosis, the famous rapture of the deep, which becomes more pronounced the deeper you go. That narcosis was dangerous. Intoxicated divers had died because they took out their mouthpieces to give air to the fish. The other thing is that the nitrogen that enters the blood must be allowed to come out of the blood slowly as you return to the surface. If the diver surfaces too quickly, the nitrogen will bubble out of his blood like soda from a bottle when the cap is removed. These bubbles cause painful cramps in the joints, hence the name bends. They also cause paralysis and death. The time needed to decompress is a function of how long the diver has been down and how deep. According to published dive tables, my sister and I were not required to decompress at all, but the need for decompression depends on such variables as temperature, the health of the diver that day, or whether part of his wetsuit binds him and prevents the nitrogen from coming out of solution. It's so highly variable, we decided to do double decompression stops. 2 minutes at 20 feet, 6 minutes at 10 feet, just to be safe. We made our decompression stops and swam back to the dock. We were both exhilarated. We had dived the wreck and hadn't died. And the wreck was remarkably beautiful. We decided to dive there again and explore it further. Given a 4-minute limit, we felt that we would have to make a separate dive to see the stern and another to see the bow. A few days later, we swam around the stern of the ship about 180 feet deep. The dive went smoothly. We had a good look at the steel paddle wheels. We were starting to feel quite comfortable around this wreck. Our pleasure was considerable. We felt like kids who had broken the rules and were getting away with it consistently. We were very pleased with ourselves. and we were getting used to the narcosis, too, accustomed to the way we felt drunk the minute we reached the wreck. A few days after that, we made a third dive and explored the bow. The bow was 210 feet down, and as we came around it, I felt the narcosis strongly. I gripped my instruments and kept checking my gauges to be sure my air was all right. I was aware I was having trouble concentrating. We started each dive with 2,200 pounds of air, and I like to head back with 1,000 pounds remaining, since it took us nearly 11 minutes to reach the surface. The wreck was incredibly beautiful. This was going to be our last dive on it. I had 1,200 pounds of air remaining, and we still had a little time left, so I decided to show my sister a tiny, delicate sea fan on one of the masts, 180 feet down. We swam out and had a look, and then it was time to go back. I checked my watch. The 4 minutes were gone. We were moving toward 5 minutes. I checked my air. I had 600 pounds left. I felt panic. 600 pounds was not enough air for me to make it back. What had happened? I must have misread the gauges. I looked again. 500 pounds. Now I was in trouble. I couldn't go up fast. That would only increase my risk of the bends. I couldn't hold my breath either. An embolism would kill me for sure. Nor could I breathe less often. The whole point of blowing off the nitrogen was that you had to breathe it out. I looked up toward the surface. I could not see 180 feet above me. I suddenly felt the weight of all this water over me and my precariousness. I broke into a cold sweat even though I was under water. I didn't know such a thing was possible. There was no point in wasting time. The deeper you are, the faster your air is consumed. We started up quickly. The rule is you ascend at 60 feet a minute, which meant it would take us 3 minutes to get to the surface. After 1 minute at 120 feet, I had 300 pounds of air left. After 2 minutes at 60 feet, I had 190 pounds left. But still before me were the decompression stops. I had never known such a predicament. Of course, I could easily reach the surface, but that wouldn't do me any good. I had been under too long, and the surface was dangerous, possibly deadly to me now. I had to stay away from the surface for as long as possible, but I couldn't stay down 7 more minutes with only 190 pounds of air. We stopped for the first decompression at 20 feet. My sister, who never consumed much air, showed me her gauge. She had 1,000 pounds left. I was down to 150 pounds. She signaled, "Did I want to share her air?" This is something you practice in diving class. I had practiced it many times. But now I was panicked. I didn't think I could manage the procedure of taking my air out of my mouth and passing her mouthpiece back and forth. I was much too frightened for that. So much for diving class. I shook my head no. We went up to 10 feet and hung in the water just below the surface, holding onto arms of staghorn coral. I tried to tell myself that the decompression stops were doubled and not really necessary anyway. True, we had exceeded the no decompression limits, but not by much. Maybe a minute, maybe less. I couldn't convince myself that I was fine. All I could think was how damned stupid I had been, to cut it so close and to put myself in this danger. I thought of all my friends who had been bent, and how it had happened. The stories were always the same. Got a little sloppy one day, got a little careless, got a little lazy, didn't pay attention. Exactly my story. I stared at my air gauge, watching the needle slowly go down. In my mind, the gauge was magnified, as big as a saucer. I saw every scratch, every imperfection. I saw the tiny fluctuations, the tiny pulses in the needle with each breath I took. The gauge was down to 50 pounds, then 30 pounds. I had never had my air supply go so low. I noticed a tiny screw in the gauge, a stop screw to keep the needle from going below 0. I continued to breathe, wiggling my arms to make sure nothing was binding. I completed the 6 minutes of decompression just barely. The needle hit the stop screw. I had sucked the tank dry. On the surface, my sister asked me if I was all right, and I said I was. But I felt jittery. I figured I was all right, but I wouldn't know for sure for a few hours. I went back to my room and took a nap. In the afternoon, I woke with a crawly sensation on my skin. Uh-oh. That was one of the signs of the bends. I lay in the bed and waited. The tingly, crawly sensation got worse. It was first on my arms and legs, then my chest as well. I felt the tingling creep up my neck, taking over, moving toward my face. I couldn't stand it anymore. I jumped out of bed and went into the bathroom. I didn't have any medicines, but I would do something, at least take an aspirin, something. I stared at myself in the mirror. My body was covered with an odd pink rash. It was some sort of contact dermatitis. I went back to bed and collapsed in a sleep. I never got the bends. As best I could tell, the dermatitis was caused by the hotel soap. In more than 10 years of diving, I had never gotten into trouble. But during my vacation in Bonaire, I experienced serious trouble twice in 2 weeks. At the time, I just saw these incidents as accidents, bad luck. More than a year passed before I began to reflect on the pattern behind my own behavior, the fact that I had repeatedly taken ever more daring risks until I finally got myself into trouble. I was startled when I finally recognized what I was really doing. The conclusion was inescapable. On some level, for some reason, I was trying to kill myself. Why would I want to kill myself? I could find no explanation in the events of my life at that time. My work was going well. I had ended an unhappy love affair, but that was months in the past and no longer on my mind. All in all, I felt cheerful and optimistic. And yet the pattern was there. I had engaged in repetitive, daredevil behavior without ever being consciously aware of the underlying pattern. But was I really unaware? Because when I thought back, I remembered some odd and uncharacteristic worries during my stay in Bonaire. For a man on vacation, I had been unusually fretful. I worried that the dive shop would fill my tanks with bad air. I worried that the restaurants would give me food poisoning. I worried that I would have a fatal car accident on the road. Yet the roads were nearly deserted, the restaurants were spotless, the dive shop was scrupulously managed. At the time, I had commented to myself that these fears were particularly unfounded. But now I had to recognize that they were not fears at all, but disguised wishes. In any case, I hadn't put the pieces all together during the time I was in Bonaire, and the entire episode left me with a renewed respect for the power of the unconscious mind. What I had demonstrated, to myself at least, was that my ordinary assumption that in some casual and automatic way I know what I am doing and why is simply wrong. The acceptance of unconscious motivation obliged me to assess my behavior by methods other than ordinary introspective awareness, because what I think I am doing at the time is almost certainly not what I am doing. In some way, I had to get a perspective on myself. One time-honored way is to listen to the perceptions of an outsider, a friend, associate, or therapist. There are also ways to get perspective by shifting consciousness, changing to what is sometimes called the witness state. Those meditative states didn't interest me in those days. But I stumbled on another useful technique for entirely different reasons. Starting around 1974, there was a lot of attention paid to so-called circadian rhythms, the daily rhythms of the human body and its hormones. It had been found that most human beings didn't follow a precise 24-hour cycle, but that the usual cycle was slightly longer or shorter, which meant that we were sometimes in synchronization with the day and sometimes not. In addition, the psychological effects of the female menstrual cycle were receiving new consideration. In England, there were rumors of legal acceptance of a condition called PMS, premenstrual syndrome. and it was commonly accepted that many women experienced some monthly fluctuation in mood and behavior. I began to wonder if there might be a male menstrual cycle as well, or something equivalent. After all, there are physical analogues between the sexes, the male scrotum to the female labia, the testicles to the ovaries, the penis to the clitoris, and so on. It seemed to me unlikely that women would develop a complex monthly cycle of hormones and that there would be no trace of such a cycle in men. That was a job for an endocrinologist, but I wasn't interested in the hormones. I was interested in seeing if there were patterns in my own moods that I wasn't aware of. How to keep track of this? I asked my friend Arnold Mandel, a neurobiologist, how to keep an objective record of subjective mood. Because the danger, of course, is that you will inadvertently create a pattern in your own data. Arnold said the best way was each day to put a mark at the edge of an unmarked diary page, using the top of the page as the best mood and the bottom as the worst mood. So I began to do this. Since I was keeping a daily diary mark, I started to record little thoughts for the day, too. I had always thought keeping a diary was a belabored, Franklin-esque thing to do. But since I was doing it for another purpose, it was all right. After a few weeks, I looked back over my notes with astonishment. Every day I was so critical. One nasty comment after another about something or somebody. I didn't regard myself as particularly critical, but evidently I was. I began to observe my state more carefully during each day. It did indeed seem that I was frequently judgmental and snappish, even when I didn't mean to be. So I decided to watch for that behavior and modify it. It was surprisingly difficult to do. I never was able to detect a monthly cycle of my own mood changes, though from time to time I tried again. In later years, I wrote a computer program to record my responses on a blank screen. I still suspect there is such a cycle, perhaps bi-monthly, running 7 or 8 weeks, but I have never demonstrated it. However, I demonstrated a great value to keeping a diary, and have kept one ever since. I reread Franklin's autobiography and noted that he kept a record of himself, as I did, for exactly the same reasons. This most practical and observant of men had decided that careful record-keeping was the only way to find out what he was really doing. Pahang. I became interested in the Sultan of Pahang, ruler of the largest and richest state in Malaysia. I had some notion of writing about him, and I had heard that his birthday celebrations were worth witnessing. Horse races on his palace grounds, native dances, and a ceremony in which his subjects ritually poison fish in the river and collect them for a special dinner. It all sounded suitably exotic. From the Malaysian consulate in Los Angeles, I learned that the Sultan celebrated his birthday in late May, and a week before the date I flew to Singapore with the idea of finding someone there who would assist me in attending the party as a journalist. Failing that, I would crash it. I was delighted at the idea of crashing the birthday of the Sultan of Pahang. I told everyone that was what I was doing. It sounded so eccentric and dashing. Unfortunately, when I arrived in Singapore, I learned that the Sultan's birthday was not in May. The old Sultan's birthday was in May, but he had been dead several years. His son, the present Sultan of Pahang, celebrated his birthday on October 22nd. I was 5 months early. I felt like a fool. And in the meantime, there was the question of what to do now that I was in Singapore. I decided to see something of the province of Pahang, birthday party or not, and learned that there was a national park in the middle of the jungle called Taman Negara. I arranged to visit it in a week's time. The Malaysian government required a week to process my application to visit the park because there was still fighting with communist guerrillas in that region. My friend Don, with whom I was staying, instructed me about guerrillas. Don was an international lawyer, but he had been in Vietnam during the war. "Now," he said, In case there's an ambush, you know what to do." "No," I said. "Actually, I didn't." "If they ambush your vehicle, you want to run in the direction of fire." "Really?" That didn't seem logical. "Yes," Don said. "Get out of the car and run toward the fire." "Why?" "Because what they do is they put two guys on one side of the road who open fire. They put everybody else on the other side of the road, expecting you to get out on the opposite side of the vehicle, so when you get out, you're exposed. That's when they let you have it." I made a mental note to remember that. Run toward the fire. "Probably won't come up, but it's good to know these things," Don said. "Now, you have your compass?" "No," I said. "I was going to have a guide." "Jesus, never go into the jungle without a compass," Don said. "And try and get a decent map. It won't be easy, but try and pick one up in KL." "Okay," I said. "I would do that." "Now, you know what to do about leeches." Don had lots of information. He instructed me long into the night. In no time at all, I felt dashing again. I bought a compass and a map, and I flew to Kuala Lumpur to meet my guide. He was a young Chinese biologist named Dennis Yong. We set off the same day. Here is how you get to Taman Negara. In Kuala Lumpur, the modern capital of Malaysia, you get into a land cruiser and start driving. For the first 3 hours, the road is a 2-lane paved highway in mountainous jungle. Then it is a 1-lane paved road, then a dirt road, then a mud track. After half a day of driving, the mud track stops at a river at a place called Kuala Tembeling. Kuala means mouth of the river, and most villages are at the juncture of rivers. At Kuala Tembeling, you get into a long, slender boat powered by an outboard motor, and you head up the Tembeling River. The river is incredibly tranquil. You pass small villages interspersed with regions of jungle. As the hours go by, there are fewer villages, more jungle. Finally, there are no villages at all. There is only jungle. After 3 hours on the river, the boat pulls over at a place called Kuala Tahan. Here I find several plain concrete buildings, a restaurant pavilion, and 4 or 5 guest cottages. This is Taman Negara, formerly the private retreat of the Sultan of Pahang, now donated to the nation as a park. I have never been in a jungle before. Certainly I have never been so far from civilization. The place is quite comfortable, and Dennis radiates competence. Yet I feel so far from anything I know. I would never admit I am frightened, but I am. We go at once to the nearest hide, not far from the cottages. Dennis tells me there are tigers, rhinos, and elephants in Taman Negara, but the animals are shy and rarely seen. We must not make any noise, or the animals will not come. On the path through the jungle, Dennis gestures for me to be silent, and we do not speak after that. We climb a flight of wooden steps and sit in the hide, an elevated wooden hut with narrow windows looking out into a clearing. In the clearing is a cake of salt, surrounded by the muddy prints of many animals. At the moment I see no animals. We wait, not speaking. It's comfortable for me not to talk. I've spent years writing, never speaking. Silence doesn't bother me. We stare out at a clearing of grass with a salt lick and wait for animals to come. Pretty soon an English couple arrive. They sit in the hide with us, but they speak. I put my finger to my lips. They whisper, "Oh, sorry," and don't say anything for about 30 seconds. Then they begin to whisper. I think it must be something urgent, but it's not. Just random chatter. I don't like to be pushy, but I ask them to please be quiet. Dennis explains to them that no animals will come unless the hide is entirely silent. They say irritably that there aren't any animals out there anyway. They are silent for a couple of minutes. Then one of them drums his fingers on the bench, and the other begins plucking at the thatching of the hide. Then they smoke cigarettes, and pretty soon they are whispering, and then speaking in low voices, and then talking in ordinary tones. When I catch their eye, they fall silent again, and the cycle begins all over. I realize that these people can't be quiet. They are incapable of silence. They want to see animals, but they can't be still long enough to let the animals come. It amazes me to watch them. They seem to have a kind of incontinence. They would be embarrassed not to be toilet-trained, yet they show no embarrassment at their inability to sit silently for more than a few seconds. Eventually they leave. Dennis and I remain alone in the hide for another hour. No animals come. We return to the hide after dinner. The night is dramatic, because the overcast sky glows with silent bursts of heat lightning, casting flickering bluish light on the field before us. The surrounding jungle is noisy. Crickets make a shrill sound, toads and frogs a low rumble. An owl gives a kind of abrupt, cut-off hoot, which is answered across the valley. Around 10, the sounds begin to die. By midnight it is quiet. No animals come. We go to bed. I am staying in cottage number 5. Dennis tells me that this was the Sultan's own cottage when he was in residence. I think, at least that's something. I am sleeping in the Sultan's cottage. At least that. The next day we hike in the jungle. Paths in the national park are more than 10 feet wide. Dennis explains they must be cut wide because the jungle grows back so quickly. We pass flowering red ginger, spiky rattan, and the occasional small orchid, but for the most part the landscape is monotonous green, very dark and hot. Dennis has promised I will see gibbons, and we hear them hooting everywhere in the canopy of trees above us, a distinct cow-wow sound. I also hear them crashing through the branches, but I don't really see them. Finally, with binoculars, I glimpse 4 black shapes, far off, silhouetted against the sky. They shake the branches and are gone. I've seen my gibbons. I never see them better. In trying to get a clear look at them, we have wandered a few yards off the trail. I turn and see I am surrounded by ferns and plants as tall as I am. I can only see a few feet in any direction. I am utterly lost. Dennis laughs and leads me back to the trail. As we walk, he tells me that the Orang Asli, the aboriginal tribesmen of the Malay forest, can walk in the jungle for weeks and not get lost. Dennis has gone with aborigines on long expeditions, several hundred miles of walking, and on the route back, weeks later, the aborigines unerringly return to precisely the same campsites each night. I ask how they are able to do it. Dennis shakes his head. He doesn't know. He has spent a lot of time in the jungle, but he can't fathom it, he says. You must be raised here, he says. It must be your city, the way we grow up in a city. You have to know your way around. He points out some tiny hazards, a small scorpion in a rotting tree, and leeches wiggling like thin worms along the trail. Dennis himself walks barefooted on the trail. The leeches never bother the first man in a party, he says. They respond to vibration. As the first man passes, the second and the third man get the leeches. I look down and see one crawling through my bootlaces. Dennis tells me not to worry. If it's still there later, he will show me what to do. I think, if it's still there later? The air is hot and humid beneath the trees. I am soaked in sweat. Occasionally on the trail, the views open out to a wider vista of the jungle. The trees are all faintly dusted with color, red and yellow and white and pink. A hillside here looks like an autumn hillside in Vermont, but paler, washed out. Dennis explains this is the dry season and the trees are blossoming. That is why they display those dusted colors. I am seeing thousands of tiny blossoms. We walk for an hour and finally reach the view we have been seeking. I'm out of breath, extremely tired, and glad for a rest. We stop, and I immediately learn a consequence of all the flowering trees. Bees. This entire vast jungle is in bloom, and there are thousands and thousands of bees. I have not noticed them while walking, but now that I have stopped, they descend upon me. They crawl all over my camera and my hands as I take pictures. Looking down, I see they are on my arms and crawling over my t-shirt. Dennis says to be calm, that the bees are only attracted to my salty sweat and will not sting if I remain calm and move slowly. That's all I need to hear, and I immediately relax. I am not particularly afraid of bees anyway, nor am I allergic to them. A few bees won't bother me. It's kind of an interesting experience. The bees continue to land. I feel them crawling over my cheeks and forehead. I feel them in my ears and hear the hum of their many wings. I see them crawling on the frames of my glasses. I feel them tickling as they walk on my eyelids. I feel them clustered on my lips. I am no longer relaxed. I want to scream. It is all I can do to keep from screaming. The bees are now so thick on the lenses of my glasses that I can hardly see Dennis. He has quite a few bees on him, and he is smiling at me. "They prefer you," he says. "Nice and salty." I am trying to control my breathing, to avoid jagged, short, panicky gasps. I'm doing okay. I am holding my own. But even so, at any moment, I may begin to scream. "Do the bees bother you?" Dennis asks. "A little," I say. "If you are bothered," Dennis says, "we can start walking again, and the bees will fly away." But I am too tired to walk right now. I must endure the bees for a few moments longer. And as they crawl over me, down my shirt and up toward my armpits and around the back of my neck and between my fingers, as I feel them everywhere, I realize that I am waiting to be stung. If I could really believe they wouldn't sting me, I would be able to relax. "They won't sting you," Dennis says again. "They just want to lick you. They are very gentle." It seems inconceivable that they will not sting me. By now I am encrusted with bees. I have so many on me that I feel their added weight on my body. And I haven't been stung yet. I look down and see my chest carpeted with bees, rising and falling. I don't want to take any more pictures. I can't see well enough to do it anyway through all the bees. Finally, Dennis says, "Ready to go back?" "Yes," I say. We start to walk slowly. The bees slip away, one by one. In a few moments I am free of them, back on the trail. I was never stung. That afternoon I meet some Orang Asli of the Semai tribe. They are short, stocky Negroid men with curly hair, very different in appearance from the Malays and Chinese who constitute the majority of the population. They find me funny because I am so tall. One man appears to be cooking nails in a pot. I'm told he's making poison. The Semai take sap from the Ipo tree and then boil it with nails and snake heads. Although Dennis says the snake heads are a ritual ingredient not necessary for efficacy. The resulting poison on a blow dart produces convulsions and death in animals as large as monkeys. Nearby, another man is stir-frying Chinese tobacco with sugar. The Semai prefer to smoke it that way. The men seem jittery. Dennis says that they are always a little paranoid because even well into the 20th century, the Malays shot them for sport. There are stories of Malay sultans riding on the bonnets of their Bentleys and firing into the jungle at the little forest men. Dennis tells me Aboriginal shamans are highly respected and often consulted by prominent Malays when they become sick. The Semai call their shamans behalak, meaning someone who can go into a trance. The Semai believe everyone in their tribe can go into a trance, and therefore everyone is a shaman to some extent. But certain individuals are especially good at trances, and therefore become accomplished shamans who combat evil spirits and heal people. A person is generally called to become behalak by a dream of a tiger, and the most powerful shamans are believed to be were-tigers. Dreams are important to the Semai, and even the dreams of a young child will be exhaustively discussed, and further dreams directed and encouraged. The Semai believe they can control their dreams. That night we sleep in a hide a half-mile from Kuala Tahan. The distance from even that much civilization is exciting. I am certain I will see a tiger tonight. I feel it. I stay awake for hours, watching the heat lightning flash over the landscape. I never see a tiger. In the morning I wake stiff and cold in the hide. Dennis is gone. I look out the window at the salt lick. He is bent low, inspecting hoofprints in the mud. "Tracks of a wild pig," he says. "We missed him." A wild pig does not sound exciting. Privately, I am glad I slept instead of waiting all night to see a pig. "No tigers?" "Not last night." On a boat, we go up rapids to Kuala Trengganu, where we see a monitor lizard near the river edge and a hornbill flying overhead. Then we see tiger tracks in the wet riverbank. Everyone is enthusiastic about the tiger tracks, but if anything, they make me feel more frustrated. I am seeing the signs of everything, never the thing itself. From Kuala Trengganu, we had planned to go up a smaller stream, but the boatmen tell me that this late in the dry season, the streams are low and we cannot make it up. Still frustrated about the tiger, I suggest we try. They shrug, warn me it will not be possible to get up very far. I insist we try. They shrug and smile, and we start up the river. Almost immediately we strike a dry rapid. The boat must be ported upstream past it. We get out, the boat is dragged. We climb back in, scrape along the rocky bottom. Manage another 100 yards until the next dry rapid. Again we get out and carry the boat. We do this 3 more times until I suggest there is no point in continuing. The river is too low. They shrug and smile, and we head back. Nobody says anything. On the way back, I find myself newly interested in the tiger tracks and want to stop to inspect them. But the wake of our passing boat has washed the shore clean. The tracks are gone. That night, after dinner, I am walking back in the darkness toward my cottage with Dennis. He shines his light around the woods and says, "Mat is here." Mat? A pair of gleaming eyes, a heavy dark shape on the ground. Yes, and one of her children. I see a second pair of eyes. Dennis sets out and I follow. Pretty soon I see that Mat is a pregnant deer, sitting calmly on the ground. As we approach, Mat stands. She is 6 feet high and beautiful, and she remains calm even when we come close. Dennis explains that Mat is the Malay word for Friday, which is the day, many years ago, that this deer wandered out of the jungle and into the settlement. The villagers fed her, she stayed, and when she had offspring, some of them came into the settlement too. "Mat is why they don't have goats here," Dennis said. "In every village the Malay people like to raise goats and eat them, but once Mat arrived here, they found she did not like the goats and would kick them to death." So what did the villagers do? They didn't keep goats anymore. But if they are so fond of goats, I know, but Mat came, so they didn't have goats anymore. In the end, the story of Mat and the villagers came to symbolize the trip for me. The village people had encountered a deer, and the deer stayed, and so they didn't eat their favorite food anymore, that's all. I could think of a dozen alternatives. I would have built an enclosure for goats. I would have tried to train Mat to tolerate goats. I would have raised goats at a nearby village and brought them here at the last minute. I would have gotten a freezer and kept frozen goat meat. Maybe I would have discouraged Mat from coming any more. In short, where I would have struggled, the villagers simply accepted the situation and went on with their lives. I began to realize how many times the trip had repeated that lesson for me. The bees. I didn't like them, but I had to tolerate them. There was nothing I could do. The low water on the river. I wanted to go upstream, but there was nothing I could do. The absent animals. I didn't like not seeing them, but there was nothing I could do. I couldn't make it rain, I couldn't fill up the rivers, or stop the jungle from flowering, or make wild animals appear. These things were beyond my control, and I was forced to accept that, just as I was forced to accept the couple that wouldn't stop talking. In fact, I began to realize that, although they couldn't stop talking, I had a much greater problem. I couldn't stop trying to control everything around me, including the couple. I couldn't leave things alone. I was an urban, technological man accustomed to making things happen. I had been taught countless times that you were supposed to make things happen, that anything less implied shameful passivity. I lived all my life in cities, struggling shoulder to shoulder with other struggling people. We all were struggling to make something happen, a marriage, a job, a raise, an acceptance, a child, a new car, new life, new status, the next thing. I'd lived in that frantic, active way for more than 30 years, and when I finally began to crack, when I tried to control everything about my life and my work and the people around me, I somehow ended up in the Malaysian jungle and experienced a solid week of events over which I had absolutely no control, and never would. Events that reminded me that I had my limits, rather severe limits in the greater scheme of things, and I had no business trying to control as much as I did, even if I could. When I went home, I noticed I felt much better. Not rested, the way a certain kind of vacation rests you, but literally better. I couldn't figure out why for a long time. Back in Los Angeles, nobody even knew where Malaysia was, and people asked why I had gone there. I kept telling them about the deer named Mott and how the villagers stopped eating goat. This wasn't a very dramatic story, nobody responded to it, and I wondered why I kept repeating it. What is it about that deer and the villagers? I wondered. And then one day I got it. 10 years after my trip to Pahang, I wrote these notes in Los Angeles. Then I changed clothes and went to an exercise class. In class, I noticed I had put on the same blue T-shirt that I had worn in the jungle a decade before, when the bees had covered me. I had always been fond of this T-shirt, now much faded. It was one of the oldest articles of clothing I owned. When I got home, I threw it out. Enough is enough. One way I control myself is to hang on to things too long. My past is too present in my life. So I threw the T-shirt out. It seemed a step in the right direction. An Elephant Attacks. In 1975, Lauren and I were staying at the Craig Farm, a 60-square-mile preserve in northern Kenya. She and I had met the year before, and we were now in the middle of a passionate romance. A trip to Africa seemed a fine idea. We had gone to the Craig Farm because I wanted to walk among the animals, which is illegal in the government game preserves. I'd studied anthropology in college, and after so many years of academic work, I hoped to have first-hand experience, however brief, of what it must have been like to be a primitive hunter on the African savanna. I imagined myself stalking wild beasts, getting dangerously close to them until I could see the muscles quiver beneath the skin and could observe their behavior intimately. Then, at some unknown signal, perhaps my own error, the snap of a dry twig, skittish heads would jerk up in alarm, they would look around in fright, and they would thunder away. Well, it wasn't like that at all. The animals saw me from a quarter of a mile away, and calmly moved off. If I stalked them, they moved a little farther. I was never able to get within a quarter mile from them. I was never able to see them worried, let alone alarmed. Their heads never jerked up. Instead, they would glance over from time to time in a bored way, notice my pathetic stalking, and move off. William Craig, who walked with me, explained that each animal maintained a characteristic distance from man. It was a kind of invisible perimeter. If you came within it, the animal simply moved until the distance was re-established. For most animals, it was a fraction of a mile. We spent the day hiking on open plains among zebras and giraffes and antelopes. With the snowy peak of Mount Kenya rising in the background, it was quite exciting, but frustrating too. Clearly, to sneak up on a giraffe, as I had seen pygmies do in movies, was far more difficult than I had imagined. Giraffes were not as dumb as they looked. They had excellent eyesight, and they tended to cluster with zebras, animals that had an excellent sense of smell. I began to realize that stalking animals was a skill rather like pole vaulting. It looked easy when others did it, but if you tried it yourself, you were in for a surprise. Nothing turned out the way I expected it to be that day. I found that zebras gallop like horses but bark like dogs. That bark is their characteristic sound. And we didn't see a great variety of game. No elephants or lions or really exciting animals. And all the animals seemed maddeningly indifferent to my presence. I didn't frighten them. I bored them. Actually, it was a little insulting. I took everything that happened that day personally, and the animals in their natural setting seemed so impersonal, so fundamentally uninterested in me. It was in this frame of mind that I returned to Lamu Downs camp in the evening to spend my first night under the African stars. I had never camped before, except one night at the age of 11 in the Nassau County Boy Scout camp on Long Island. That was a far cry from Africa. The Craigs showed Lorne and me how everything was set up, the camp beds, the hissing gas lanterns, the open-air shower attached to the back of the tent, and so forth. It was all quite luxurious. I felt very comfortable. Then we had dinner in the mess tent, and the Craigs talked about their ranch and the animals found there. They were concerned because, although this was the dry season, the drought had gone on for a long time, and the elephants had disappeared. They usually had quite a few elephants on the ranch, they said, but the elephants hadn't been seen for weeks now. We talked and ate as darkness fell. When dinner was finished, Lorne and I headed back toward our tent. It was now very dark. I found that a few more questions had occurred to me. One was about wild animals. The same wild animals I had been unable to approach during the day might, I suspected, come and visit me in the night. The Craigs laughed. No, no, they said, animals never entered the campground at night. Of course, there was the time they woke up in the morning and found a big rhino asleep in the embers of the fire from the night before, but that was unusual. How unusual? I wanted to know. I hadn't yet noticed the easy way these people simultaneously gave reassurance and took it away. Very unusual, they said. You were almost never bothered by animals. Of course, you had the occasional monkey screeching in the trees, keeping you awake, that sort of thing, but not animals on the ground, no. By now my concerns had shifted. The fabric of my tent looked flimsy as I imagined a sleeping rhino just outside. Would an animal ever enter the tent? Oh, no, they said. Of course, there was the time that leopard clawed right through the tent fabric, scaring the hell out of the lady inside. She woke up shrieking, frightened the cat off. But there had been something peculiar about that incident. They couldn't remember what, exactly. People had food in the tent, or the woman was having her period. Anyway, something peculiar. It wasn't as if a leopard would just come up and claw your tent for no reason. Really? I asked. Really, the Craigs said, wearying of their own game. Really, there aren't animals around the camp at night. Animals don't like to be around people, and they won't come near. Anyway, see these lanterns? They pointed to 3 hurricane lanterns spaced around the tents. The lanterns were lit all night, they explained, and the light kept the animals away. Count on it. Never any animals around the tents. Now, you see the stream over there? Sometimes you find the odd animal on the far side of the stream, but never over on this side, where the tents and the lanterns and the people were. Have a good sleep, they said cheerfully, and said good night. Lauren and I zipped up our tent and went to bed. Lauren had camped a lot in her childhood and was relaxed about sleeping in the woods in a tent. I, on the other hand, was far too nervous to sleep. I read for a while, hoping to become sleepy. I remained wide awake, listening for sounds outside. There weren't any sounds outside. It was completely quiet. A cicada, a gust of wind blowing lightly through the acacia trees. Otherwise, silence. On the cot across the tent, Lauren rolled away from the light. I watched her shoulder rise and fall rhythmically. I thought, she can't really be going to sleep just like that. "Hey," I whispered, "are you going to sleep? It's night, isn't it? Are you tired? Just go to sleep, Michael." "I'm not tired," I whispered. "Just close your eyes and pretend you are." I heard something outside, a sound of some kind. "Hey, did you hear that?" "It's nothing. I'm going to sleep, Michael." Pretty soon Lauren was snoring. I envied her effortless drift to unconsciousness. I, on the other hand, had to urinate. I ignored the urge. There was no way I was going outside the tent at night. Anyway, the latrine tent was all the way across the camp. As time went on, I found I couldn't ignore the urge. I was going to have to do something. I looked under the bed to see if there was a chamber pot. These people were British, you never knew. No chamber pot. I inspected the zippered flaps to see if there was any way I could do it without leaving the tent. There wasn't any way. By now I had a voice saying, "Oh, for God's sake, Michael, pull yourself together. What are you afraid of? The dark? What do you think is out there? You're being ridiculous. It's a good thing Lauren is asleep, or she would really lose respect for you, a grown man afraid to go out of his tent at night to pee." And another voice was saying, "Look, you don't have to go far, just about 3 feet outside, and you can do it right there. And think how much better you'll feel afterward." Because by now the urge was intense. So I pulled on my sneakers, unzipped the tent, held my breath, and stuck my head out. The night was pitch black. The lanterns they had promised to keep on all night had gone out, and it wasn't even midnight. I felt like a cartoon character with my head sticking out of the tent, neck muscles straining with tension, waiting, listening, looking. At nothing. There was nothing out there. No sounds, no animals, no nothing. My eyes became accustomed to the darkness, and I still saw nothing at all. I realized I had been holding my breath. I leapt out, moved just beyond the tent ropes, relieved myself, dashed back inside, and zipped up the flap behind me. Safe. I looked around the tent. Lauren was sleeping, breathing softly. It amazed me that she could do this. She was sleeping as easily as if she were in a nice, secure hotel room somewhere. I envied her, but on the other hand, it was important for somebody to stay alert out here in the bush. I turned out the light and lay on my back, wide awake, listening to the sounds. There still were none. It was absolutely quiet, and it was almost midnight. Despite myself, I was beginning to feel drowsy, when suddenly I heard a distinct, dry crack. It was the sound of a branch breaking underfoot. Then I heard a crashing sound, something large moving through dry brush. It sounded to me like an elephant, very near. Lauren still slept peacefully. I listened some more. There was silence for a while, and then I heard the crashing again. The crashing sound had a lazy rhythm, exactly like an elephant moving. Anyway, whatever it was damn big and damn close. I listened a while longer, and when I couldn't stand it any more, I whispered, "Hey, are you asleep?" She said sleepily, rolling onto her back. "Hey," I said, "listen, there's something out there." She was instantly awake, sitting up on one elbow in alarm. "Where?" "Out there, outside. Something big. It sounds like an elephant." She collapsed back on the bed. Michael, you heard what they said. They haven't seen any elephants for weeks." "Well, listen." We listened together for a long time. "I don't hear anything." She sounded annoyed. "Why are we whispering?" she said, now speaking in a normal voice. "I swear to you," I said in a normal voice, "I heard something." Just then the crashing sound came again, very distinct and loud. Lauren sat bolt upright, whispered, "What do you think it is?" I whispered, "An elephant." "Have you seen it?" "No." Actually, trying to see the source of the sounds had not occurred to me before. "I don't think we can. The lanterns have all blown out. It's pitch black out there." "Use the flashlight." We had a powerful flashlight in the tent. "Okay, where is it?" "Right by the bed." "Okay." More crashing sounds. Unless my ears were playing tricks on me, the source of those sounds was now very close, only a few feet away. I crept up to the zipper with the flashlight. I opened a little air ventilation flap that was covered with mesh mosquito netting and shone the light out, but the light reflected off the netting. I could see nothing. "What do you see?" "Nothing." "You have to open the zipper." "Not a chance." "What, are you afraid?" "Yes." "Okay," she sighed. "I'll do it." She got out of bed, took the flashlight, and crawled to the front flap. She unzipped the tent from the bottom about 6 inches. More crashing outside. "Sounds close," she whispered, hesitating. I waited. She unzipped it 6 more inches and shone the light outside for a few seconds, then zipped the tent shut and clicked the light off. "Well?" I asked. "I didn't see anything. I don't think there's anything out there." "Then what's making the noise?" The crashing noise, the branches cracking, still continued, still close. "I don't think it's anything," Lauren said. "It's the wind." "It's not the wind," I said. "Okay, then you look." I took the flashlight. I approached the zipper. I listened again to the intermittent crashing sounds. "What do you think it is?" she said, listening. "I think it's an elephant," I said. "But you heard what they said. It can't be an elephant. It must be something else, a big bird in the trees or something." I unzipped the tent a full 3 feet and shone the light out. The round beam shot into blackness. I swung it around. I saw the branches of trees. Then I saw some kind of round brown shape in the beam, with furry things hanging down in front of the round thing. I couldn't make it out at first. Then I realized I was looking at an enormous eye. The furry things were eyelashes. The elephant was so close his eye filled the flashlight beam. He was just 10 feet away from me. He was huge. He was eating brush and grasses. "It's a goddamn elephant," I whispered, snapping off the beam. I felt strangely calm. "You're kidding," she whispered. "An elephant? You saw it?" "Yes." "Why'd you turn off the light?" "I don't want to upset him." I was thinking the elephant might not like having a light shone in his eye. I didn't want him angry or confused and trampling the tent. I didn't know anything about elephant emotions, but this one seemed calm right now, and there was no point in changing that. Lauren jumped out of bed and took the flashlight. "Let me see. Where is he?" "Don't worry, you can't miss him." She shone the light out the tent. Her body went rigid. "He's right here." "I told you." I couldn't help it. I had been right all along. There had been an elephant. "But what about how they never crossed the river and all that?" "I don't know, but I know there's a huge elephant right outside our tent." "What are we going to do?" I don't know. You think he'll hurt us? I don't think he'll hurt us. Lauren had a habit of raising a question and resolving it for herself without waiting for assistance or disagreement. I have no idea what he'll do. Should we try to get away? I don't think so, I said. I don't think we should leave the tent. Maybe out the back where the shower is? I don't think so. We could shout for help. The other tents are just across the way. Shouting might upset him, I said. Anyway, what would we say? We'd say there's an elephant outside our tent. And what would they do? I don't know, but they must know what to do when there's an elephant outside the tourist's tent. I think shouting could make him nervous. Maybe we can scare him away. He's a lot bigger than we are. Then what can we do? She asked. All the time we were discussing plans, the elephant was peacefully crashing around in the underbrush outside the tent, eating and moving around in his slow, ponderous way. The elephant didn't seem upset, and all our options for action seemed unworkable. I got into bed. What are you doing? She said. Going to bed. I was calm. Just like that? With a dangerous elephant right outside? There's nothing we can do about him, I said, so we might as well go to sleep. And I did. I fell asleep almost immediately, listening to the elephant crashing around in the brush outside. The next morning after breakfast, I said, By the way, I noticed an elephant outside my tent last night. Oh, no, they told me. That couldn't be. Elephants haven't been seen around for some time because of the drought, and anyway, animals never cross to this side of the river. Well, he was right outside my tent. There was an awkward silence. The tenderfoot explorer, however misinformed, is still paying the bills, and politeness must be maintained. Someone coughed, asked if I might have been mistaken. No, I said. It was an elephant, all right, a big one. Well, my courier, Mark Warwick, a brilliant 23-year-old naturalist, said, Let's have a look, shall we? We all went over and inspected the ground outside my tent. There were plenty of elephant droppings which are hard to miss, and there were circular footprints in the soft earth. Each print was the size of a large serving platter. What do you know? They said. There was an elephant here last night. Damn big one, too, someone else said. Came right up to the tent, too. Didn't give you any trouble, did he? Oh, no, I said. No trouble. Sleep all right and so forth? Oh, yes, slept fine, I said. Didn't bother me at all. And the truth was, I had slept well, when I finally stopped worrying. I was impressed with the instantaneous flip in my own emotional state, from a barely controlled hysteria to a detached calm once I saw the giant eye. How had that happened? For a long time I felt it was because I am a practical person who, faced with an elephant outside his tent, examined all the possibilities, to run away, to call for help, to scare the elephant off, and having rejected them all, sensibly decides to go to sleep. But later I realized that we are all like that. We all can work ourselves into a hysterical panic over possibilities that we won't look at. What if I have cancer? What if my job is at risk? What if my kids are on drugs? What if I'm getting bald? What if an elephant is outside my tent? What if I'm faced with some terrible thing that I don't know how to deal with? And that hysteria always goes away the instant we are willing to hear the answer, even if the answer is what we feared all along. Yes, you have cancer. Yes, your kids are on drugs. Yes, there is an elephant outside your tent. Now the question becomes, what are you going to do about it? Subsequent emotions may not be pleasant, but the hysteria stops. Hysteria accompanies an unwillingness to look at what is really going on. It promotes an unwillingness to look. We feel we are afraid to look, when actually it is not looking that makes us afraid. The minute we look, we cease being afraid. Knowing in advance what you are going to do about something is not so easy. I remember in 1968 I was getting ready to dive off a boat in the Virgin Islands, and some man was putting on all this equipment. I was interested because the man was a diving instructor, and instructors don't usually carry a lot of equipment. Finally, he strapped a knife on his calf. All my life I had seen divers strapping on knives, and I never understood why. I said, "Excuse me, but why do you carry a knife?" "Oh," he said, just in case." "Just in case what?" In case something happens." "Like what?" "Like you get your lines fouled and have to cut yourself free." "How would that happen?" "Oh, like in a wreck. Diving in a wreck, you get your lines fouled." "But there aren't any wrecks here." "I know, but a knife is still good to have. You see something nice, a piece of coral or whatever, you cut it free and bring it back." "This is a protected undersea park. You can't take anything." "I know, but there are other reasons, too." "Like what?" "Defense." "Defense against what?" "Whatever's down there, say sharks." This was a little knife with a 9-inch blade. I tried to imagine the undersea battle. "This knife would help you fight off a shark?" "Damn right." "You think it would cut the skin? Sharks have pretty tough skin." "Oh, yeah, sure, it would cut the skin." "So you figured you'd kill the shark with that knife?" "Pretty much, yeah." "Of course, to stab the shark, you'd have to be awfully close to it, wouldn't you? The shark would really have to be close." "Well, they do that, you know." "I know. But the thing is, when you first see the shark, instead of backing away to safety, you would have to move forward because you have to get close to attack the shark with your knife." "Oh, I wouldn't do that." "You wouldn't?" "Oh, no, I'd back away." "Sure. See, the knife is just in case he comes after me." "If he comes after you, then you'd try and stab him?" "Well, no, what I'd probably do is I'd hit him on the nose with the handle. Sharks have very sensitive noses. You pop them on the nose and they generally turn and run." "But why wouldn't you hit him on the nose with your movie camera?" I said, pointing to a big piece of equipment at his feet. "That'd be in your hands anyway, and it's a lot easier to hit a shark with a big movie camera than a little knife handle." "Yeah, that's probably what I'd do," he said. "So why are you carrying the knife?" "You never know," he said, and he plunged into the water. I couldn't argue with that. Later, when the dive was over and we were back in the boat, he unstrapped the knife he hadn't used and said, I was thinking about what you asked me, why I carry a knife. You know why?" "Why?" I said. "Because I just feel safer with it." I couldn't argue with that either. I just feel ready for anything when I have the knife strapped on. "Gee," I said, "every shark I've seen has seemed so big and powerful and fast. I don't think I would have felt any better to know I had a little knife with me." He looked up suddenly. "You've seen sharks?" he asked. Once on Bora Bora, I was diving with my brother. There were 2 other divers in the boat, a man and his 10-year-old son. Because the boy was so young, we were diving in the lagoon and not on the outer reef. The boy's father could talk about nothing but sharks. He kept saying, "Are there any sharks around here?" We kept saying, "Nothing dangerous, nothing to worry about." Actually, the lagoon was full of white-tip reef sharks. You saw them all the time. You saw them while you were snorkeling 20 feet from the hotel beach. And the man was saying, "Now don't worry, son, about any sharks." The man was nervous, speaking rapidly, his hands shaking. Meanwhile, the kid wasn't worried about sharks at all. He was just going diving. They plunged into the water first. My brother said, "I hope that guy's going to be okay," because the guy was almost certainly going to see sharks down there. We dropped over the side and went our own way, exploring the coral heads. A little while later, we saw the man take his son to the surface. The kid had run out of air. Then the man came back down and poked among the coral, taking photos with his Nikonos and flash. Pretty soon, a white tip came cruising by. I held my breath, waiting for the guy to freak out. But the guy didn't see it at all. He was busy with his pictures. Other sharks appeared. Sharks passed to his left, sharks passed to his right. Sharks glided over him, sharks slipped beneath him. He must have had a dozen encounters with sharks in the space of 10 minutes. Back on the boat, he said, "Beautiful dive, wasn't it?" "Beautiful," we agreed. "Thank God I didn't see any sharks," he said. "I don't know what I would have done if I had." Kilimanjaro. "The odds are 7-1 against," the courier said. "Against what?" I said. "Against your making it to the top of Kilimanjaro. I polled the men, and they are 7-1 you'll never make it." It was late afternoon in my camp in Ngorongoro Crater in Tanzania. I was approaching the end of a 2-week safari in Africa with my courier, Mark Warwick. Next, I was scheduled to climb Kilimanjaro. I hadn't really thought much about Kilimanjaro until now. Curious, I said to Mark, "How did you vote?" "I voted no." "You don't think I'll make it either?" "No." "Have you climbed Kilimanjaro?" He shook his head. "I'm not that crazy. I've heard the stories from the people who came back." "I heard it was pretty easy," I said. "Just a walk to the top." "Well, a lot of people don't finish the walk," he said. "Don't kid yourself. It's bloody difficult trekking above 18,000 feet. That wasn't how it had seemed months before, when I had read the African guidebooks, planning my trip. The books merely said that the famous Mount Kilimanjaro was an extinct equatorial volcano with a broad sloping cinder cone, which meant that, although it was the highest mountain in Africa, you simply walked to the top, with no need for technical gear or specialized mountaineering knowledge. Since Kilimanjaro was on the equator, the weather was milder than comparably high mountains elsewhere. The climb was routine. Thousands of people did it every year. The standard ascent took 5 days and was easily arranged by any travel agency. It sounded like fun. Sitting on the floor of my house in Los Angeles with guidebooks opened all around me, I had said to Lauren, "Hey, look at this. We can climb Kilimanjaro. Want to do it?" "Sure," she said. "Why not?" So I had called my travel agent and said I wanted to climb Kilimanjaro, and the agent said no problem. She'd set it up to follow the safari. We should remember to pack boots and a parka, and that was that. I had never done any climbing, but I owned a pair of hiking boots I'd gotten to shoot a movie a few years back. I'd worn the boots for a week in the desert, and I remembered them as fitting okay. Not great, but okay. I had an old parka from my Boston days. I packed a sweater and an extra pair of jeans. The travel agent said everything else would be provided. If it was just walking, I figured I could do it. I played tennis once a week or so, and I didn't get too tired. But just to be safe, I cut back on my cigarettes and beer during the final 2 days of the safari. Just to be safe. But now, here was my courier, my guide and leader, the white hunter who had taken Lauren and me around Africa for 2 weeks, telling me in the pleasant African twilight, as the air cooled and the sun set, and a line of wildebeest moved in stately procession across the floor of Ngorongoro Crater, here he was telling me that he and the men who ran the camp had concluded I'd never make it to the top of Kilimanjaro. I just looked at him oddly, as if he were misinformed. "I don't think it'll be a problem," I said. "You ever been at altitude before?" "Sure," I said, thinking back. When I was a kid, I'd been on glaciers in Canada. I had visited some relatives in Boulder, Colorado. Sure, I'd been at altitude. I didn't think it was such a big deal. 18,000 feet's pretty high, Mark said, shaking his head. That kind of altitude changes everything. Uh-huh, I said vaguely. I continued to feel that he was misinformed, or at any rate that there was something he didn't understand. Mark mistook my vagueness for concern. "Look here, don't worry about it," he said, laughing and slapping me on the shoulder. "I was just joking." "You weren't." "I promise you I was." What do you want to bet I make it? Look here, Michael, he said. It was just a joke. You're taking this entirely too seriously. I persisted. I'll bet you a dinner when I get back to Nairobi, I said, and named a French restaurant that he had mentioned as expensive and good. Mark agreed to the bet. Right, he said. Now, how will we verify that you actually get to the top? Do you think I'd lie? He raised his hands. I'm just asking how I'll know. A bet's a bet. How'll you prove it? Well, there'll be pictures, I said. I'll have pictures. They won't be developed yet. I'll develop them in Nairobi for you. It turned out that you couldn't get color processing done in Nairobi. The film was all sent to England and took weeks. I'll get a statement from the guide or whoever. Could be forged. Well, Lauren will tell you whether I made it or not. That's true, he said, nodding. She'll tell me whether you got up there. So we agreed that once back in Nairobi, if Lauren said I had climbed Kilimanjaro, he would buy the dinner. Then a thought occurred to me. What if Lauren doesn't make it? Mark shook his head. The boys are 6-2 that she'll make it to the top. We're not worried about her. We're worried about you. Great, I said. The Marengo Hotel stood at the foot of the mountain. It was run by a charming, elderly German woman. The hotel had once been a farm. It was Spartan and efficient, and seemed to exist only as a staging place for tourists to climb the mountain. I was told there were several such hotels in the area. Lauren took a bath, remarking on how plentiful the hot water was. Yeah, I said. I guess they have to have it. When people come down off the mountain, they must want hot water and no fooling. While she took her bath, I walked out into the garden behind the hotel. It was early evening. Although we had been driving near Kilimanjaro for the last 2 days, I still hadn't seen the mountain because of haze. I could not see it now, but among the roses in the garden there was a little shellacked photo on a wooden pedestal showing the mountain and the route up. So I suspected, as I looked at the photo, that Kilimanjaro was probably directly in front of me. I went back into my hotel room and mentioned to Lauren that I felt a certain frustration about not being able to see the mountain I would be climbing tomorrow. Lauren didn't seem to mind. It didn't matter to her, this abstract quality of the whole adventure. That night in the dining room with its dark polished floors, there was only one other party, a family of Americans at a nearby table, a husband and wife and their teenage son. They didn't say much and had a dazed look on their faces, but their movements, even the way they spooned their soup, conveyed an unusual economy of gesture. They were people who had been through something. I was sure they had come down from the mountain. Well, Lauren said, why don't you ask them how it was? On the eve of our departure, the question was much on our minds. We felt a little giddy with anticipation. Our giddiness didn't seem to accord with the flat, dull quality of the returning American family. I waited until they were leaving and walking past our table to ask them if they had climbed the mountain. Yes, they said. They had just come down that afternoon. You all made it to the top? Lauren asked. Yes, they all made it to the top. Anybody in your group not make it? They weren't sure, but they had heard about a group of English students from another hotel who had been climbing at the same time. Several of the English students had not made it and had turned back. Some of them had gotten sick from the altitude. As they spoke, the dull look never left their eyes. I couldn't tell if they were tired or disappointed, or if something odd had happened that they weren't talking about. Well, I said brightly, how was it, the climb? They paused. Nobody seemed to want to answer this question. They looked at one another. Finally, the wife said, It was good. It was a good climb. Hard? In some places. The 4th day was not easy. The rest of the time it was okay. I was disturbed by the flat intonation, the inward manner. We were curious about them, but they showed no curiosity about us at all. They didn't ask where we were from. They didn't ask if we were climbing. They didn't offer any tips or hints or reassurances. They just answered our questions, volunteering nothing, then let the conversation trail into silence, said good night, and left. Huh, Lauren said, watching them go. What are we letting ourselves in for? I asked. I think they were just tired, she said. I slept uneasily and woke shortly after dawn. I went out into the chilly garden. The atmospheric haze had thinned, and for the first time I saw, hanging suspended above the roses, the broad white sloping cone of Kilimanjaro. Its profile was so wide, I felt disappointed. I had imagined a view more like the dramatic cone of Fuji than the bland arc of snow now before me. I almost didn't take a photograph, it looked so unspectacular. On the other hand, Kilimanjaro looked safe, matronly, more like a breast than a mountain, and that encouraged me. How bad could it really be? The German woman gave the orientation lecture. We were surprised to find we were not the only people climbing. There were 6 others. We were instructed to divide ourselves into groups of 4, since 4 people shared each overnight hut. Lauren and I joined a California lawyer named Paul Myers and a Swiss surgeon named Jan Neumeyer. Both were experienced climbers, and both were a decade older than I. I felt I would be able to keep up with them. Lauren was not worried. She was only 22 and in good shape. The German woman had charts and photos and maps. She had given this lecture countless times before, and she did it smoothly and well. Today, the first day, we would hike through rainforest to 9,000 feet. The second day, we would hike in meadowlands to 12,000 feet. The third day, we would cross the high, cold, wind-swept saddle between the 2 peaks of Kilimanjaro and spend the night in a tin hut at 15,000 feet at the base of the cinder cone. At 2 the next morning, our guides would awaken us, and we would begin climbing in darkness to reach the summit in early morning, when the weather and the views were best. Everyone would reach the summit if we took our time. Not long ago, she said, a 60-year-old man had reached the summit, arriving a bit later than most, but reaching it without difficulty nevertheless. Remember, at the summit there was only half the oxygen as at sea level. The key thing at altitude, she told us, was to take your time. And she added, rather peculiarly, that we should not let the guides push us. They sometimes offered to push you, but we would not find pushing helpful. We were warned about the dangers of altitude sickness and told to turn back immediately if we developed a dry cough. From the summit we would descend to sleep in the huts at 12,000 feet. The following day we would return to the hotel. Altogether we would be gone 5 nights. Altogether we would walk 72 miles. The guides and porters were highly skilled. If we needed extra clothing, it would be brought to our rooms while we packed. She was sure we would have an enjoyable trip, and she wished us luck. The group starts from the hotel at a brisk pace. Little children from nearby villages walk with us, chatter in broken English, beg. The sun is shining. The warm morning carries an air of expectation, of adventure. I am terrifically excited. I have never done anything like this in my life, and I am sure it will be rewarding. In less than an hour, my enthusiasm is gone. The begging children have become reminders that we are not trailblazers, but more like commuters en route to a well-established tourist destination. I find their cuteness irritating, because it has been honed on my predecessors, and thus reminds me that thousands have gone before me. The atmospheric haze has closed in. We can no longer see the mountain that is our destination. We are walking up a dusty road through poor farming villages. The views are not attractive, and the day has turned from warm to hot. I am sweating profusely. My clothing chafes at waist and crotch and armpits. What's worse, I feel blisters on my feet, though I have not been walking for an hour. I stop by the side of the road, pull off my boots, and inspect my feet. Lauren tells me I should have worn 2 pairs of socks, a thin inner one and a heavy outer one. I dismiss this double-sock camping lore with a wave. My feet will be all right. I'll put Band-Aids on them in the evening. Paul walks by, mentions he has some moleskin if I need it. I say no thanks, wondering to myself what moleskin is. I've never heard of moleskin. I keep walking. We enter the rainforest on the lower slopes of Kilimanjaro. It is a beautiful and lush setting, gurgling streams and hanging moss on huge trees that arch overhead and block the sun. It is cooler here, and the trail follows a fresh stream. Monkeys chatter in the trees. I feel renewed enthusiasm. However, before long the humidity, the moisture trapped beneath the canopy of the trees, the dripping of water, like a constant rain, gets on my nerves. My clothes are now entirely soaked. I no longer appreciate the beauty, no longer enjoy the clear water tumbling over the smooth rocks, and my feet hurt more and more. It was a relief to enter the rainforest, and it is a relief to leave it in early afternoon, emerging into an open meadow of grass 6 feet high. However, by now I am very tired, astonishingly tired, and the path up the meadow is steep. I'm wondering how much farther I must go. There are no signposts to tell me how I am doing, how far before we reach the huts. Unable to plan, unable to pace myself, I find my fatigue feels extreme. Do I have an hour still to go? 2 hours? Then I see on a ridge above the high grass the brown geometric A-frames of the Mandara huts. They are very close. It is only 4 o'clock in the afternoon. I am not really so tired after all. We have afternoon tea. Paul and Jan have been here for an hour, so much faster was their pace. The Mandara huts are at 9,000 feet, so I have a chance to feel the altitude. It doesn't seem to make much difference. My spirits are good as I walk around the huts, looking around. The only problem is my feet. They hurt considerably, and when I remove my boots I find that I have large blisters on the heels and on the small toes of both feet. I put Band-Aids on them, eat an early dinner of bread and canned beef stew, and go to sleep. Paul says he never sleeps well at altitude. I sleep badly. I'm nervous about the coming day. The second day is strikingly different. On the first day the landscape was varied, from desert savanna to rainforest to mountain meadow, and there was never any wider view, never any orientation, any sense of where you were on the mountain. You were just climbing. On the second day, the landscape is unchanging alpine meadows. An hour from the huts, we suddenly see the peak of Kilimanjaro with perfect clarity, the sides of the volcano streaked with snow. I am excited. We stop for pictures. Here, in a field of low grass with open topography, I can see where I am, moving on the flank of an enormous, wide cone. But so wide is this volcano, and so gentle its slopes, that soon we cannot see the peak any more. It is somewhere ahead, hidden behind deceptively gentle ridges. Once again deprived of a view of my destination, I am discouraged, and ask the guides when we will be able to see Kilimanjaro. They invariably point to the ground beneath my feet and say, "This Kilimanjaro." When I make myself clear, they shrug. They don't seem to understand my anxiety about seeing the mountain when I am walking on it. Finally, our guide Julius says, "You see the top with snow tomorrow, all day tomorrow. Not today, but from tomorrow." I walk on. It is never really hot today, and walking is pleasant, the ground dark and spongy underfoot. Occasionally the trail is a knee-deep trench dug by all the feet that have passed before, and we are seeing more people on the trails too, apparently climbers from other hotels. All sorts of people, all sorts of ages. I am encouraged by the diversity. All in all, it is a pleasant day. My only concern is my feet, which are painful. Today I am wearing sneakers instead of boots, but the damage is already done. And I am often winded. I stop to rest every 15 or 20 minutes. Lauren never seems to tire, but I am 33, she is 22. Even so, as the day goes on, I notice she appreciates my frequent stops. In the absence of the peak, I am looking for the lobelia trees, which I have been told characteristically appear at the 11,000-foot level. I don't know what lobelia trees look like, and since we are above the tree line, every kind of odd plant receives my scrutiny. I ask the guides, "Lobelia? Lobelia?" and they just shake their heads. Finally, when we break for a late lunch, we find ourselves sitting next to a light green plant about 4 feet high, with puffy, bulbous leaves. Julius points it out as lobelia. At every break, the guides and porters sit and smoke cigarettes. I can't believe they are doing this. I am gasping and wheezing and stopping for breath every 15 minutes. The lobelias at 11,000 feet mean, I remind myself, that I am barely halfway up. I begin to wonder if I can make it to the top after all. During the rest of the day, I have nothing left to look for except the Haramba huts, where we will stay the night. When we reach them, I am extremely tired, and my feet are very painful. The location of the huts is spectacular. A-frames set on a ledge of black lava at 12,300 feet. Looking down on a bank of clouds, at sunset, the air is pink and purple. I feel I am walking around at an altitude normally reached only by airplanes. It is exhilarating. It's also making me lightheaded. Now that I'm just strolling around the camp and not pushing along the trail, I realize how severely the altitude affects me. I can't breathe comfortably, even sitting down. A term comes back from medical school. Resting dyspnea, shortness of breath while sitting down. I never appreciated how panicky it feels not to be able to catch your breath. I wonder about altitude sickness, which starts to be a problem at this height. Altitude sickness makes your lungs fill up with water. The cause is unknown, but if you have a dry cough or a headache, you must head back down at once, or you may die. I give an experimental cough. I don't have altitude sickness. My feet are my real concern. I am reluctant to take my sneakers off and see the extent of the damage. When I finally do, I find that the Band-Aids have shifted and done little to protect me. The blisters are larger than yesterday, and they have burst, exposing red, inflamed, exquisitely tender skin. It's sufficiently bad that I abandon my pride and ask Paul for help. He takes one look and calls Jan, who is, after all, a surgeon. Jan gets out his moleskin. Moleskin turns out to be a thin, padded cotton sheet with adhesive on one side, and cuts pieces to fit my blisters. We use all his moleskin fixing me up. He stands back and pronounces himself satisfied with the dressing. I thank him. "Yes," he says sadly, "but it is too bad." "Why?" "Well," he says, looking at my feet, "now you must go back." "No," I say. "I think," he says judiciously, "that you cannot go on with your feet this way. You must go down the mountain tomorrow." "No," I say, "I'll continue." I am surprised at the strength of my own conviction, sitting there with my feet bandaged and my breathing labored. But it doesn't really feel like conviction, it just feels like logic. I've already walked 2 days. If I go back, it will take 2 days, that's 4 days. Whereas if I push on an extra day, in a total of 5 days, I will have reached the summit and returned. I've gone too far to turn back, at least in my own mind. Jan leaves. Pretty soon Lauren comes over. "I talked to Jan. He's very worried about your feet." "Uh-huh." "Jan says you could get a bad infection. He says the dirt from the trail gets ground into your open skin and you could get a serious infection." I wonder where she is leading with this. "I've already talked to the guide," she says, "and it's no problem. They do it all the time. They'll send one porter back down with you, so you don't need to worry about getting lost. And don't worry about me. Paul and Jan will keep an eye on me, and I'll be fine." Her whole attitude is so casual. Climbing this mountain just doesn't mean that much to her. I wonder why it means so much to me. "I'm not going back," I say. Even as I say it, I realize I am being unrealistic. We are at 12,300 feet on the side of a mountain. I have very bad blisters. She's right. I should go back. "Your feet look so awful. Are you sure?" "I'm sure." "Okay," she says. "I guess you know what you're doing." "I do." "They say tomorrow is the worst day," she says. "That's fine. I'll be ready." We start early on the third day. The terrain turns abruptly vertical. For an hour we scramble hand over foot up lava ledges. The air becomes much colder. We start out in sweaters, but soon we are wearing parkas, then gloves, then hoods. After 2 hours we break out of the narrow lava ledges onto the saddle. It is an abrupt and startling view. At last I can see the geography. Mount Kilimanjaro is actually two major peaks. Kaibo is a broad cinder cone with snow on its southern flanks. A few miles to the east, an older volcanic peak, Mawenze, presents a different appearance. Jagged, harsh vertical lines and streaks of snow over crumbling, rocky pinnacles. Mawenze is about 16,900 feet high, and Kaibo 19,340 feet. The two peaks are separated by a distance of 7 miles, and between them lies a sloping desert plateau averaging about 13,000 feet in altitude called the Saddle. It is here that we have emerged, at the base of Mawenze, looking across the windswept saddle toward Kaibo, its blunt summit cloudless in early morning. The view is spectacular in a bleak way. For the first time on the trip, I appreciate my vulnerability in a hostile environment. I am standing on a desert plateau 2.5 miles high. There are no trees, no plants, no life at all, just red rocks and sand and freezing wind. Ahead of me at the base of Kaibo, I see a sparkling dot, the tin roof of tiny Kaibo hut, where we will spend the night before making the ascent in darkness up the cinder cone the following day. The clothing that was once too hot, that clung and chafed, is now flimsy as paper before the wind. I am chilled. I put on everything I am carrying in my day pack, and Lauren and I set out across the saddle. Even walking on flat terrain is difficult at this altitude, and Lauren calls for a rest, the first time on the trip she has done so. After midday, clouds appear around the peaks and cast swift-moving shadows on the desert floor. We are now on a gentle rise up to the hut at 15,500 feet. Distances are deceptive here. The hut looks only about an hour distant, but after an hour it still seems no closer. We walk slower and slower, and when we finally come up to Kaibo Hut to greet Paul and Jan, who have been here for a while, we feel as if we are moving in slow motion. Paradoxically, the thin air makes us behave as if we were underwater, in a dense medium. Paul and Jan have lost their usual good spirits. In fact, everyone is distinctly irritable as they trudge up to the hut. People complain about the wind, the bunks, the food, the weather. The general mood is grim. Paul says, "I've seen it before. It's the altitude makes you irritable, and of course everyone's wondering. Wondering? Whether they'll make it to the top." That's certainly what I am wondering. But Paul is an experienced climber who's been on several trekking expeditions in Nepal. "You're worried about it?" "Not really, but it crosses your mind. It has to." The accommodations at Kaibo Hut are reminiscent of a Siberian prison camp. Triple-decker bunks line all 4 tin walls. In the middle of the room, a central pit for eating. The wind winds through the cracks in the walls. Nobody removes any clothing indoors. We have dinner at 5 p.m., porridge and tea. Nobody can eat much. We are all thinking about the ascent. We must reach the top before 10 the next morning, because after that the weather is likely to sock in, closing off the views and making the summit dangerous. If we climb too slowly, we risk being turned back from the summit because of the weather. One of the guides tells us the plan. We will be awakened with tea, no coffee at these altitudes, at 2 a.m., and we will begin our ascent in darkness. 1 lantern for every 2 people. We will stay together so as not to get lost in the darkness. It is 6 hours from here to the summit. After 3 hours there is a cave where we can stop and rest, but otherwise there is no shelter until we reach the summit and come back down to Kaibo. It will be very cold. We should wear all the clothing we have. I'm already wearing all the clothing I have. I'm wearing long johns and 3 pairs of pants, 2 t-shirts, 2 shirts, a sweater, and a parka. I wear a wool balaclava on my head. I wear all these clothes to bed, removing only my boots before climbing into my sleeping bag. Everyone else wears their clothes to bed, too. We're in bed by 7 p.m., silent, listening to the wind whine. Sleep is impossible. Every time I begin to drift off, I snap awake, suddenly fearful, convinced I am suffocating, only to realize that it is simply the altitude. I am not the only one with this problem. Inside the darkened hut, I hear groans and curses in a half-dozen languages throughout the night. It is almost a relief when the guide shakes me and hands me a plastic cup filled with smoky hot tea and tells me to dress. All around me people are pulling on boots and gloves. Nobody speaks. The atmosphere is, if anything, even more grim than before. Paul stops by to wish us good luck on our ascent. He hopes we make it. I wonder if it's some sort of mountaineering tradition, this last-minute wishing of luck. After all, we've come so far, there's so little left, who would turn back now? Nobody in his right mind. After all, I think, how bad can it be? We take our lanterns and leave the tin hut, and climb the mountain in darkness. Very quickly, it becomes a nightmare. The lantern is useless. The wind blows it out. The darkness is total. I cannot see anything and continually stumble over rocks and small obstacles. I'm sure this would be painful if I could feel anything in my feet at all, but they are numb with cold. Even when I wiggle my toes in the boots, I feel nothing. As I stumble up the mountain, the numb cold creeps up my legs. First to the shins, then the knees, then the mid-thigh. The trail upward is steep and exhausting, but the cold is so penetrating we stop for only a few moments at a time, just enough to catch our breath in the blackness, and stumble on. I feel rather than see the presence of the guides, the porters, the other hikers. Occasionally I hear a grunt or a voice, but for the most part everyone trudges along silently. I hear only the wind and my own labored breathing. As I walk along, I have plenty of time to wonder whether I am getting frostbite in my numb feet. It's my own fault. I was completely unprepared for this trip. I didn't bring the right equipment, including the right boots. It was a serious oversight. I may be penalized now. Anyway, frostbite or not, I am having real trouble. I frankly don't think I'll be able to make it. I can go on for a while, but I doubt I can last much longer. Somewhere around me I hear Lauren. "Is that you?" "Yes," I say. "Can you feel your feet?" "I haven't been able to feel them for an hour," she says. There is a pause. "Listen, what are we doing here?" The question takes me by surprise. I don't really have an answer. "We're having an adventure," I say, and laugh cheerfully. She doesn't laugh back. "This is crazy," she said. "Climbing this mountain is crazy." Her words enter my consciousness directly. I have no doubt in my mind she is right. It is crazy to be doing this, yet I feel protective toward the decision to make the climb. As if it were a friend I don't want criticized. I am trudging onward in the darkness, tired, numb, gasping for air, freezing cold, a prisoner on a forced march. I put one foot in front of the other, one foot in front of the other. I try to set a rhythm, to keep moving forward in that rhythm. To consider whether or not this is crazy does not help my rhythm right now. I ignore her statement and concentrate on walking in my rhythm. How long I continue in this way, I am not sure. It is too much trouble to look at my watch, clumsily peeling away layers of clothing to expose a glowing green dial that is hard to read through chilled, tearing eyes. After a while, the time doesn't matter anymore. I just keep walking. The arrival at the cave at the halfway point is a surprise. The cave isn't warm, but it's out of the wind, and so seems warmer. We are all able to light our lanterns, so we have light. We can look at one another. People huddled together, talking quietly. I see the shock on many faces. I am not the only one who finds this climb a nightmare. Lauren sits next to me, whispers, "I hear the English couple is going back." "Oh?" "She's sick. She's throwing up from the altitude." "Oh." I don't know who she is talking about. I don't really care. "How do you feel?" she says. "Terrible." "How are your feet?" "Blocks of ice." A pause, and then she says, "Listen, let's go back." I am shocked. This woman, who has so much energy, is so much in control of her body, now wants to quit. She's had it. She wants to quit. "Listen," she says, "I'm not embarrassed to say we got to 17,000 feet and then quit. We're not in shape. 17,000 is damn good." I don't know what to say. She's right. I think it over. Lauren continues quickly, "It's insane to be doing this. There's no reason to be doing this. It's some kind of crazy proving of ourselves. For what? Who cares? Really, let's go back. We'll tell everyone we climbed it. Who will know? It won't matter. Nobody will ever know." All I can think is, I'll know. And I think a lot of other things about not being a quitter, and how I think that quitting is contagious, that once you start to quit, it spreads through your life. But that's sports talk, coaching talk. I'm not sure I believe it. What I believe is, I'll know. I feel trapped by an inner honesty I didn't know I had. "I want to keep going," I say. "Why?" she says. "Why is it so important to you to get to the top of some stupid mountain?" "I'm here now, I might as well do it," I say. It sounds evasive. The fact is, I have no better answer. I have put up with a lot of pain and a lot of anxiety to get this far, and now I am in a cave in pre-dawn darkness within a few hours of the summit, and there is no way I am going to quit now. "Michael, this is crazy," she says. The others are filing out of the cave, resuming their ascent. I get to my feet. "Just go one more hour," I say. "You can make it another hour. Then if you still want to go back, we will." I figure in another hour it will be dawn and everything will seem better to her and she will be encouraged to go on. I figure she'll never quit if she knows that I am continuing. And I am continuing. I surprise myself with my own strength and conviction. Dawn is a beautiful prismatic band that throws the jagged peak of Mawenze into relief. I tell myself I should pause for a moment to enjoy it. I can't. I tell myself I should pause and take a picture of it so I can enjoy the picture later. I can't even take a picture. I have lost the ability to do anything that some animal part of my brain judges to be non-essential energetic movement. It is not necessary to take a picture. I don't take one. A few thoughts enter my awareness anyway. I have never seen a sky so indigo black. It looks like the sky from space pictures. And I realize that it should, that I am now more than 3 miles above the surface of the earth, and the normal blue sky created by atmosphere and suspended dust is gone. The other thing is that the horizon is curved. There is no doubt about it. Sunrise is an arc that bends down at the sides. I can see with my own eyes that I am standing on a spherical planet. But the actual sensation is uncomfortable, as if I'm viewing the world through one of those curving wide-angle lenses. I look away. I put one foot in front of the other, one foot in front of the other. I lean on my walking stick and breathe and keep my rhythm. I wait for the air to warm. Eventually it does, a little. At least I can see where I'm walking. But when I look up, the summit seems far away. Most of the other climbers are farther along, and their bright jackets contrast with the beige scree of the volcano. Scree is a geological term for small cinders of volcanic origin. We are walking up, ankle-deep in scree. It is like walking on a vertical beach. You take 2 steps up and slide 1 step back. 2 steps up, 1 back. The destination never comes any nearer. 2 hours after sunrise is the worst time for me. I am utterly exhausted, and I am suddenly aware, looking at the climbers farther up the slopes, that they are walking like mountaineers in a National Geographic special, one of those movies where the intrepid climbers plod through the snow, head down with a dogged, deliberate rhythm. Step, breathe, breathe. Step, breathe, breathe. The hikers above me are moving like that, and so am I. I have become a character in a television special. I am totally out of my element. Lauren is right. I never expected it would be this hard. I'm not cut out for this. I'm not in shape for this. I'm not interested in doing this, now or ever again. Who cares about this climbing business anyway? 1 million people have already climbed Kilimanjaro. There's nothing special to it. There's no real accomplishment. It's no big deal. My guide, Julius, sees that I am fatigued. He offers to push me. I tell him no. He offers to push Lauren, and she agrees. And he stands behind her with his arms on her waist and pushes her up the slope. But it doesn't seem to me that he helps Lauren. It seems to me that you have to do this one alone. Pretty soon Lauren tells Julius to stop pushing her, and she continues by herself. She doesn't seem to be aware of me anymore, although we are only a few feet apart. She is lost in some private world of focused effort. I am trying to figure out what is going on inside my head. I have begun to understand that climbing at altitude is a mental process, an exercise in concentration and will. I notice that some thoughts sap my energy, but others allow me to continue for 5 or 10 minutes without stopping. I'm trying to figure out which thoughts work best. To my surprise, the mental pep talks, "You can do it, you're doing great, keep up the good work," don't help. They just provoke the counter-thought that I am kidding myself and will ultimately fail. Nor does focusing on my rhythm, my pace, counting my steps or my breathing, going for a kind of mindlessness. That just puts everything into mental neutrality, which is not bad, but not particularly good either. Equally surprising, to focus on my exhaustion is not deleterious. I can think, God, my legs ache. I don't think I can lift them another step, and it doesn't slow me down. It's the truth, and my legs don't feel worse just because I think the truth. In the end, what seems to work is to think of a nice, warm swimming pool in California, or the nice beer and curry dinner I will have when I get back to civilization, Hawaiian palm trees and surf, scuba diving, something far from my present surroundings, a pleasant fantasy or daydream. So I think about swimming pools and palm trees as I plod up the gritty scree. Around 8 a.m., Julius begins to show concern. Already people are coming down from the summit. I resent them deeply, and Julius wants to make sure we reach the top before any bad weather closes in. I ask him how far away the summit is. He says 45 minutes. He has been saying 45 minutes for the last 2 hours. In a way, it's not his fault. The higher slopes of Kilimanjaro provide a bizarrely undramatic perspective. It's like the view an ant would have on the outside of an overturned salad bowl. All you see is a curved surface that gets narrower as you approach the top, but otherwise looks pretty much the same all the time. It's very dramatic to be there, because your body can feel the steepness of the ascent, and it is dizzying to look up to climbers above you. But it doesn't look like much at all. Julius begins to urge us onward, bribing us with chocolate bars, threatening us with clouds. He needn't bother. We are going as fast as we possibly can, and finally, around 9 a.m., we arrive at Gilman's Point, marked by a small concrete plaque at 18,700 feet. Although the actual summit, Uhuru Point, is at 19,340 feet, most hikers stop at Gilman's Point and consider honor satisfied. I certainly do. I stand on the summit, pose for pictures, read the plaque, and look at the flags and mementos left by previous climbing groups. I stare indifferently at the views. I'm not elated, I'm not self-satisfied, I'm not anything. I'm just here at the summit. I have gotten here after all, and now I'm here. Lauren tells me I have gotten her to the top, and I tell her she did it herself. We take pictures of each other, and all the while I keep thinking one thing. I am here. I got here. I am at the summit of Kilimanjaro. Shrieking at the top of our lungs, we ski down the scree in our boots, sometimes falling, laughing, then sliding on the seat of our pants. It has taken us 7 hours to make the ascent from Kaibo Hut. We're back down in an hour. From Kaibo, we walk another 10 miles across the saddle. The threatened bad weather finally arrives, with intermittent snow and sleet. Finally, we reach Horombo Hut, where we spend the night. Altogether, we have walked 18 miles since 2 a.m. that morning. That night, at the hut, I inspect my feet. When I pull my boots off, my socks are stained red. I quickly pull the boots back on. My injuries don't matter now, anyway. Tomorrow night we will be back at the hotel. Lauren comes up with the small mirror, laughs, asks if I want to see how I look. I say sure. I've not seen myself in 4 days. I stare at a dirty face with a scraggly beard, red skin, bloodshot eyes. In the tiny mirror, it is the face of a stranger. Some local entrepreneur at Horombo Hut is selling Tusker beer for $5 a bottle, and he has plenty of takers. Paul and Jan have one, and so do I. I go almost immediately to sleep, around 5 p.m. The following day I discover that climbing down a mountain calls upon a whole other set of muscles. My legs are trembling before lunch. I also discover that while my heel blisters are rested by the descent, my toe blisters now hurt fiercely, so coming down is not easier on my feet. Although we retrace our route exactly, I am surprised by how different the views appear on the way back. In part, this is a standard trekker's discovery. Any route looks different going and coming. But in part, it is my own sense of having succeeded in climbing the mountain. I feel different. In the hotel, the bathwater turns opaque black. We each take 2 baths, trying to get clean. Sitting on the hotel bed, I peel off my socks and moleskin and finally take a good look at my feet. The blisters are open, exposing great patches of bleeding, raw, dirty skin around the heels up to the ankle bone. My feet are so bad I make Lauren take pictures of them, but they turn out like pictures in medical textbooks, and I later throw them away. For a couple of years afterward, the skin of my feet remained discolored, and if I was at the beach or had my shoes off, people would say, "What's the matter with your heels? They're funny colored." And then I would start to explain about climbing the mountain, and they would get an odd look in their eyes, and I would stop talking. Eventually, I never talked about climbing the mountain. What I learned was this: that I had defined myself as a person who didn't like heights or cold, a person who didn't like to be dirty, a person who didn't like physical exertion or discomfort. And here I had spent 5 days cold, dirty, and exhausted. I had lost 20 pounds, and I had had a wonderful experience. I realized then that I had defined myself too narrowly. The experience of climbing Kilimanjaro affected me so powerfully that for a long time afterward, if I caught myself saying, "I'm not a person who likes to do that activity, eat that food, listen to that music," I would automatically go out and do what I imagined I didn't like. Generally, I found I was wrong about myself. I liked what I thought I wouldn't like, and even if I didn't like the particular experience, I learned I liked having new experiences. Second, although I am tall, I had always secretly defined myself as a physically weak and somewhat sickly person. After climbing Kilimanjaro, I had to acknowledge that I was mentally and physically tough. I was forced to redefine myself. Climbing the mountain was the hardest thing I had ever done, physically, in my life, but I had done it. Of course, part of the reason it was hard was that I had approached it like a damned fool. I was not in shape and not prepared, and I refused to listen to anybody. Now it seems inconceivable to me that I had no inkling what was in store for me, no idea what exertion was implied by an 18,000-foot summit, no idea about proper conditioning and equipment. So much of my behavior looks to be deliberately unconscious, designed to give me a shocking, hard experience. It certainly was that. And it was an experience that I didn't fully appreciate for years afterward. But at the time, it just left me flat. After we had taken our baths and Lauren had photographed my heels for posterity, we got dressed and walked to the polished dining room. Paul and Jan were eating silently at one table, other climbers at others. We felt a camaraderie as we sat down to eat. We were very tired, far more tired than hungry, but we were also away in some special world reserved for exhausted athletes, a world in which triumph is muted, the gains countered by the costs. At another table, a family stared at us curiously. I knew they were going to climb tomorrow morning, and they wanted to know what it was like. I thought, what can I tell them? I can't tell them what it's really like. What would be the point of that? I found myself looking away, hoping they wouldn't ask. The father. "Did you climb the mountain?" "Uh-huh," I said. "You make it to the top, both of you?" "Uh-huh." A silence. "How is it up there?" "It's good," I said to them. "It's hard, but it's good. Some days are very hard, but it's good. Just do a day at a time. It's good." They stared at me. I knew that stare. They were trying to figure out why I was so flat. I didn't care. Tomorrow they would find out for themselves, and the climb would mean whatever it meant to them. When we walked back to our room after dinner, the sun was just fading. Kilimanjaro hung above the garden like a pale, reddish, disembodied ghost. Unearthly, unreal. Already unreal. The next day we flew to Nairobi. Pyramid of the Magician. Dawn appears as a yellow band over the Yucatan jungle horizon as I climb the steep Pyramid of the Magician and look out over the extensive Mayan ruins of Uxmal. It is an extraordinary sight to watch the rising sun illuminate the pale buildings of that ancient city. Guidebook in hand, I pick out the sights. Directly before me stands the white courtyard structure known as the Nunnery. To the west, the great tiered House of the Governor, which has been called the single most magnificent building ever erected in the Americas. Near it, the House of the Turtles and the House of the Pigeons, and beyond the humped green shapes of more ruins still to be uncovered in the surrounding jungle. At dawn, Uxmal is deserted. The tourists still sleep. An occasional parrot cries, but for the most part, the jungle landscape is silent. The city before me is serene, yet I feel anxious. Looking straight down the Pyramid of the Magician, with its nearly vertical incline of steps, is dizzying. But even more disorienting is the recognition of where you really are. For Uxmal is a great mystery. The pyramid on which I stand is an oval structure, 125 feet high. It is called either the Pyramid of the Magician or, sometimes, the Pyramid of the Dwarf, for reasons that are unclear. The nunnery and the house of the governor are names applied by convention. The ruins already bore those names when archaeologist John Lloyd Stephens stayed in them in 1841. The House of the Turtles is named for a row of turtles on its facade. The House of the Pigeons is so named because its roof suggests a dovecote. But no one knows what those buildings were really called, or what went on in them. No one has any idea at all. It is easy to become anxious atop the pyramid, for I am looking at extensive ruins that no one understands. Uxmal is a city 50 miles from the ocean, and 100 miles from Chichen Itza. Why was it built here? How does it relate to other Mayan cities? How many people lived in this great complex, which records date to AD 987? What was this city for? The night before, I had watched the Sound and Light show at Uxmal, similar to Sound and Light productions elsewhere in the world, only here the narration artfully concealed from the audience exactly how little was known. Uxmal was not a French chateau or an Egyptian pyramid. There was no clear chronology, no well-understood purpose. Rulers could not be named, their edicts could not be quoted, histories of construction could not be cited. Uxmal was an utterly mysterious ruin. Sitting there watching the colorful play of lights on the buildings, I felt a sort of conspiracy among the audience. A conspiracy not to acknowledge the depth of the ignorance. It was almost intolerable to look at this vast complex and to admit that we didn't know about it. We had to know. It was too large for us not to know. Uxmal is not a detail, not a footnote to history. It's a big, impressive city. How can we not know all about it? I watched the sun rise over the buildings. The jungle grew warm. An hour later, the first tourists begin to arrive, walking through the ruins, guidebooks in hand. They read confidently about the rules of the ball games that were played in the ball courts, and the meaning of various ceremonies and human sacrifices. They read the date of founding of Uxmal, and they read that its late classic architectural style is termed decadent. Sources of information are never cited. Visitors are not reminded that scholars cannot easily read the hieroglyphs the guidebooks so glibly summarize. Nor are they reminded that scholars do not know how this ancient temple-building civilization of the Mayas arose, why it flourished, or why it died. Such reminders would be unnerving. Nobody on vacation wants to walk through a great ruined city and be told, "We know nothing about this place." But the truth is, we don't know. The closer one looks at history, the less coherent it becomes. From a distance, from the chapter headings of a textbook, history looks very tidy indeed. But on closer inspection, it all breaks down. The Dark Ages weren't dark. It is hard to be sure what the Middle Ages stood in the middle of. The Renaissance is as much a birth as a rebirth. Anyway, these headings only apply to European history, a small fragment of world history. Things were different in other parts of the globe and in other cultural traditions. For the most part, the constructions we make of our own past are invisible to us. The interpretations themselves become real. Nowhere is this clearer than in the interpretations we place on the artifacts of prehistory and early history. When we look at ancient ruins, our beliefs are manufactured whole. At Knossos, on Crete, Arthur Evans found a ruin he called the Palace of King Minos. Tourists have dutifully tramped through it ever since. Yet there is no clear evidence that Knossos was a palace, or that King Minos, if he was a historical figure, had anything to do with its construction or its habitation. Similarly, the story of Heinrich Schliemann's discovery of Troy is endlessly retold, but Schliemann merely found a previously unknown city in Asia Minor. There is no evidence that Schliemann found Troy. There is no compelling evidence that Troy ever existed, except in the imagination of a poet. Schliemann went on to excavate at Mycenae, a known historical site in Greece. Schliemann decided he had found the grave of Agamemnon. There is no evidence that he did. He found a grave, and he called it Agamemnon's grave, but there is no evidence that Agamemnon was a real person either. The internal psychological pressure to make up a story, to explain the ruins before one's eyes, is powerful indeed. That was the shock that I felt atop the pyramid of the magician as I watched the morning sun spread across the face of the ancient city. Soon enough, I too clutched my guidebook and walked through the ruins of Uxmal, pretending that I understood far more than I did. My father's death. When I was in high school, my mother used to wait up for me until I came home from dates. This is, of course, a time-honored form of parental harassment of young people of dating age. If I asked why she stayed up, she said, "I was worried something might happen to you." There was no reasoning with her, no asking why she thought staying up would help in the unlikely event that something had happened to me. It was not polite to question a mother's love, or her logic. But I was bizarrely reminded of this on December 27, 1977, when, as I climbed back into the boat after a 90-foot deep dive on a paddle-wheel wreck called the Rhone in the British Virgin Islands, the dive master, Bert Kilbride, looked at me and said significantly, "Call home." "What is it?" I said. My first thought was that my house had burned down. That's what usually happened in California, and I had known Bert for many years. He'd tell me if he knew. "I don't know," Bert said. "The hotel just radioed to find out if you were on the boat. They said you had a call from home." That didn't sound like a fire. "Can I call from the boat?" "No, better wait until you get back." "Won't the radio phone let me connect through to the mainland?" "The radio phone isn't working so good. Better wait until you get back." That definitely didn't sound like a fire. I tried to think what it could be. It was 2 days after Christmas, and I was spending the holidays on Virgin Gorda in the British Virgin Islands. Most of my family was at my parents' home in Connecticut. When I got to the hotel, I called. My younger sister answered the phone. She said, "Oh, Michael, when are you coming back?" "What happened?" "Didn't they tell you?" "Nobody's told me anything." "Dad died." I started to feel very stupid. Slow and tired and stupid. Dad died? My father was 57. He was young. He was in good health. "In his office," my sister was saying. "He had a heart attack this morning. Kimmy and Dougie have gone to identify the body. When are you coming home?" I said I'd be home as soon as I could make connections. I would check the airlines. I'd try to be there tomorrow. I said I would call back. I got off the phone. Lauren said, "What happened?" "My father died." "Oh, Michael, I'm sorry." "Yeah," I said, looking around at the hotel, the palm trees. "You screwed up my vacation pretty good." Because I was suddenly angry, really angry with him for having done this thing, leaving me at such an inconvenient time. Lauren said she'd call the airlines for me. I sat at the bar. I didn't feel sad. I didn't feel anything. I just stared around the hotel at the people coming up from the beach and the bartender washing his glasses and setting out the bowls of nuts for the afternoon, and I felt annoyed. I wanted to stay here, and now I had to leave. And I thought, be careful. It's harder to feel grief when you're not on good terms. because my father and I had not had an easy time together. We had never been the classic boy and his dad, and it hadn't gotten better as we got older. It was no accident that I was down here in the Caribbean and not at home with my brother and sisters. As far as I was concerned, he was a first-rate son of a bitch. And now he was dead, and everything was up in the air. No more conversations, no more irritations, no more hopes for resolutions, just bang, dead. Haven't got anything more to say to you, Nico. The end. Except I had to go back to attend the son of a bitch's funeral and mess up my much-needed vacation. And all his goddamn friends were going to be there telling me what a great guy he was. Be careful. I was really angry. I woke up the next day very early, 4 in the morning, unable to sleep. I was still angry. I stayed angry on the flights home. I got to Connecticut late the next night in a state of fatigue and high irritation. I was really annoyed to have to be there. I wouldn't say that to the others in my family because they were all grieving. But I was just plain angry. I woke up the next morning at 4 too. I couldn't sleep. By now I was so tired it was hard to be angry. There was a terrible exhaustion about the house. People were calling continuously from all around the country. Everyone was being very nice. And there was a lot to do, a lot of details, flowers and food and so on, and relatives were flying into town. The situation seemed to have all the disadvantages of a huge party with none of the benefits. I decided I ought to keep busy and do the errands, especially since I was the only one who wasn't crying all the time. My brother had noticed that and had said to me, "Listen, I know you didn't like him, but he was still your father, you know. He was Dad. He did the best he could." "Yeah? Fuck him," I said. That pretty much summed up my feelings. My brother was understanding, which made it worse. But I said that somebody had to remember, in the midst of all these maudlin carryings-on, that the guy had had a really nasty streak in him. And not just with me. Dad couldn't have been my brother's favorite, not after some of the incidents I could remember. And what about the time he beat up my sister so badly the doctor was going to call the— "Yeah, well, whatever," my brother said, and walked away. He turned back. "Listen, Mike, he's dead now." I understood that my brother had always had a soft spot for everyone. My brother had a sweetness I'd never had. He had forgiveness in him. I didn't. It had been hammered out of me years before, as far as this particular subject was concerned. So I did the errands. It was okay. The only thing was I was so tired. I could hardly get around. When I pulled up at the florist, it was a huge effort to open the car door, to get out of the car, to close the car door, to walk inside, to remember what I had come for, to talk to the florist in normal declarative sentences, to answer when he asked me how I wanted to pay for this. It was like it was all happening underwater, or like I had a bad heart and couldn't get my breath. Slow, painfully, exhaustingly slow. After I did all the errands, I was really exhausted, and I found myself in the kitchen peeling vegetables with Kim, my older sister, and I said with annoyance, "Listen, I don't see why I have to be the one who does everything around here, why I have to be the one who holds himself together while you all collapse." "Nobody's asking you to," she said. When she said that, I realized she was right. I had imposed this role on myself. So I went to my room and cried. I cried with complicated feelings, because I was still angry, but I was also sad. I was sad for what had happened to my father and me, sad that nothing would ever be resolved, sad that he had lived his life as he had, with the unhappiness that he had felt and concealed. I was having all these feelings simultaneously on several levels. It was quite peculiar, but it was a distinct relief. I was still angry, but I wasn't so pent up, and I was able to accept things a little better. There were plenty of trials ahead, the arrival of the relatives, the viewing of the body tomorrow, and the funeral the day after. I took a sleeping pill, but I still woke at 4 in the morning, with the feeling that there was something I had to do, something I had to solve. Then I remembered. I couldn't do anything. He was dead. There was nothing to solve. I couldn't do anything to make it better for my mother or anyone else. The whole thing was out of my hands. There was nothing to do. It was strange to feel that. There was nothing to do. Just somehow get through it and get yourself back together and keep going. I was crying a lot now, whenever I felt like it, and that was very good. I thought, we have this wired into us, the way we have the ability to give birth. We already know how to grieve. We only screw it up when we get in the way of the natural process. So I thought I was doing the natural thing now. But I was not looking forward to that most awful of rituals, going to the funeral home and viewing the remains. Even making the arrangements seemed gruesome. I called the funeral home in the morning, and they said my father wasn't ready yet. They were having some problems, and they were a little behind schedule. They were sorry, but would 2:30 be all right? I said yes. My mother said, "What did they say?" I wondered what to tell her. A little late finishing up the body? They said they're very busy, and they won't be ready until 2:30. She nodded. "They're having trouble with his mouth," she said very matter-of-factly. Apparently my father had died in his chair with his mouth open, and rigor mortis had set in. She seemed so calm about it. At 2:30 everybody put on coats and grabbed Kleenexes and went to the funeral parlor. I was afraid to go. I'd never seen the dead body of anybody in my family, anybody I was really close to. I didn't know how I would feel. I would have preferred to stay home, but I was the elder son, and I had to accompany my mother, so I went. The funeral parlor was a Connecticut frame house. There was ice on the steps. You had to be careful going up. The sun was shining, but it was cold outside. My mother met her sister in the hallway, and we watched to see if they would be all right together. They were. We all went in to view the remains. Immediately as I walked into the room, I had the crazy and unexpected thought, "He's here. He's still alive." Meanwhile, my mother had run forward and flung her arms around my father's body, and was crying and talking to him and kissing him. I was embarrassed, as if I shouldn't be witnessing this scene between them. At one point she turned to me and said, "He's so cold." But she was really in her own world, her own way of handling things, and it was remarkable for its force and directness. She cried, she talked to him, she wiped her tears from his cheek. She was really dealing with it. I tried to figure out why I had thought he was still here. I checked again. Yes, I felt it. He's here. He's hanging around this room. He's confused. I knew that people had reported these impressions, but I was not one of those who believed that a soul stayed around a dead body, particularly following a sudden death. So where did the feeling come from? A sensation that the room was warm, a feeling that he was hovering near the ceiling, looking down on all of us, wondering why we were here. Or was it the projection of my own difficulty accepting that my father was really dead? Because certainly I was having trouble accepting it. I kept staring at his chest, waiting for him to take a breath. I was sure he was still alive. I knew he was in this room. I just couldn't figure out how I knew. Then I cried some more. Finally, my mother kissed my father goodbye, said she was done. On the way out, she told the undertaker that they had done a good job, that my father looked very nice. Then we all went outside. Tomorrow was the funeral. The next day, my mother announced that she wanted to view the remains a final time before the funeral. Nobody had much enthusiasm for this because the previous day's viewing had been very emotional. but I wanted to confirm my reaction of the previous day, so I said I would go with her. We went back to the viewing room. As soon as I entered the room, I wondered how I could ever have thought my father was here. He was gone. The room was cold and empty except for a body that once had belonged to my father. My mother looked at it, walked up to it, cried a little, looked at it some more. But she didn't hug it or kiss it. She just stood there for a while. Then we left and went to the funeral. My father was an important man, and he had many business friends who came to the funeral. The funeral was very impressive and a nice gesture to his memory. By now I was so confused about my feelings about his being present or absent that I sat in the church service and wondered, is he here? He wasn't there. The church service had very little meaning to me. I noticed that even though I was on an emotional fast track, being taken for a rough ride by my feelings, I was clear about what made sense and what did not. For example, visitors coming to the house made sense. You just seemed to keep going if you were forced to chat with people for a while. Small talk made sense. It was fine. Let's talk about basketball for a while, or what Jimmy is doing in school. And it wasn't necessary to say anything about how sorry they were about my father. People always say, I don't know what to say. There isn't anything to say. Just coming over to the house said everything. But visitors who cried a lot or who stayed longer than half an hour did not make sense. They were draining. And food being brought over made sense, but only if it was very easy to prepare, because anything more than heating a dish was an impossibly difficult job. Viewing the remains made sense. Telegrams and phone calls made sense even at late hours, since nobody was asleep anyway. But the religious service in the church didn't make much sense to me. The church itself seemed dead, full of old rituals and old ways of doing things that had been worn out centuries ago, and no longer provided comfort, at least not to me. My emotions were overwhelming. They demanded some genuine response, not this stately ceremony of artifice, the most recent components of which reached back to the 19th century. It was nobody's fault, it was just how it was for me. Mother was comforted, and important social functions were served by the church service. Afterward, we went out to the cemetery and had the burial service. It was a sunny day, a nice day, but cold. Everybody was tired. I looked at the tombstone and wondered if my father was here. By now I was looking for him everywhere. But he wasn't here in the cemetery. The tombstone seemed small. We got back in the cars and drove away. I asked my brother whether he had felt anything unusual in the viewing room that first day. Like what? Like Dad being there, hanging around the room. Oh, you felt that, huh? He said. Yes. Did you too? No, he said. I didn't. I was just sorry he was dead. The next day I went back to California. Ireland. I am the director of a film called The Great Train Robbery, loosely based on an actual train robbery that occurred in Victorian England. We are shooting in England and Ireland. The cast includes Sean Connery, Donald Sutherland, and Leslie Ann Down. A secret, lifelong desire is fulfilled. I am an international film director, shooting in foreign locations with big movie stars. What a thrill. Put on the safari jacket and hang the director's finder around your neck. But I am also secretly terrified. This is only my third movie, and I'm not really an experienced director. I've never shot in a foreign location. I've never made a period picture. I've never worked with a foreign crew, and although I've worked with good actors, I've never directed such big stars. To direct a movie, you must be authoritative, and I don't feel authoritative at all. On the contrary, I feel isolated and under intense pressure. I am alone in Dublin. Lauren is back in America finishing law school. There are only 3 Americans on the show: myself, the producer, John Foreman, and the stunt coordinator, Dick Zeicher. John is experienced in foreign filming, and I rely on his judgment, but in the end I am the director, and I must do the job myself. And I'm afraid. I've never known what to do with these fears of new undertakings. There doesn't seem to be anything to do but live through them, get past them. At least some of the terror of new undertakings is justified. At least some degree of anxiety will actually improve performance. But here in Dublin, I am not exerting my authority well. It just isn't working. John Foreman has told me the English film crews call the director Governor or Gov. Nobody calls me Gov. Nobody calls me Sir. They don't call me anything. Even though I am 35 years old, the crew thinks I am too young to know what I am doing. The company tries to second-guess me, to do things behind my back. I ask for something to be done a certain way, and they go off and do something else. We have lots of arguments. Then, too, there are many differences between British and American filming procedures. In America, the director plans shots with the cameraman. In England, with the camera operator. Scenes are numbered differently. Technical terminology is different. English crews take 4 food breaks in a day, but Americans break only for lunch. If you want to work overtime, the British crew has to meet and vote. Even the most basic signals seem to get crossed. In America, I am considered a laconic director, but the English find my energy level bizarrely high. My assistant director, who is openly critical of me to the point of insolence, finally asks if I am taking something. He means drugs, speed. I am astonished and ask him why he should think so. He says the whole crew thinks so because I do everything so fast. I assure him I am not on drugs. The first few days of shooting go badly. We have a split crew, half English and half Irish, and the 2 halves dislike one another, reflecting an ancient antagonism. Whenever something goes wrong, each side blames the other. Our progress is slow. Nobody listens to me. I set up the camera in a certain place, and the crew moves it. They always move it, even if it's just 6 inches. I move it back to where I want it. The weather is terrible. It seems we are always on a food break. We fall behind schedule. Each night I drag myself home to my Dublin hotel room. It looks like the anteroom to a tuberculosis sanatorium. The floors are uneven, the wallpaper stodgy Victorian. I'd like to call home, but there is a telephone strike, then a mail strike. I am entirely isolated. I ask John Foreman what to do. He says, "Talk with Jeff. Jeff likes you." Geoffrey Unsworth is the lighting cameraman. He's very courtly and distinguished. Everyone adores him. Each day, Jeff and I drive to the location together, so there's plenty of time to talk. Jeff seems to understand my difficulties, but it's not easy to discuss the matter frankly. He has his British reserve, and I feel awkward. How can I ask him why I'm not getting any respect? That's a Rodney Dangerfield line. So we talk about technical things, why we're not making more setups, how to get things to run more smoothly. Jeff keeps saying, "I'd like to see one of your films." I think he's just being polite. My last film, Coma, is still in release in America, and it will be difficult to have a print shipped to Ireland. Meanwhile, the problems continue. After a week or so, Jeff says, "You know, I think the crew would enjoy seeing one of your films." I tell him again of the difficulties of getting a print, but I managed to telex MGM in Los Angeles and order one. Our problems get worse. The situation is deteriorating. Sometimes there are shouting arguments between the Irish and English crew members. As a group, we have no cohesion, and I know it is because we have no leader. We are painfully slow. The work is good, but it is taking far too much time. The film is a negative pickup deal, which means that when the money runs out, we will have to shut down production whether we have completed the film or not. The pressures on me are enormous. Get more setups, finish more scenes, pick up the pace. But the pace never picks up. Jeff says, "I wish we could see one of your films." Finally, the print comes, and we run it for the crew on Friday night after work. Most of the crew attends. On Monday morning, I come to work ready to fight my usual uphill battle. I come onto the set, picking my way among the cables and light stands. One of the electricians smiles at me. "Morning, Gov," he says. What happened was that the crew decided Coma was a pretty good movie, and I must know what I am doing after all. Thanks to Jeff, from then on the atmosphere is entirely different and our progress much better. The crew stretches a white bedsheet in the middle of a field so the helicopter will know where to land. A crowd of local people line the fences around the field. They stare at the sheet, waiting for something to happen. Their attention turns the sheet into a work of art, a Christo. Wrapped Irish Farm Field, 1978. I would find it funny if we weren't behind schedule. It is 8 in the morning and bitterly cold. We are in a provincial train station outside Mullingar, Ireland, about to start a week of filming on top of a speeding train. Sean Connery has agreed to do his own stunts on top of the train. The little 1863 locomotive is hissing